some of the failures, but they keep on going and keep on trying, so they deserve to be here today. So we're glad to have them here. The goal of every pitch is to entice investment and mentorship. Judges may negotiate any offer they want. They can offer to support them in non-financial ways as well. They have been given access to each company's business plan and financials in advance of the event. Now, our judges today, you look at them, they're very nice people, but they are sharks. They are sharks. They are here. They are encouraged to scrutinize weaknesses, be skeptical, and to challenge the company today. In their pitches, each founder must present a compelling case that answers 3 basic questions. How will my startup make money? How will I make you money? And why is my startup awesome and why you should be on board with it? So those are the questions that they should try to answer. So again, thank you all for being here, and thank you for bringing Shark Tank Virginia alive. So are we ready to get started? Judges, are you ready? Okay. So our first category is healthcare, and let's welcome our judges. If you want to come up and introduce yourselves, I will hand you the mic.
Thank you. My name is Dr. Elaine Horn-Raney, and I'm the CEO and co-founder of Tympanogen. We're an ear, nose, and throat device company located in Richmond, Virginia, and we develop a gel patch for repairing perforations of the eardrum. We also conduct experiments aboard the International Space Station and are looking at some long-term space travel devices as well.
I'm Dr. Courtney Zedrin. I'm the Chief Medical Officer for a company called Care Team. We do direct-to-business, direct-to-employer primary care, so we avoid the insurance space. And we were successful in our last company venture in the medical scribe industry, selling to Scribe America after approximately 5 years, where I served as the Chief Medical Officer in that company as well.
Hi everyone, my name is Chris Girdwood. I manage the Prince William Science Accelerator in Manassas, Virginia. 9 wet labs, 9,126 square feet, where we have 10 startup companies. 1 successful Series A round, $9 million from Series Nanosciences. We've collectively, as an accelerator, brought in $26 million in non-dilutive federal funding, SBIR, STTR phase 1, phase 2s, but also we've raised about $15 million in venture and angel funding. So, been through the commercialization pathway with the companies and looking forward to meeting you all.
Thank you very much. So I think we're ready to get started. Our first startup, Euphoria Health. You have yours?
Okay, so being the PhD student and the co-founder of a startup are a lot of work. I really enjoy doing both, but my body does not. A while ago, I ended up visiting the doctor at VCU Health Center, and while I was lying down, I checked my Fitbit, and I found that, oh my God, I'm doing the extensive cardio, and I'm burning the calories around 200. Oh my God, it's shocking. So it turns out that I am stressed. So I talked with the doctor, and he suggested me to take a medication and talk with the therapist and also my family and my friends. So in Euphoria, we are here to help you to not go through these kind of steps. So in Euphoria, you can observe yourself, produce elation, and share happiness. Let me talk with you about the problem. So around 1.1 billion people in the world have a mental illness, and around 110 million people die as a direct result of stress. So it's a really big problem. But the main problem is that people don't know what causes the stress, and even worse, they don't know what can reduce their stress. But don't worry, in Euphoria, we are going to solve this problem. So in order to reduce the stress, we have to measure the stress. We focus on heart rate and heart rate variation. Then we need to predict the stress. For predicting the stress, we have two different methods. The first method is by using the time predictive algorithm. So, and the second method is based on the machine learning algorithm. So by the time predicting algorithm, we can figure it out in 1 second, in 3 seconds, 1 minute, and 1 day, what will be happen to your stress based on your heart rate and heart rate variation. And by machine learning algorithm, we can find a correlation between your stress and other data, such as your calendar, your location, and the use of your cell phone and your mobile device. After we could find and predict the stress, we are going to suggest some remedies to the people in order to reduce their stress. So this is a demo of our app. Okay, in here, you can go through the user account, you can see your stress level. So basically, we value the stress. So you can see your stress level, your heart rate, and your heart rate variation. Then you can see the alerts for tomorrow, for instance. So in tomorrow, we can predict what will be happen if you're doing that work. And then we are going to give you some suggestion and remedies. For instance, take a breath, or go for the walk, or call your mom. Or if you're reaching the really emergency situation, you need to call the emergency number or call someone. The other thing that you can find in our app is a stress map. So in our stress map, you can see the location and your feeling. So basically, if you are in the cable library, you got nervous because you have an exam and you're doing your work. But if you're going and spend time with your family, you will be loved and you feel happy. And the other thing that we have is the stress calendar. So if you have a meeting with your boss last week and you got nervous, this week we can predict that and give you some remedies. And say that, okay, so these are the stress management that you need to take. And the final thing that we really like is the heart-to-heart. So based on our customer discovery, people said that we really love to talk with the people. So self-expression is one of the best way to reduce the stress. So in our app, we create the anonymous chat system for people to talk and hear, and also send and receive the forms. This is really important. So in our chat, you can figure out, okay, so you want to talk with the therapist or with mother or with a specific range of people with a specific problem. So you can define that, or also if you like to help other people, you can hear to them and listen to what is their problem. Yeah, that's it. So let me talk about the sales and marketing. So in United States, more than 44 million people has a mental illness, and around 22% of female has a stress and anxiety. So if we could only target 10% of female in our market, we can charge them based on premium fee, and it will provide us the revenue around $48 million. So this is our first target market. The good thing with our app is that we can work with the giant smart device manufacturers. So based on our customer discovery, people say that we are unwilling to use the wearable devices because they can't find it useful. So based on our app, we can help them to to increase the usability of these wearable devices. This is a timeline of our work. So we started our idea from the hackathon. We got the 3rd place in hackathon competition for medical innovation. Then we go to the pre-accelerator program at VCU. We finish our horizontal prototyping, and right now we are in the vertical prototyping. So we have 4 customers. We purchased a Fitbit, and we have a customer, and we are trying to collect their data and predict the stress and figure it out if their algorithm is work correctly. We have the dashboard, and the dashboard and our website is on, so you can check that. And we hope that we could reach the beta phase on August 2019, and the final public launch will be at the end of December. And we are the team of scientists, PhD and PhD candidates, and we are collaborating with the great people. Thank you so much.
All right, judges.
this thing on? Okay. Thank you very much. That was very interesting app that you're developing. So my first question is, how are you? You mentioned that the action that one of the actions of your app is that you're connecting with a network of support for the user. So how do you create that network of support for that person?
A network of support for
Say, like,
which
you
part?
can talk to somebody, you can hear someone out, you can talk to a therapist. Like how do you? So right, you have that. How do you populate that with people?
Oh, okay. So if the people use our app, they can we can the channel of advertisement. We can share our app with other people, and also we would like to work with the hospital and other health center, because there are the people who wants to talk and hear with the other and help with the patient. So this is the first step, but most of the people who likes to use our app, they can also go and register for that part. So this is based on the marketing and advertising that we are going to increase the number of users in the anonymous chat system.
So the user of the app, they need to connect with someone who also has the app.
Yes.
You mentioned that you have an algorithm to detect stress. Can you
Yes.
tell me what's proprietary about that algorithm and how you derived it? It doesn't have to be in terms of specifics, but there's a lot of research going into attempting to use different biometric data to predict stress. And as of to date, has there been anything proven? Or are you working on something that...
Yeah, actually, we are trying to patent our algorithm. So basically, because we are scientists and we are the computational scientists, and every day we are working with the time series algorithms. We are predicting what will be happening in the next time or in the another scale. So we know that part, and I don't know if I can mention the name of the algorithm that we use, but for doing that, we use the Shiny R, we use the R language, and for the first part, for the innovation, when we got that award, we predicted for 3 seconds. So this is the first part for the time prediction algorithm.
Thanks. Just a few quick questions. So you mentioned you were at VCU. Are you licensing technology that you developed at VCU, or is this under your own LLC or C Corp?
We will be working with VCU. Yes. VCU will help us that LLC, and it will be partially owned by VCU, but we are not there yet to have that.
Okay, so the intellectual property is currently owned by VCU.
No, it's partially owned by VCU. Since this was developed
So there is a license agreement in place. Okay.
there isn't.
VCU, that will be the next step. Lawyers that will meet those lawyers, and we will figure those steps out at that point. Yeah.
Okay, and then who gets paid and how do they get paid within the app? So if I'm talking to somebody anonymously, are you paying those people to respond to the folks in your
No,
app?
no. We are not paying, because this is the part that we like to make it free for the people, so they can freely talk with others, and we don't want to charge them. But in future, in our revenue, we are thinking that if the therapists and the people in the health center, they want to join and we can charge them. But at this point in our revenue, no, we don't want to charge the people.
So then how do you make money?
Okay, so we have a freemium part. So we are going to open some parts of our app free for the people. And if they like, for instance, if they want to reach the stress map, or if they want to do the more prediction about it, because we have other section in our app. So if they want to access to those, we want to charge them.
Do you have any preliminary data about how much somebody's willing to pay you to open up those additional aspects of your app?
If
For that, but our customer willing to talk to offering that
Okay, thanks.
Any other questions, judges?
Just one other question. So going back to your demo,
Okay.
and you mentioned that you're collecting some data from Fitbit. So does a person have to have a Fitbit in order to use your app?
At this point, we only focus on Fitbit, and the reason is that they have a really good forum, so we can connect with the people and we can get the high resolution data. But our goal is not only use the Fitbit, we can have any wearable devices. So and we can connect that to the app, yes.
Okay, so your app does depend on someone else's device to collect the data.
Yes, wearable device, yes.
Wait, say that one more time. You're going to build your own device?
No, wearable device.
Oh,
So
a wearable, okay.
Yeah, wearable device. So you have to connect the app with the wearable devices.
All right, thank you.
Any other questions? Thank you, ladies. For your help.
Going to page through to our start, I would assume.
And I will introduce you.
Yeah, absolutely.
Hold on.
Okay.
Judges, did you need any more time with the previous group making notes? Were you good?
We'll be fine.
All right, we can move on to our next group. This is Pocket Protector. Would you like the microphone?
Yes. Thank you so much. Hi, everyone. My name's Carly Vogt. I'm the co-founder of Pocket Innovations. Thank you so much for having us today. We're excited to be here. I'm going to start us off with a few alarming statistics. So did you know that 1 in 4 women have cardiovascular disease or die from cardiovascular disease? Or that cardiovascular disease is the leading cause of death globally? I did not know that either, and luckily I've been made aware of that problem and have been working on a team looking to increase and better patient outcomes. So right up here, you see on the black and white shirt, this is Michelle. She will be undergoing pacemaker surgery later in the near future. So currently, 33.5 million irregular heartbeats exist, and in result of this, 1.2 million pacemakers are implanted yearly. Over the next 3 decades, we'll see a 400% increase of these statistics. So what you see here is a pocket hematoma. It's pretty gnarly. So this is one of the leading complications post-pacemaker implantation. It's a pooling of blood in the wound site that is a result of the pacemaker implantation. Oftentimes, it results in a longer patient stay and adds additional costs to the hospital's end and as well as on the patient's end. So current solutions, as you see up here, gauze and tape. So let's go back to Michelle. She had her pacemaker implanted, and post-surgery, she developed a pocket hematoma in her wound. So what the nurses would do is take a big stack of gauze and put that right on the wound site, tape that down, and in hopes that that would apply enough pressure to relieve the pocket hematoma. When this doesn't work, and oftentimes it does not, they'll take a sandbag equivalent to a 10 to 15 pound bowling ball and place that on her chest to apply pressure. This will work, but obviously it's a little extreme and not a very effective way of doing so. So the patient's average stay is typically 20K per day in the hospital, and once a pocket hematoma develops, it can extend their stay up to 9 days, and oftentimes insurance companies do not cover these costs for the hospital's end or the patient's end. So this is where we come in. We're Pocket Pro. We've developed a proactive medical device that eliminates the occurrence of a pocket hematoma before it even develops. I'm going to pass the microphone over to my co-founder, Kayla Burkholder, and she's going to run through the progress we've made thus far.
Absolutely. Thank you, Carly. So in terms of Pocket Pro, we've really positioned ourselves as a preventative medical device. So our top three things is patient comfort. Number one, it's got to be comfortable for the patient to wear. Number two, outpatient use. Doctors are trying to get patients home sooner and sooner. And so a big thing is to be able to send them home that day after so hospitals don't incur extra costs. It's a flat rate that they pay. So anyone who comes back in or anyone who develops complications, that's going to end up costing the hospitals more. So our cost price point right now, just on kind of chicken scratch beta manufacturing, is running about $90. That's with the 45% margin built in. And then it's an effective treatment, so we actually work. If you stack us up against our competitors, as you can see, there's only one solution that really works. And then we have one commercial competitor, which yes, it's comfortable for patients, and yes, it works for outpatient use, but it does not work. And so here's the difference, the pressure generated. So here's the thing, the pressure bandage on the bottom is the standard use. The Pocket Pal 2 has about the same pressure. As you can see, we actually apply enough pressure to stop bleeding. That's why it's important post-pacemaker. In terms of customer validation, we have gone and talked to 28 different doctors, nurses, and technicians across 7 different hospital locations just to ensure we have product market fit and that we're actually solving a problem that needs solving. We've heard it time and time again, this is a problem that no one's solving and really should be. When they do occur, they can be gnarly, they extend stays, and even reoperation. In terms of billing and understanding the procurement process, we've started talking with billing specialists within hospitals, people who consult in the insurance area to understand our insurance codes and reimbursement, so we know when and where we actually need to sell this. In terms of revenue, after we have FDA Class 1 clearance, we're looking to get 5% of the US market. With 45% profit margins, we can expect to see our first year of revenue around 1.1 million. So this is a slide here that talks about our 5-year revenue streams. Basically, it grows up from about, we're starting at 45, then we get into that 1.1, and then it kind of escalates to 1.9. It's really a slow growth plan, but our ideal situation is to expand into other product lines and grow out our whole company. So it's rather conservative, but with, ideas of growing up and moving on. In terms of traction, we've been around for 8 months. We have our LLC set up. We filed for a provisional patent. We've developed partnerships with people like VCU Health and the Veterans Affairs. So we're working with McGuire, who's right in our backyard, with their cardiac unit. And they're willing to beta our initial units to make sure we have that efficacy after approval. And then lastly, customer validation. We're making a ton of changes based on feedback from doctors and nurses. So in terms of other traction that's been great for us, we've gotten to go to a lot of great pitch competitions. Just yesterday, we won Something in the Water Best Female Co-Founders. We are in talks with Austin Technology Incubator. I'm moving back home there after grad school, so we're kind of dividing and conquering. And then we're also a finalist for the nationally recognized Mass Challenge. So in terms of our team, as you can see, we've got Annika, Carly, and myself here, but we also have Dr. Charles Joyner. So he's our primary investigator. And in terms of what makes our team awesome is so we are built of product innovation students, a biomedical engineer, and a cardiologist, electrophysiologist of 20 plus years. So when I look at who and what can conquer this problem and other medical issues, it's us. We've got the human-centered design, we've got the engineering brains, and we have the doctor to actually help us build those connections. So for us, what are the next steps? So our biggest roadblock right now is FDA Class 1 clearance. That's going to take anywhere from 6 to 9 months. We'll be submitting that here in the next 1 to 2 months. And during that time period, we'll be doing a small initial capital raise. So we're not going to go out and raise a ton of money. We want to get just enough to get our beta units manufactured so we can go ahead and get those tested and understand what design changes need to be made before we go into full-scale production. Or if there's none, go ahead and launch and get going. So once we have our first successful launch, you'll see us moving into other product lines. Like I said, we've got ideas on the back burner now, but we want to get one item through FDA clearance first. I can see you, and I know I heard you talk downriver about that. So all sorts of fun. And anyways, that's a big, huge thank you from Pocket Innovations. I'm looking forward to any of your questions.
Great, thank you. So you mentioned that you are 1 to 2 months away from submitting to FDA as a Class 1 device.
Yep.
So who manufactures the product?
So right now, we're looking at different manufacturers, kind of trying to understand what our cut and sew will look like. We're looking at a couple cut and sew shops within Virginia that are going to be able to put the whole device together.
You can do that in the next 1 to 2 months with all your validation ahead of FDA submission?
That's ideally, yes. It's aggressive, but we're basically moving very, very quickly full-time into this. And if not, then that pushes us out about another 3 months. But that's kind of the main focus coming up.
Who's your regulatory, who are you working with on the regulatory side?
So we're working with Alistair Monk and John Wilson.
Are those people?
Yes, those are people. And so, and to give you background, so Alistair has put several devices through the FDA approval. John Wilson has got regulatory background in submitting those. So this is like brand new.
Okay. Are those VCU people? Like who are they?
They're in the Richmond community. We got to know them through the biopark. And again, this is new to us, so this is our first medical startup. So any helpful hints or, if that's too aggressive of a timeline, I would be very happy to know that.
Yes.
Yes, perfect.
I would look into some similar devices and see what their validation looks like, because it's going to take you much longer than a month just for the validation.
Yeah, just for the validation. Okay.
Yeah, after you have your product assembled and
Right.
everything. So even if it's a class 1, I would look further into that.
Okay. That's great, because we have a meeting not this Tuesday, but the following Tuesday about all of that. So these are all things to add to our docket.
And do you know which regulatory code it falls under?
I have that somewhere, but yes, it falls under bandages.
And you know the 3-letter acronym it falls under?
I can't remember.
Okay.
That's a good question.
If you do have that, definitely go look up those devices through FDA's.
Yeah, and I do have that. We actually have that on our competitor, the Pocket Pal 2.
Okay.
I have a couple questions about the device and its competition against the status quo. Right now, it sounds like the status quo is cheap and easy.
Yep.
And works. So tell me about how you're going to market it and how much your product's going to cost in order to come over the barrier of the status quo.
Yeah, absolutely. That's a great question. So we've had a lot of conversations with doctors, and that's really, so there's kind of 2 routes to go there. And as we continue to do customer validation, we're hoping either one path lights up more than the other, or we'll end up going both. So on one end, the hospitals, when it does occur, ends up costing them quite a lot. Or if a patient comes back to the hospital with a pocket hematoma and they have to come back in, again, that's not covered by insurance. So there's this flat rate cost, and they're covered up to like 1 or 2 days post-op. So any time past that is going to cost the hospital money. So one approach is to say, this is a preventative approach, put it on your patients, and those costs kind of even out or come down and improve patient outcomes, which we know is huge. And then the other way to look at it is in terms of surgeons. So we observed operation. We watched a couple of these surgeries over a couple days. And the one thing that's really interesting is there's always these trade-offs for surgeons. So you can do it quick, and you may end up with a little bit more risk of complication, or you can do it longer and make sure that you seal up all the cauterize all the wound, little blood spurts. And even that doesn't always work. So for them, it's really peace of mind. It means that they're going to have improved patient outcomes because none of them are going to have the pocket hematoma, which means none of them come back, and they can go through their surgery quicker because it's applying pressure post-surgery. And so for that end, that's also looking to target the private practices and talking with the doctors about making this a standard of care for them. So right now, we've found out that they use a microbial mesh, antimicrobial mesh that's $800. In a couple of hospitals we've talked with, not been proven to improve patient outcomes, but it gives them that peace of mind. And so that's really we would love to take the same approach, except we will know that our device actually improves outcomes.
I would recommend, as you're doing your studies, determining what your number needed to treat, given we had talked earlier that only 3% of these procedures result in this outcome. And as a preventative device, you're going to need to overcome that total cost.
Right.
on a prevention side relative to the number of patients needed to treat to prevent the outcome.
Need that, yeah,
That cost analysis.
absolutely. That's on my list.
Thanks, great presentation. So you filed a provisional patent?
Yep.
And are you looking at?
So Dr. Joyner came in with a patent already filled and filed and accepted for the mechanism of applying pressure, and now we are filing a provisional patent on the updates that we did to the design.
Got it. So it's just a design patent, not a full utility?
Yeah, the patent for the mechanism is a utility patent.
Okay, thanks. And so I just had a quick question about applying pressure. Are there any adverse events or effects to applying pressure? Like, do you strain a shoulder? Like,
Yeah, so
how does that work?
there's definitely drawbacks if you apply too much pressure. That could lead to blood not going in that region at all. That could lead to necrosis of the tissue. Those are things that we're aware of, and we are definitely going to make sure that those do not occur. And that's going to be within the within our protocol of here are the standards of how you establish how much pressure each patient needs and for how long.
And have you published that data?
Yeah.
No, we're currently working on actually developing those standards and working on understanding that better.
So far, we've done that research, but beyond that, we have not published it, no.
So, and that's not part of your FDA submission?
Not as of now. Our FDA submission is full, we're literally in the process of working on that. It's not, we just started probably exploring that 3 weeks ago, so clearly we have a long way to go with that.
We have a big meeting two
Yeah.
Tuesdays from now to
Yeah.
really nail down those timelines.
Yeah, it's a very new thing for us.
Yeah, and those are studies that exist in literature currently. So those are just the understanding that if you completely remove blood flowing into a region, the cells are going to die. They're not going to have oxygen. They're not going to have the ability to survive. So that's definitely something that we're going to consider, and we want to set those limits so that that never happens.
Along that same vein, developing pressure ulcers is a major issue for hospitals. And do you have data to show how much pressure you will require in your device to stop bleeding relative to the duration of time it has to maintain that pressure versus the time of onset of the beginning stages of pressure ulcers? This is a major issue for hospitals.
So yeah, that is an excellent question. We'll definitely look more into that, and we're trying to grow deeper understanding in that. We're conversing with Dr. Joyner. We're trying to reach out to as many physicians who have a deep understanding in this, and I would love to have a conversation after this about that, because we want to learn about this. We want to make sure that we're creating something that genuinely helps people.
Right, you might need to make sure your device has a variable pressure change.
It does.
Certainly.
Yes.
Okay, that's time sensitive, because if someone forgets to reduce that pressure, you can be in a lot of problems quickly.
One last question. So why the 45% margin?
So that is just pretty much standard for medical devices. You're looking at, dependent on the medical device, you're looking anywhere between 20 to 40, seems about there. So we really do need to nail down prices. I mean, we're still here at the beginning stages of this. So trying to understand the medical device industry, where we fall in line, what pricing can be, what's pricing for insurance companies if they're covering it, what's prices direct to hospitals. This is space we're 100% looking for mentorship in. We are not the experts in that yet, and are trying to build out that network of people who can be litmus check, can be no, you're wrong. So, I mean, that's for us over the next 4 months. We're looking to be in an accelerator where we have the people who can help us answer these questions. Because right now, we are basing it on whatever you find on the internet. And as we all know, not everything on the internet is true.
Thanks.
Thank you guys so much. That was just really
this was
helpful
super
for us. So thank you.
Well, I have a question. What made you decide to create this product in the first place?
Yeah, that's a really great question. So as you know, we are Master of Product Innovation students. So we got partnered with Dr. Joyner, and we all came here for very different reasons. So my background's in marketing and websites and tech. Carly's is in hospitality and tourism. And Aniket, well, he's a biomedical engineer, so he sort of fits the bill here. But we're all interested in human-centered design and improving people's lives based around products that are actually doing that and thinking the person first. So when we got this project, we're like, oh, we didn't know this was a problem. And then we went and actually saw people suffering from pocket hematomas, and we saw the units, and we were like, oh man, this seems like we could do something better. And so it's been great for us to be able to take what we've learned in school, create an actual product, be human-centered, improve people's lives, and get to launch a business. To me, it's an amazing experience to take this on, especially in this challenging space. But I've got this killer team. We've gotten great opportunities to make connections with people who can help set us straight, can help make us contacts. So for us, it's an amazing learning experience. It's improving people's lives, and it's honing and using our skills.
Thank you.
That's a great one.
Our next group, Exorise. Got everything? Judges, you ready?
Hey, good afternoon, everyone. My name is Rowan Cade. I'm the co-founder and CEO of Exorise. Exorise's mission is to enable increased mobility among the elderly, weak, and disabled populations. We're doing this by developing a pair of single-joint exoskeletons or powered knee braces that improve the efficiency and safety of sit-to-stand transfers. Our goal today is to raise seed round investment to expand our team and build a minimum viable product. So, independence in the nursing home is something that affects not only the resident, but the caregivers and the administrator as well. George is a resident in a nursing home, and even though he lives in a nursing home, he wants to maintain his independence. Independence to him means deciding when he eats his meals, what events and activities he goes to, and be able to move freely around his residence in the facility. Unfortunately, George requires assistance to get out of his bed or a chair. Claire is his CNA, and Claire not only has to care for George, but she also has to care for 7 to 9 other residents every shift. If Claire wants to help George get out of his bed right now, she has to use a mechanical hoist lift. It takes 10 to 20 minutes and also requires another caregiver to help her. That, or she can do it manually and throw out her back. Mark is the administrator for the nursing home facility. Mark's main goal is to provide quality care for all of his residents and maintain day-to-day operations. Unfortunately, he's also facing a national skilled nursing and nursing assistant shortage. So these 3 factors are at the core of the resident transfer problem. Current solutions offer a poor resident experience, they're labor intensive, and they exacerbate the existing labor shortage. Looking at the market for nursing homes, while this issue applies to almost all long-term care settings, looking at just the nursing home market, there's about $200 million worth of opportunity there, and a strong growth rate due to the aging population and increased awareness around occupational safety. Exorise has developed TransferBot to solve this patient transfer problem. TransferBot is a single joint exoskeleton that's used as a pair, applied directly to the resident to augment their own strength and act as an external quadricep to help in the sit-to-stand movement by applying a torque around the knee joint and replicating the natural body mechanics of the sit-to-stand motion. Basically, the nurse comes in, applies the brace, and is able to complete the transfer in 3 minutes and move on to her next task. In comparing TransferBot with our direct competitor, the mechanical sit-to-stand lift, TransferBot allows for direct physical contact between the caregiver and the resident. So that way the caregiver can operate the device and provide stability and reassurance to the resident while helping them with the transfer. The existing state-of-the-art technology, this giant machine pictured on the right, the device itself acts as a physical barrier. So the resident and the caregiver are separated by the device, which requires a second caregiver to come in to help be there on hand to help steady the patient or catch them if they slip out of the device. So essentially, comparing these 2 devices' use cases, looking back at George. George hits his call button. Claire is there in about 5 minutes to see what George needs. She realizes George needs help transferring out of his bed. She grabs TransferBot, puts it on George. 3 minutes later, George is in his comfy lazy boy. Compare that to sit to stand. George calls the call button. Claire is there in 5 minutes. Claire realizes George needs help getting out. She now has to wait up to 30 minutes for another CNA who also has 8 to 10 residents to care for every shift to help her move George. In the end, that could mean George is sitting around in his bed for 45 minutes before he's either in his wheelchair or his chair or on his toilet, wherever he needs to do. I don't know about you guys, but I don't like sitting around for 45 minutes if I just want to stand up. So throughout this design and development process, we've talked to over 170 customers, stakeholders, decision makers in the nursing home space. We actually have 3 nursing homes that are willing to help us with our in-facility testing once we have developed our minimum viable product. Our team is made up of myself and my co-founder, Dr. Scott Paul. My background is in biomedical engineering and supporting medical technology innovation in a number of different roles. Scott has 35 years of clinical experience in rehabilitation and physical medicine. So our development timeline, up to this date, we've self-funded this along with a small grant from NSF for doing iCore customer discovery. We're in the process of filing our provisional patents very soon, and we're looking to raise a seed round so that we can develop our MVP in 6 to 9 months. With that MVP, we'll have a product that is safety tested, also has a polished user interface so that's not going to scare the resident from using it, and most importantly, we have an optimized control algorithm that allows for safe use. Following that, not only will we convert our patents to full patents, our provisional patents to full patents, we'll also begin facility testing. We have a 510K clearance pathway, finalize the design, and get to sale in 1.5 to 2 years of our initial sale of the device. To get to market, as I mentioned, we are a 510K Class 2 device. There's a very specific pathway that FDA has laid out for powered lower extremity exoskeletons that's not incredibly onerous. Another thing I mentioned was that while this technology is applicable to the entire long-term care space, we're targeting the skilled nursing facilities and continuing care retirement communities because they are an incredibly dense population as far as the need, but also how those organizations are run. The top 20 skilled nursing facilities, as far as population size, care for 25% of the entire nursing home population in the United States. So if we can target these larger facilities and providers, we're able to gain market penetration much faster and for a much lower cost. Looking at revenue for our device, talking with both customers, looking at the cost value of time savings, and looking at competitive devices, we believe we can sell a device for $5,000 and still maintain a good gross profit margin, even with discounts and cost of goods sold. 5-year projected financials, losing money in the first 2 years, gaining traction, and really $3 and $13 million sales revenues the first couple years are very achievable. So, that's kind of messed up, but so next steps for us, as we continue to grow in the nursing home market, partner with national and international distributors to get full penetration to the nursing home market in the United States, as well as expand to European and Asian markets. And then really after that is expanding to the home care market. Currently there's 12 million Americans that receive some type of assistance in the home care, and they're completely underserved by the current technology that's practically unusable in an average home. And then the technology is also applicable to rehabilitation and physical therapy equipment. At any point in this timeline, we'll be looking to get acquired by the large hospital equipment and bed manufacturers such as Stryker, Hillrom, and Arjo. But there is a pathway to continue development as an independent company throughout that time. So today we're seeking $700,000 to expand the management team, increase the engineering staff, and build a minimum viable product. Thank you.
All right, judges.
So thank you very much. From the images that you showed, the Exo Rides is only for one leg at a time?
Two. 2 legs. Sorry, the picture is a little misleading because we only have one prototype built at this moment.
Oh, okay.
Well, this model prototype built at this moment.
Okay, I got it. And so who pays for this?
Yeah, so the nursing homes pay for it out of their capital budget. So nursing homes, how they make their money is they have a daily bill rate for all their residents, and they have to provide all their, then what's determined on that daily bill rate is the average services they provide per resident. And this is one of those services, like assistance with ADLs, and the number of ADLs they provide assistance with is all factors into that bill rate. And so they buy sit-to-stand lifts out of their capital budget and other type of lifts out of their capital budget currently.
And for the sit-to-stand lifts, is any part of that covered by an insurance company? Or CMS?
So not for a nursing facility. For home care or for assisted living, there are CPT codes for rentals of those equipments for up to, I think, 13 months, and you have to buy it. The reimbursement rate isn't great. You end up, I think it's about $130 a month, which after 13, I think there's a 13 or 14 month max on that. These typically, especially the sit-to-stand ones, typically go for $5,000 to $7,000. So it's almost always paid out of pocket. You can go on any of the online rehab mart or like places you can buy these online. They will not. They make you deal with the reimbursement yourself. So they're not. It's not a steady enough reimbursement that they are willing to like deal with that themselves.
So the value proposition for, say, it's the nursing home is the time savings.
Yes.
And so how does that translate into the?
So time savings and quality of care, and patient satisfaction, quality of care. So
what's the quantifiable measurement for them?
For
like you tell them you can provide this device, you can save them 25 minutes of their day per user.
Yes.
How does that translate into how much money they can save?
Yeah, so pretty much laid out right there. But essentially what it is they are so short of staff right now that they could redeploy that labor elsewhere to other care tasks that are not being done right now and improve their quality score, which eventually gets factored into their reimbursement rate. But they're just, the time savings itself is the more realistic thing they can actually put their head around and immediate impact.
I have some questions about the device itself.
Yep.
What's just kind of quick ones. How much does this device weigh?
Yeah, so the current prototype weighs about 8 pounds, but we're working on reducing that weight down to something that's, around 4 or 5 pounds.
Okay, and your time estimate, does that include attaching the device to the patient on both sides?
Yeah, it is.
Okay.
And that's one of the things we're innovating over is the attachment system that's focused on the elderly population. So if you think about 85-year-old grandma, she's got very fragile skin. One of the biggest issues in nursing homes is pressure ulcers and skin tears, like you mentioned, in any hospital setting. And so our attachment systems focus on better distribution of force to eliminate all pinch points and pressure points. And also, it's not intended for full-day wear right now. That's potentially down the road. Our ultimate goal, big vision, is to get this to be a full-day wear, independent use without supervision of a caregiver, so that grandma can use this in her home and get up out of her chair whenever she wants. But the first logical step is supervised use in a controlled setting like a nursing home.
And what's the overall estimated product life for it? How long do you think it's going to work before it has errors?
Yeah, I think we haven't really, we want the thing to last 5 years, so we'll try to engineer it to last that long. We haven't done any lifespan testing of it yet.
And it sounds like this product doesn't allow the body mass to move the center of mass over that, so that's always going to require another person unless they have that continued strength. Just in looking at the device and the way you move from sit to stand, your device is only at the lower extremity,
yes,
correct? And only addressing quadriceps issue,
yes,
versus core strength and the amount of hip flexion.
Yep.
So you're always going to have a second party to help pull the mass forward. Presumably, if they're so weak they can't move from sit to stand, you're going to have another caregiver assist. Yes.
So
That.
yeah,
So I'm
and
just
there's
talking about the viability for home use without a caregiver.
yeah. So I mean, it's definitely and this is why also like independent use is like you have to slice the population a bit differently, and it's not the first market we're going after. But there is definitely a large use. I mean, because the home care market itself is so much bigger, even if it's a smaller slice of the pie, there's still a large market there for independent use. But there's still also, supervised use in home care. But also, if you look at the biomechanics of it, about 80% of the work done in the sit-stand movement is done by your quadriceps, and when that's part of the control system is to help maintain that center of gravity as well.
What other market opportunities? I think about NFL football players who, have trouble walking at the age of 35 or 40, and these are high net worth individuals who would look for a device like this just to help them.
Yeah, so I think, the core technology, again, is going to be in kind of the control system and the use of it. If you look at the mechanical engineering components, they've been around forever. That's why there's 20 exoskeleton companies out there. But the applications can go to a lot. It's basically anyone that needs some type of additional strength in their quadricep for multiple applications, and you can tailor the control system around that. And you can also tailor the size of the device based on the power system and the actuator around what's the intended use. If they're only going to need a 10% assistance, you want to really minimize the size of the device in the weight of the device. Whereas in this case, if they're pretty dependent on the device, it's going to be a bit bulkier. While still trying to minimize the entire size, there's certain physics aspects you can't get around.
Yeah, I'm thinking about ways where you could sell the device kind of off the shelf to create a revenue stream to pivot then into an FDA approval process.
Yeah, so FDA cracked down on some of that stuff. A lot of previous exoskeletons were being sold as powered exercise equipment, and I think part of it was they were also selling them to physical therapy gyms as powered exercise equipment. And basically, FDA came through and said, no, you can't do that anymore. All you have to go back and resubmit through this new pathway. So it's something we haven't outside of physical therapy gym. There might be ways to sell this. Really, when you look at the amount of effort that would be required to build that sales channel and to build that market, and the amount of potential revenue there is not great. It would likely just be a distraction for right now.
And then you talked about the user experience. What's that little remote control? Is that to? Yeah,
so that right now it's wired, but it will be wireless. It's basically that's the up-down button.
Okay.
Yeah, and there's potential to eventually move to a system where it can sense when someone's intending to stand up and just help. But again, trying to build a minimum viable product, I think that's kind of, if you look at the exoskeletons out there now, they're huge, they do everything, they cost $50,000, and they really haven't looked at the core problem and building the minimum viable product that meets the biggest need out there.
Okay, thanks.
Does it have to be wireless?
No, it doesn't. Well, so it'll probably take more time. I think wireless is really not that hard to do, and it will improve the experience and user interface a lot, because having the two connected or having a wire that someone could trip on and get tangled up. Yeah. But yes, it doesn't have to be wired. You can still operate with wired. But it's not that. It's just a Bluetooth receiver or RF, yeah.
I think we've all had issues with Bluetooth. That's why I was asking.
Yeah.
Yeah.
Okay, thank you.
Any other questions, judges?
Just a quick question. Since it's going to be in a nursing home, in terms of your products and cleanliness and infection control,
Yeah.
how have you addressed that?
Yeah, so we're thinking of consumables to go line the inside, as well as in nursing home, most people are fully clothed, so it'll be applied on top of clothes and can be wiped down and stuff. And if certain nursing homes, we've looked at the economics, some of the higher end nursing homes are willing to actually buy this for each resident that needs it, or rent it for each resident that needs it. Most others, we believe, will buy kind of a fleet of 3 to 5 to use throughout the facility.
Any more questions? Much. Our next presenter, Kill Medical Solutions, LLC. We're ready for you.
Hi everyone, my name is Kashyap Rupali, and this is one of my co-founders, Joshna Seelam, and together we're representing Kill Medical Solutions, which is a medical device company focusing on bringing the latest technology into healthcare to solve unaddressed medical needs. And we plan on entering the market with our first product called Breezolette, which is focusing on the neonatal intensive care unit. So currently there's 15 million babies that are born prematurely each year, and they're placed into special incubators, referred to as isolettes, which control various parameters such as oxygen saturation, temperature, and humidity. But before I move on, I want a quick show of hands. How many of you enjoy sleeping? Everyone. Now raise your hands if you like sleeping with the lights off or want them dim. Off, right? Yeah, so clearly light is important to us to function properly day to day. We need the lights off at night and need the lights on in the morning, and that helps us with our sleep-wake cycle. So why should it be any different for premature infants? Currently, light is not properly regulated in the NICU. There's either too much light, too little light, or an unstructured combination of the two. And improper light stimulation can have negative impacts on their overall health development, such as their neurocognitive, optical, and overall physical development. The current solution hasn't been changed since the 1960s. It also isn't standardized, so it varies from hospital to hospital, and sometimes within the unit itself. So you can see on the left side is a blanket that's being used all the way, and it made minimal progress through the years to a physical isolate cover. But there are still two main issues associated with them. The first one is safety. When the blanket's on, the care provider doesn't have a constant visual cue on the infant to make sure everything's all right. The second one is sanitary. Since they're made out of fabric, they fester bacteria, and since the infants have underdeveloped organs and immune systems, it's detrimental to their health. After identifying this unmet medical need, we have spent a lot of time to validate it. We've talked with over 300 stakeholders, which includes care providers, unit directors, parents, procurement services, and parental advocacy groups. And they have all validated the need for our product and cannot wait for it to go to market. So we decided to make Breezolette. Breezolette is the first technological solution that provides an optimal light environment for premature infants. It's a system of films that's applied on the exterior of isolettes, so it can be retrofitted onto any existing model. So on the left side, it's in its opaque state, and then on the right side, it's in its transparent state, and it has the ability to go through all different light levels. So there's three main features that are attributed with our company and with our product. And the first one is it reacts to vitals. So let's suppose that the infant's vitals are unstable. Then the isolate will turn clear immediately to serve as a visual cue to care providers, and in turn, this reduces response times. The second feature is that it implements light cycling. And light cycling has been proven by many studies to have significant benefits, such as it extends sleep duration, stimulation of growth hormones, it helps with the early development of circadian rhythm, weight gain, decreased risk of vision loss, and many more. And this is important because these are the same factors that care providers currently use to assess if an infant's ready for discharge. The third feature is gradation of light, so it's different from the on or off solution of a blanket. It has the ability to be opaque and also transparent, but in addition, it has the ability to have all the intermediate light levels. And this can be used to personalize care from infant to infant. So I'm going to pass it off to my co-founder.
And in addition to all of the health benefits that my co-founder just mentioned, there's a huge economic benefit to our product that we're currently developing. So as you can see on the screen here, 1 day in the NICU costs anywhere from $5,000 to $7,000, depending on the location of the hospital. And there's a lot of research that shows that if there is a proper light environment that is provided to these infants, it can significantly decrease their number of days that they're staying in the NICU. So most of the research that we've found shows anywhere from like 15 to 30 days that can be decreased. We're hoping with our product, if we can at least have them discharged up to 9 days earlier, this can save $31,500 for both hospitals, insurance companies, and even families as well. And more importantly, any time that's spent less in the NICU is more time that this infant is spending at home with their loved ones, which is what we all need. And so let's take a look at the market here. So this is a huge market. There are currently over 5,000 NICU departments across the United States. And in each department, there's approximately 30 isolettes. We're currently at a point where we're pricing our product for $7,500, which allows us to have a total available market of $1.18 billion. We have identified many ways on how we want to take this to market, whether it's direct sales to the manufacturing companies or to the hospitals, or even like a licensing deal with the existing isolette companies. Based on our current research and our strong partnerships with the major hospitals in Virginia, we have decided to take our product into market through direct sales, mainly because we do have these really strong partnerships with VCU Health and the Children's Hospital, both in Richmond and in DC. So I want to take a quick moment to highlight our journey to date. So we have started working on this project a little over 15 months ago, and we've come a long way since then. So we've identified the unmet medical need. We have done our customer validation to make sure that we do have a product market fit. We have already filed for our non-provisional patent under track 1, so we're hoping to have that issued by the end of this year. We also do have a minimal MVP that is currently functioning, and it has all of the core 3 features that my co-founder has mentioned in the previously. We actually do have our device outside on our table, so if anyone is interested to see how it works, we're happy to give you a tour of that. We have raised over $15,000 to date, all through non-dilutive funding means, different pitch competitions and business plan competitions. We're currently at the spot where we're trying to enter the FDA clearance pathway. We're hoping that would take anywhere from 12 to even 2 years at max. We are identified as a Class 2 medical device, and that is something that we have found through our preliminary conversations with the regulatory consultants. So here's my team. We're 4 passionate individuals, and we all have core technical background in biomedical engineering and product innovation. But based on our skill sets and strengths, we've kind of divided ourselves into different roles of the company. And so today we're here to ask for capital help as well as mentorship, and in these areas that we're moving forward as our next steps. We are looking to build our Gen 2 prototype, as well as our biggest thing right now is the FDA pathway. Thank you.
Perfect. Judges?
So I'm not certain what the actual technology is. Is it the glass? Is it the whole isolette? What are you selling?
So we're just selling the film that is going to be placed on the outside of the isolette. So we're not bringing any new isolates in because they're very expensive. We're just adding an additional feature to the existing technology.
So this is the technology that you've developed, is the film that would go onto the isolette.
So we actually did not develop the film, but it's a utility patent, so we're going to use that film in this space. It's just applied.
Whose patent is it?
Whose patent? Oh, we filed for a utility patent, a non-provisional.
The film is currently commercially available for other purposes, but we're bringing it into the medical space.
Yep.
What stops the person who invented the film from just speed to market and going into the medical space?
So this film has been out for very long, that their patent has actually been expired, from our understanding at least. So we have worked with the IP lawyers who have went through this process, and they've assured that because it's a commercially available product, it would be patent in a different state.
Based on the claims we made in our patent, it's going to prohibit them from doing that. Because
If awarded.
if it's awarded, if
Right.
it's awarded.
If it's issued.
Correct. Yep.
I just had a quick question. You mentioned that there's a lot of scientific data on the light control need, but I didn't see any sources of that scientific data. So could you shortly or briefly explain where's the core papers that were written on light control in the NICU? Where did that come from? Who were the scientists behind that?
We do have a list of documents, so I'm happy to share that with you, but Cash can share a quick study that we have been sharing with the judges.
Yeah, so I mean, there's been a lot of studies with the NIH and other scientific journals that we found, and they kind of showed how they achieved light cycling by having acrylic helmets. So there's helmets that placed over them, or eye masks. So they put that on for a certain period of time, take it out. And by doing that with over 40, 50 infants, over the period of their stay, they saw that they were able to sleep longer, they spent less time crying, it reduced their cortisol levels and other benefits.
So those are your competitors, the helmet technology and the eye covering technology. What are those? What's your competition selling their products for?
Our competitors are the physical isolate covers as well as the eye masks. None of the hospitals that we visited and talked to with the stakeholders use eye masks. It was particularly in the studies that we found it. But yeah, the competitors are mainly like Philips Healthcare, Draeger, and GE that produce these isolate covers.
In addition, so those competitors, they cause a lot of discomfort to these. They're actually very, very tiny, so you don't really want to put a helmet on their head when they already have a lot of wiring throughout their body for other medical needs.
Right.
So we're providing something that's more comfortable for them. And our device won't even be touching the baby, so since it's on the outside, we don't want to add any more wiring or any more devices.
So currently, people are using a blanket to cover the isolate, and you're offering a $7,500 film that's on the market to replace the blanket.
Yes. Well, there are actually features that we mentioned that are beneficial. For example, through the studies, I know we have to still do clinical trials to prove that efficacy, but each day costs $5,000 to $7,000. So even if we're able to discharge the infant a day or two earlier, it'll pay back the cost for our project.
Got it.
And also, one of the biggest things that we got from customer discovery is that we're providing an automated solution. This is something that we don't want to add another task onto what care providers already do. 100% of the people that we talked to said that light cycling is important, but 0% of them actually implement it in their hospitals. So the only way they can do that right now is by having the blanket, taking it off, but that's just very ineffective.
And what's the lifetime of the film?
It's 10 years.
Right. So, the hospitals have these isolates for 20, 30 years at a time. And so you have your film. What I don't understand is how do you install it, how do you upkeep it, and who pays attention to it? How do you actually get it to the hospital?
So we're going to have our own technical team that goes around and installs them. And if you want to
customizes the fit to the whatever brand of isolate that they have?
Right. So when we actually do start mass producing these, we're going to start with the main top isolate brands. So these are going to be retrofittable to their specific models.
Why don't you sell it to them?
That's one of the options that we can do, yeah.
That's way easier. Why build out an entire sales team and tech team when you just sell it to Giraffe?
Right. So that's definitely one of the options down the line that maybe we should just push it up the line now, yeah.
Any other questions, judges?
So how are you? What is your regulatory testing look like?
So we have actually just started the process of having these initial conversations with the FDA consultants. And based on those conversations, we've identified that it would be a Class 2 medical device. It has a very minimal, it poses a very minimal risk since it's not directly touching the infant. So getting it through the FDA wouldn't be a huge setback, at least based on the conversations that we've had. It would take anywhere from 12 to 18 months to be able to like kind of go through all of the testings and whatnot. In terms of, we don't need to do any biocompatible testing because it is not touching the infant, but we would have to do the electrical and safety testing from the outside perspective.
You'll probably also have to do the the safety testing to indicate that, because you mentioned that it would turn transparent once some alarm is going off.
Right.
So that needs to be 100% reliable, because you can always rip a blanket off.
Right.
That's super easy.
Right.
So,
Yeah, so in addition to that, we're not really replacing any of their alarms. This is an added feature in addition to what they already have.
yeah, but it still needs, if you're going to provide a response, it has to be, infallible.
Right, yes. I'm assuming that is one of the tests that they're going to make us go through.
You also have to define that test for the FDA and show that that's the appropriate test, because the FDA's not going to tell you.
Okay.
just let you know for like later down the
Got
line.
it, okay.
You're going to have to educate the FDA on a lot of things regarding your product. And so it's up to you to define how you're going to do that testing, and, showing them that what you're doing indicates that it is safe and effective, of course.
One question on the product. You say that one of the main features is being able to alert with the vital signs. I'm taking it that all that data is coming from another source and feeding into your device. Is that correct?
We're going to try to work with existing monitoring system prior to that.
Have you developed that integration system yet between any of the isolates?
So we have a simulated environment where we have had this product in like a MATLAB GUI form. So we haven't directly worked with the hospitals to be able to test it out, but we do have like it in a simulated format. So where if we're putting any of the vitals that are out of range, it is immediately going clear.
We have proposed this to, they're open to us trying that in the future.
Any more questions? Thank you very much. Our next presenter, Frog Skin LLC. Judges, are you ready?
Gymnastics judge to raise their hand.
All right.
Okay, I'm Brian Stewart. I am the founder and CEO of Frog Skin LLC. Our products, they help our customers quickly return to the activities they love, and we do this through comfort. We have about 3.5 million kids hurt every year playing sports. We're also seeing kids specializing in a single sport younger and playing year-round. So we're also seeing a rapid increase in the number of overuse injuries each year. Let's not leave out the old folks and the grown-ups. We also get banged up quite a bit as well. One of the most classic treatments, and everyone here has done it and everyone here has hated it, is where you get banged up and someone, even you, puts a bag of ice on your injury, or a gel pack or something like that. There are studies going back as far as the 80s and even some more recent ones in the early 2000s that basically associate immediate cold therapy with rapid recovery times, as much as a 100% increase or a 50% decrease in the recovery times. There have been a lot of folks coming out recently called ice haters, and you're starting to see this as a trend sometimes in the athletic community, but I will tell you, everybody's an ice hater. Nobody likes the stuff. We put it on, and within a few minutes, one application maybe, no 20 minutes on off for an hour, It comes off in just a few minutes and most folks are over it. I have a personal story to go with this because I first observed this when my own daughter was playing soccer. She played highly competitive soccer all the way into college on a scholarship. And I watched her and her friends. These kids were not slackers. They were serious players. And they would put it on for maybe 10 minutes, one application, and the bag was in the grass. So I started inquiring about it, and I was like, what's going on here? And she said, and her friend said, I will cut it off, I will pull it off, I will chew it off, but it is coming off. So then I actually started doing when we started doing our customer discovery and market checks on this stuff, we actually went to a D1 school in Virginia, talked to the athletic trainer staff, and we said, hey, we think if folks are comfortable, your athletes will like this better. Their response was, we don't care if it hurts. They're machines. Our job is to get them back on the field. I thought that was a little mercenary. You walk around the corner, you talk to the athletes, and you ask them, how long do you leave the ice on? And they say, till they're not watching. So what we learned was that compliance rates were incredibly low for the therapy. So the best therapy in the world doesn't work if people don't do it. And one of the best ways to make sure that people do not comply with therapy is to make it uncomfortable. So what our theme is, comfort is the key to recovery. So where did this come from? Like I said, my own personal experience. I've got a bunch of years. I am probably the age outlier here at this event. I've got a lot of years experience in mechanical engineering, system design, and materials development. So hook up in the laboratory, which this does not look like my laboratory that I did this in, and actually came up with a material-based solution, and the technology is in the material. This is the first form of it. It is a generic or a general purpose wrap form. It is an engineered material. This is actually a thermal composite. It has a lot of properties. It is very, very soft to the touch, so it's got a great tactile performance. It is incredibly elastic, so you get a lot of range of the degree and location of compression. You can actually localize it if you want to. The magic is in the powder material that's a part of this. It's a dispersed powder of about 15 microns in diameter size, uniformly dispersed throughout the material, but its property is it regulates your skin temperature to a fixed number during your therapy. So this particular version keeps your skin from dropping below 43 degrees during your therapy. 43 degrees is important because therapeutic range for cold therapy is skin temperatures below 50 degrees. 43 degrees is about the point where most people start feeling uncomfortable. So it takes you right down to that point and doesn't let it go below that. So we did a soft launch last summer, early in the summer, and along the way we picked up a couple of nice awards. We got the 2018 Sports Medicine Technology Award. This is actually voted on by a panel of orthopedic surgeons. And we also got a regional competition award for the Emerging Biomed Product of the Year. We're not going around hunting for awards right now, but these are the first two that we got out of the blocks. In addition to sports medicine, there's a lot of growing markets in other segments in healthcare. Clinical follow-up, we're getting some recent traction in the lymphedema community, believe it or not, mainly because of the compression performance of this. And there's also post-surgery and some very unpleasant clinical settings that we're getting some interest in. So we lined up against our competitors on 5 performance metrics that you can see there. And the industry standard is game ready, of course. You'll see this in your PT. If you go to a physical therapist, you'll probably see that in their clinic. But we're beating them on 2 to 4 of the performance metrics across the board. So our team, in addition to me, I have Lindsay, who is a marketing director. She actually does medical marketing in the Shenandoah Valley area. Bernd Haas, who is a business advisor, and Daniel Morris, who is also the incubator director at Reactor in Hampton. So we've got a great team of folks that are kind of helping out. Also, not on the list is a gentleman from Hudson Scientific who is helping us with FDA information. And we look like we're going to be adding an orthopedic surgeon who's going to partner us with an ankle-specific device. We also are working on our manufacturing on a local level. We teamed with an organization called Versability Resources out in Hampton. They provide job services and training for folks with disabilities. We taught them how to do product development. They are helping us with manufacturing development, and they are now our contract manufacturer. So where we are in this, we are actually in the commercialization phase. This product is actually available for sale. It has just been landed in 2 clinics locally, a podiatry clinic in Suffolk and Hampton Roads Sports Medicine in Newport News, and also in our first sporting goods store regionally. So with that, we'll be happy to take any questions. Oh, and I have demos. So who wants to be the guinea pig? Who wants to go first? Yeah. See, look at her. She just starts dodging. Okay.
Already cold.
So he's got a hairy arm. He's cringing right now. It will not stick to your hair. So this material sticks to itself incredibly well, but it does not stick to the individual skin. So you'll see a lot of range. I can also do a highly localized there and not tighten it up so much so it doesn't cut off circulation. Get to the end, simply tuck it under, and you are good to go. Now when we do the ice application, you're not done yet. So we'll do the ice now. So you'll feel it. It takes about 20 seconds. He's starting at room temperature. You can also start with it chilled. We have it in nice jars so people can drop it in a bag or in the fridge. There's also no gels or any goo inside, so it's a completely solid state material. So this one was cut down to make a little finger treatment for a kid. You clean it with pretty much anything you can think of. We use alcohol, soap, and water. If it gets really gross, you can actually clean it with a bleach and water solution. How's that feeling? Feels fine. How's that feeling? It's cold. Yeah, there you go. So that's the idea. So I've had it on with a thermocouple underneath of it for up to 2 hours, and it stayed above 43 degrees. We generally have seen people using it for anywhere from 20 minutes to an hour in the field. So now we'll go with questions.
So what's the IP behind it?
The IP is actually the material formulation. So we sought a utility patent back in August of 2017. We're still waiting for our first office action, but we're expecting that literally any day now.
So it's technology that you developed on your
Yep.
own?
Technology developed on my own, yes.
And this product came from Versability?
That one was manufactured at Versability, yes. Yeah. If you ever, you nodded your head, so have you been there before?
I haven't been there, but I know
It's
them.
back, where Theragas used to be made back in the clean room. It's right next to the Theragas site.
All right. So can you tell us a little bit about the revenue? Like who's buying this?
Okay.
How much is it? How much
So
money are
the
you gonna
price point is $27.95. That's a retail price point. We have a wholesale price point of $17.95 for doctors' offices. That gives them about a 42% margin. And so that's been, we tested that. We started at a lower number and worked our way up to that one. But right now, $27.95. We're selling it online through distribution channels like the clinics and sporting goods store are our primary, and also live events. So we've done a handful of like volleyball tournaments and things like that.
So, I mean, what do your revenues look like? Who are you selling this to?
So we did a pilot run last summer of 400 units. We sold 300 of those and comped the other 100 because that always happens. And we just scaled up production. We are now at 4 times our original production rate, and we just started that in mid-February. And so we have sold 200 since then. So we're looking at 8,000. Our total revenues right now so far since last summer about 13,000.
Can you talk about the 2.0, the 3.0 version of this technology? I still need the ice, I still need the bag.
You still do need that, yes. So the technology is in the material, it's in the thermal regulation. That particular, keep in mind, this is the first product. The IP is actually in the material itself. So there's a whole range of products that can be developed around that material technology. So we made that one simple and intuitive. Everyone knows wraps, everyone knows ice, everyone's very familiar with that. But there are additional development cycles, and we're actually working on an integrated version that actually has the cool component built into it as well. Right. That's a trade-off because it makes it bulkier. Anything you do like that makes it bulkier. so it makes it less agile in the field. So that tends more towards a more application-specific device. So we're working with, like I said, we're working with the ankle surgeon with ankle-specific devices, and there are a whole host of other devices that can be done. You saw the vasectomy one. That's not going to be a compression device. That's going to be a cold device. So that could be easily integrated.
Are there other markets, maybe in the pharmaceutical sector where they have to keep certain items in their supply chain at a certain temperature? So more of a business-to-business market opportunity?
There are, in order to function, it needs a warm source and a colder source, so it regulates the heat transfer. So there has to be a, like I said, like I told people, it has to have, for people you have to have a pulse on one side and something cold on the other. So as long as there are energy sources on either side, it would certainly work for regulating temperature. So there are other segments.
Right. Yeah, I'm looking at a business-to-business model for your technology, and I'm wondering if you thought through that.
On a B2B model?
Yeah, what businesses would like that 43-degree or temperature in their supply chain? Like, shipping cold chain technology is very important. And so how could this fit into a business model?
Anything that you would pack in an ice chest, you could use the same technology for. So if you wanted a very specific temperature, if you wanted it to stay a very specific temperature, then you could actually use this for that purpose. So to give you the extreme case, organ transfers, things like that. So we haven't marketed in that area yet, but that is a possibility.
Okay, I want to know if you're thinking through.
Oh, we're thinking all sorts of things. So lymphedema wasn't originally on a market. We're also working with a hospice nursing supervisor at Centera. She's actually doing some early checks on us for managing wound tears, especially in very late stage hospice patients. And there's actually a cost savings because of the money that they spend in bandages. And their reimbursement model is they get paid as a service, so any supply costs are not reimbursed to the facility. So anything they could do to save money. One of the big uses or big advantages of this is actually reusable. They're also looking at it for PICC line protection so people can take showers and stuff. So there's other applications. It actually seals really well, so it seals to itself.
And once it hits 43 degrees, how long does it sustain that temperature?
It'll stay that temperature as long as you got something cold on one side and something warmer on the other. So
let's say you refrigerate it and you take it out and you strap it onto your arm. How long does it stay at 43 degrees? Or
it'll stay cold for about 5 minutes all by itself. And then, like I said, it's not a heat storage device. If we wanted to integrate it with something that would absorb a lot of heat energy, then you could do that. But this particular one is just a regulator.
Are there any other materials like this on the market?
No, we haven't found anything. So the first thing you do when you start this, of course, is you do the literature reviews to understand the need and the science behind it. Science behind cold therapy is kind of erratic. We'll go with that. If you ask 10 athletic trainers the best skin temperature for cold therapy, you'll get 10 blank stares because it's never been an option. So there's a lot of undecided information out there, or a lot of questions out there. The one thing that is consistent is skin temperature for effective therapy, and then the goal of cold therapy, which is to cool the deep tissue about 8 degrees C. So those things seem to be pretty standard. That's done with time and temperature. And so one of the advantages of this is you can put it on. You don't have to cycle it on and off. You can put it on and leave it on for a sustained period of time. So you can get to that deep tissue cooling, which is a thing that slows metabolism rate and also which reduces cell death due to hypoxia. So we're looking to scale up. That's pretty much what we're doing. We're in production. We're looking to scale up production and also keep our production and our marketing kind of in sync. So you don't want to get in a deep backorder state, but you also don't want to choke off your sales because you are not marketing properly. We do. We have a $200,000 ask right now. And in particular, what that gets us is a full-time marketing department and a scale up, an additional scale up of production capacity. It's not hard to store. We can store thousands of these on a shelf, so storage is not an issue. and it stores just fine. It also likes to live in the freezer, by the way, if you have it at home. That's its favorite place to live, is hanging. It's just as elastic coming out of the freezer as it is at room temperature. Also, in case anyone asks, there's no latex, and there's nothing toxic in it at all. So your dog can eat it. It will not hurt them.
On the financial side, how much has already been invested in this?
So we've had a small raise of convertible notes for about $47,000. I've put in about another 30 of my own. So that's the total development, and that's including the material development, prototyping, MVP, and manufacturing development. So far, we've gotten off pretty cheap. But it has taken 2 years. I do, but they're very detailed. So what we have is we have cost of production, marketing, business management, all of those associated costs, and then we have 3 different sales success scenarios. All of them have a sliding scale of projections. So the bottom line is, though, even at the most pessimistic numbers, we are cash flow positive in about 19 months.
Any other questions?
No more volunteers to try it out? No?
Thank you very much.
Thank you.
Let's give a hand to all of our healthcare presenters. And judges, thank you so much for your time and your expertise and your advice, all of that. At this point, we're going to take a 20-minute break, and when we come back, we're going to have our next category, that is the products and construction category. Product is Aha Wrap. You can find out more about it at my table or inside your book. So we're going to meet the judges momentarily here. I think everyone's here who needs to be in this category. This is the product and construction category. All right, so they just left. I think we have to bring them back in. But if the judges can come back out, we want to introduce them one by one. If they can hear me, I'll go back and get them. Judges? This is live, you know. And these are our judges for our second category, product and construction. I am going to give you the mic one by one, and you can just kind of introduce yourself, your name, the company you're with, and what are you hoping to hear today from the prisoners?
My name is Tim Michalski. I currently work at Thomas Jefferson National Accelerator Facility in Newport News, Virginia. But I have 30 years background in engineering a variety of products from automotive to commercial to military electronics. And my interest here today is learning about the new companies, seeing what sorts of issues and challenges they're having, and opportunities to mentor and see what their needs are.
My name is Ann Hughes. I'm Executive Vice President at MPA Digital. We are a marketing and advertising agency. My first half of my career was in New York. I've been in marketing my whole career, so I'm looking to hear today from the companies how they plan to really identify their target market, how they are going to develop lead generation and retention programs to grow revenue.
Good afternoon. My name is Mickey Cho. I am one of the co-owners of Second Street Restaurant here based in Williamsburg. Also, we have a location in Newport News as well. I've spent I'm in my 34th year of the restaurant industry, and myself have done numerous startups of my own and invested in many other ones along the way. So I've had a lot of experience vetting out new products and projects, and anyhow, excited to learn more today of the ones that are going to present to us.
And I'm Austin McDaniel, work with Mid-Atlantic Energy. We are a natural gas asset management and commodities trading group. We started 3 years ago and manage about $2 billion worth of assets at this point. This is my third venture and the first which I would deem as financially successful. So my interest is learning some of your current execution plans and how you plan to grow your business, and add some of my experience and help you avoid some of the pitfalls that I have learned.
Hey, Blake Luce with Ferguson. I'm the director of Ferguson Ventures, our corporate venture capital and innovation group. Excited to hear of what the entrepreneurship ecosystem is looking like locally, how we stack up against national areas, Raleigh, Atlanta, different areas. Looking specifically for construction and construction technology, but also looking to see your business models, how you're taking things to market, and how you're going to grow your overall company.
My name is Alexander Barker. I run the Center for Entrepreneurship at Liberty University. Been involved in startups for a while, owned a bunch of different companies. Really focused on mentorship and pulling students and mentors and local community members to really build an entrepreneurial ecosystem, not only in Lynchburg, but all across Virginia and really the U.S. So really what I'm looking for is how I can help mentor you guys, and at the end of the day, hopefully connect you to the right people.
I'm Ben Cox. I'm the CEO of a company called Continental Disc. We make safety relief products for any fluid industries, refineries, things like that. We try to make sure they don't blow up. I also have spent a lot of time and work very closely with the private equity and venture capital community and helping them vet investments that they make. Backgrounds, engineering, heavy industry, automotive, aerospace, military and defense. So I've been across the gamut of lots of different things. What I'm looking for to see is a well thought out product, but beyond that, what's the multi-generational plan for it? How are they going to monetize that idea?
Judges, you can take your seats now. And the way this goes, each presenter will have 8 minutes to do their presentation, and then they will have 12 minutes of Q&A with the judges. So our very first presenter is Babylon Micro Farms.
Good evening, good afternoon. Thank you for having me. My name is Alexander Wilson. I'm the founder and CEO of Babylon Micro Farms. We are creating a simple and accessible platform that allows us to create a distributed network of remotely managed indoor farms. We do this because indoor farming allows us to remove the supply chain. We can grow high quality fresh produce at the point of consumption, and the network technology we've developed allows us to reduce operational costs. Removing the supply chain is a key issue for the sustainable future that we need to build. Over 40% of fresh produce ends up in landfill, and for every dollar spent on fresh produce, nearly 85 cents of that goes towards distribution and marketing. So by cutting out the supply chain, we're able to offer significant savings and reducing the environmental footprint. We empower growers to be right next to consumers, and this improves the customer experience. It improves the quality of the nutrition and allows them to save money and reduce packaging and processing. This is coming at a good time when the customers are demanding healthy and more nutritious food. This is an inexorable shift in consumption habits, and bringing farms to the point of consumption is really helping growers to meet those needs. One of the key technological innovations we created is an IoT platform that consists of sensors in the environment and the solution. This allows us to program these farms to create perfect growing conditions. We have a research relationship with the University of Virginia, which is allowing us to grow crops for the first, some of which for the first time ever hydroponically. I should have clarified, so hydroponics is growing crops without soil and water. We're able to grow crops 2 to 3 times faster using 90 to 95% less water than growing outdoors without the use of any pesticides or chemicals. And it is a transformative industry that is really reshaping the way that we grow a lot of fresh, perishable produce. And our network of farms allows us to record data from every farm within the network, learn from that, and create basically an intelligent platform that continually improves yields and reduces operational costs. Our farms are targeted at commercial food service locations, grocery stores, and institutional food service, where they typically have issues with seasonal price fluctuations, lack of transparency, very limited produce varieties given the crops that you buy in the supermarket or through distribution have been selected for shelf life and durability, not flavor, texture, and when you talk to chefs, they always have a list of things that they can't source. We're able to offer them complete transparency with live data and tracking on all aspects of the growth cycle, a seed bank of varieties that currently sits at over 200, and we can grow crops consistently all year round at a fixed price. The organic food market is significant. It is a $19 billion industry that has grown continuously for over 9% for the last decade. The North American farming market is growing rapidly and it's forecast to grow to $10.2 billion by 2024. The recent Farm Bill passed in December of 2018 created an Office for Indoor Agriculture within the USDA, and there are a tranche of new grants coming online at the end of this year, so we're really at a very pivotal time within the industry. Our prefabricated modules are really redefining the way that people think about the industry. These are kitted with this core IoT platform that allows us to program them remotely to recreate each specific variable associated with the plant's growth from the environmental solution they're growing. Using this method, we can ensure much higher quality and consistency in the results. By standardizing the prefabricated modules, we can reduce the cost significantly. These modules are designed to be standalone units anywhere up to thousands of square feet of connected production facility. As a result, we can work backwards from a host location to produce volume demand, tell them exactly how many modules they would need to meet that demand. The business model we're pioneering within the space is a remote management software service. We finance the hardware and then install these farms for a very low upfront cost. We've taken a leaf out of the solar power industry and we're really pioneering a produce purchasing agreement where we can get these customers on a 24-month commitment to buy produce at a fixed price from the farm. We can tell them exactly how much and the price of the produce coming out of the farm, which is typically significantly less than what they're paying because of the savings we're able to offer through without distribution. And after the initial 24 months, our margins jumped to 91% because the residuals, once we had paid off the financing on the hardware. And that gives each module a lifetime value on average of $95,880. So apologies for the formatting here, something went wrong compressing it. So this is one of the farms we built recently, the Bulls Head Resort in Charlottesville. They actually paid the upfront fee, but this farm is actually 3 modules, rather confusingly. We put one cut in half on each end. But this generates $1,200 a month in recurring revenue. They're saving a significant amount on that in the chart, which you could probably make out. That gives you an indication that the leafy greens, microgreens, and herbs have a payback period for the host location of anywhere from 24 months down to 6 months. So the savings are overall considerable, and the quality of the results is significant. Relative to the existing competitive landscape, we're offering something that is much more versatile and scalable than existing large commercial operators. Some of you may be aware the movement within this space is rapidly growing. And typically these large operators consist of 10 to 100,000 square foot purpose-built facilities. Those facilities can cost anywhere from $5 to $20 million to build. They take 12 to 18 months to plan and execute on. Whereas our individual modules, to do a 10,000 square foot equivalent, would be just 312 modules. We can build and install those in under 3 months. So this modular on-site solutions is an emerging segment because it relies on a lot of remote management and innovative technology, of which we're at the very forefront. Some of the others are shipping container farms, which, they have their limitations. But, as far as the current status quo within the industry is that hydroponics is seen as an incredibly complex, expensive, and generally not economically viable opportunity, especially at a small scale. That's why these massive scale operations exist. Through our technology, we're able to automate all of the aspects of the hydroponic growth cycle. Our customers will never have to learn anything about hydroponics. We remotely manage and control every aspect of it. All they have to do is plant and harvest. By prefabricating the modules and standardizing all of the components, we're bringing down the costs and increasing the efficacy of our data collection. And then we streamline the operations by providing an on-demand farming service, so they have access to our seed bank, we're able to program their farm remotely with the growth recipe that's tailored to that specific seed variety. We send everything to them, pre-seeded, pre-measured. All they do is insert it into the system and follow the steps on our app. As far as the defensibility of this concept, a lot of the key technology we've developed revolves around the autonomous nutrient dosing system. This enables us to bring the cost of goods down for these small farms from about $5,000 to around $500 for the technology package. They're designed to work with a QR code tracking system, which operates like a digital razor blade. So the farms will only operate with consumables and seeds that we issue them. The networked effect of these farms, they're designed and standardized, so they run as continuous research trials. For every farm we install, our data set is ever expanding, so we have a significant networked advantage. The more farms we have out there, the more we can learn about how they operate, how the plants grow, and continually improve our efficiency. And the QR code system allows us to create an automated inventory tracking system. So we're really like an air traffic control for a network of these farms, providing them with a service.
And your time is up at this time. Can we ask questions from the judges?
So I'm going to leave it there, but you can kind of see what we're doing. And just one last point. So we're doing $3,000 a month in recurring revenue now. Once we fulfill current orders, we'll be doing $10,000 a month in recurring revenue. It'll be by the end of May. If we fulfill our current pipeline, we'll be doing $40,000 a month in recurring revenue by the end of the year. Thank you.
Judges?
So where are you doing your manufacturing?
So we're actually doing potentially in Richmond or in Danville. So we've actually been making them ourselves with the help of local contractors in Charlottesville.
What's the largest scale operation that you have?
So that one of the boards that I just showed you is the largest one we have operational. We have contracts with Aramark and Sodexo to do pilots. One in UVA would be 5 times the size of that one.
How many restaurant owners have you spoken with about your ideas and full company kind of customer validation?
Yeah, sure. So we have 17 of our older products out with customers since 2017. We've gone through about 25 different iterations of the hardware. The core technology stayed the same. And what we've settled on is a larger production scale. You can actually see this is a home appliance in the bottom right that we developed. We put that on hold to focus on these and really build the whole thing around the cost drivers, because whether it's an Aramark or an individual restaurant owner, they just want to save money on high quality produce. That's what it came down to.
It seems like you've made a decision that you're going to provide the hardware as well as the software, but most of the proprietary piece that you're adding the efficiency comes with the software. Have you evaluated using that software with other competitors' hardware? Would that be an option?
Yeah, absolutely. It's definitely an option. Hardware is a means to an end right now. It's really very simple vertical racking and pumps and basic plumbing. So it's easy enough for us to do it, but it's certainly something we're looking into.
So how is your financing invested? I mean, with regard to, you've got a lot in technology, but you've got a lot in hardware and the core materials, the seeds and things of that nature. Where's the breakdown of how you distribute your investment in the organization?
So in terms of the investors in, I feel like that was multiple questions.
Well, I'm just thinking that you've got technology that you've got to develop and maintain and probably improve as you describe your learning as you go. But then there's also the hardware development and implementation, as well as the recurring expenses, seeds and soil and things of that nature, and chemicals.
Sure. So the breakdown for the $799 a month recurring fee, $250 of that is the financing on the hardware, which ends after 24 months. The COGS on that, the subscription is $69. So it is a pretty solid model.
What does your team look like?
Sure. So, sorry, this pitch deck is a little long for an 8-minute pitch, but so myself, my co-founder, we met at UVA. He's a biomedical engineer. Sam Korn joined us as an IoT and CS engineer. We're pretty aware that the execution risk on something like this is non-trivial. So we've taken some steps to break into new talent. Marcus DeVries has joined us as COO actually. He spent 20 years as CEO of a plastic manufacturing company. Peter Sangenberger was director of marketing at AeroGrow, which is the largest consumer hydroponics company in the US. And Carl McCoy is kind of plugging in on the chat. in terms of like customer outreach. So right now it's all pretty much direct sales. And we were able to raise $600,000 last year to build out the team and develop the technology file patents. We really haven't spent a dollar on marketing yet, so it's being called outreach by me and one other guy on the team. We're now raising to begin marketing and releasing these products because we've not really done any meaningful marketing campaigns other than cold calling.
But from what I understand, you're selling to the commercial producers who are actually picking up your distribution costs versus what they're buying now.
So the prerequisite to qualify the lead, they have to have their own consumption need or their own means of distribution.
When you look at your competitors in the hydroponic market, so once you're inside of the hydroponic market, how are you beating those other customers, competitors? When a customer makes a decision, why do they choose you?
Sure, so really it's about simplicity and variety. Like what we're offering is a very complete, tailored service that's designed for a lot of these businesses that have no interest in becoming growers. We streamline it to the point where this is as simple as them unboxing something. They're really just taking it off on the shelf that we provided rather than unloading it off the back of the truck and unboxing it. So we're able to save them a lot of money, give them a much higher quality product without any of the stress and a lot of the capital that would be required to do it otherwise. And relative to a lot of the other competitors are owner operators, we're not. We're a technology provider and a service provider.
And just because of my background in the licensing side, and it's just my opinion, I would encourage you to really look at what the business model looks like if you can become a service provider to the other hardware manufacturers. So if that's your core competency, just look at what that might look like.
Yeah, I would.
Where do you stand with the patent position? Have you gone offshore yet for any international patents?
So we have non-provisional filed, waiting on first office action. We have our PCT filed for international.
Who's your largest customer right now that is using your product line successfully?
Aramark.
Aramark?
They have a pilot EVA, it was 2 small models.
And so that pilot program, what would the size of their operation, what would that supplement their needs for outsourcing to a normal vendor? Like, is it 5% of their needs? What is it satisfying their need?
So right now, the 2 modules don't satisfy their entire need. Now that the pilot's been successful, we're in discussions to do this larger project, which would make them self-sufficient in the entirety of their salad greens, herbs, and leafy greens for the entirety of UVA in about just under 1,000 square feet.
Wait, okay, let me get that straight. So you can sustain UVA's campus on 1,000 square feet with all their leafy greens?
Correct.
I can see that. I just would be flabbergasted at that.
Yeah, well, relative to a field, we're able to produce about 64 kilograms off the same area versus 3 kilograms per year. So just to give you an idea, because it's vertically staggered. And that's a lot of where the software comes in. We're able to schedule the farms so they work in harmony, so there's a very consistent amount coming out at any one time. And a lot of the numbers really do flabbergast people.
But you said 1,000 square feet?
Yes, but it's stacked vertically, so the actual growing area is significantly more.
So what does that translate in actual square footage if you were to lay that out, not vertical?
So between 4,000 and 6,000 square feet, depending on what you're.
Okay.
And you're growing all year round, and because it's hydroponic, they're growing 3 times faster than they would outdoors.
But that's only leafy greens.
Then for leafy greens, most of your highly perishable ingredients, as in this slide here, one of the R&D pieces we're working on is the technology is agnostic to the type of crops, so we're testing strawberries, cannabis, and other berries.
So for Sodexo, what do they want this for? Leafy greens, or do they want to go into the peppers and fruit?
So for them, it's leafy greens at Dominion Energy's office in Richmond. So it just serves directly into the cafeteria. So yeah, there's a huge customer experience factor here. That is a big motive for a lot of people. But the cost drivers are there and the yields are there to actually significantly sort of disrupt the supply of a lot of their perishable ingredients. When you speak to a chef, like salads, greens, perishable stuff is a real issue for them. It comes, it's soggy, it's thrown out. It's a pretty common occurrence. So we're actually looking into augmenting farms, and we don't want to sell the farmers because it's a tricky market. It's not saying we won't, but in a lot of cases they can't grow these crops anyway. And if they can, it is only for certain times a year, so yeah, we might upset a couple of them. But for these larger institutions, they're typically not buying from your local farms.
Back to your slide on the progression where
Okay, apologies for the formatting. Yes, we were up to raise $600,000 last year, which you have a 1.5 million round at the moment with 1.1 million committed. It's closing on the 10th of May. And that will set us up to be cash flow positive by the end of Q2 next year.
So what do you see as your most significant challenges to growing as you've got it listed here? Is it competitors? Is it?
For financing and manufacturing, really our biggest issues up until now. As I say, it's been pretty intensive. We're a pretty big team developing technology. That's now where we want it to be, and it's really just a land grab, because once you get critical mass, we can really install these farms anywhere around the US very quickly, but it's just getting the capacity to be able to fulfill the orders.
Do you know if there's any sort of seed money available to you through grants or any tax credits for anybody doing farming on their property, as this would be known as, I guess?
Yeah, so we have a number of SBIR applications out at the moment around the core technology. There are a number of tax credits that directly relate to this, but I don't know off the top of my head. There are.
So if someone were to decide to implement your idea on their property, then do you know if there's any tax credits available for that business?
Yeah, there are. Most it's on a state-by-state basis. Like in New York, they now have new LEED and well certifications for different buildings. There's stuff like that from the state, and we help them take a lot of boxes on that front for sort of employee wellness and reducing the footprint of the building. Environmental footprint. Great, thank you. Thank you very much.
Thank you, judges. All right, our next presenter, transport.
Hello everybody, welcome. Thank you for having me. My name is Jeff Spangler, and I'll be presenting our mobile app transport. I have a live version of it here on my phone, so if you guys want to play around with it while we're talking about it. The app is live and available for download on the App Store. A little bit about myself. I'm currently a 25-year active duty Navy Special Operations member with Explosive Ordnance Disposal. I have to retire next year, so I had to decide what I want to be when I grow up. So thinking outside the box, and what we do technically in my profession is we're a force enabler, so we enable people to accomplish their mission. And a problem that I saw was package delivery, CEP market specifically, which is the courier, express, and parcel delivery market, which is currently an $80 billion a year industry in the United States, poised to grow to over $100 billion by 2025. So I was thinking to myself, what do I want to do? I want to help people get their product from A to B using something like the Uber and Lyft market, the way they just upset the transportation market. So came up with the idea to augment people from moving their product from A to B, because express delivery is extremely expensive. Typically, UPS, if you need something delivered the same day within your locality, usually starts around $40 for express delivery. Large or odd-shaped objects are tight. You've got artists that try and move their products around, so very difficult to package, very difficult to move. You don't have really a lot of communication with a delivery driver, so even though it is considered express, you're still, where's it at? It's supposed to be here today. Sometimes you're stuck in your office or at your home or whatever, waiting on that delivery that you absolutely need, and you don't know where the delivery driver is. Just on your tracking, it says out for delivery. That could mean the next 10 minutes or the next 5 hours. And our Our initial market that we're trying to go after is the general contractors. So a general contractor working on a job site, if they need material or product, they typically either have to go get it themselves or cut one of the people that they're paying hourly to go and do this. This is a very expensive proposition for the general contractor and construction market. Whereas now, with the advent of e-commerce, which is now outgrown brick and mortar sales, you can buy most of the stuff you need online through your mobile device. Still, you run into the problem of the final mile. How do you get that product delivered to you where you're at, where you need it, when you need it? So our solution is this mobile app where you can list the product on there for a price that you set. Every other app out there or method out there uses that algorithm that decides how much it costs you to get your product from A to B based off of size, weight, distance it's going, and how fast you need it there. I decided that that's archaic and we need to empower people in today's society with more options and more control over what they want to use. So you set the price. We have included the 3 top shippers currently in our app that has open API where it will give you the general price of their fastest means of delivery based off of relative size from one destination to the other. That shows up at the bottom of the app when you put in addresses. That gives you a rough estimate of how much you want to list your product for. Say that $40 express package UPS is going to charge you, you're like, oh, well, I'm going to pay $20. If it's more important, if it needs to get there, you want to entice drivers a little better, $15, whatever the case may be. With our app, you get direct communication through in-app texting currently with those delivery drivers, so you can give specific instructions, up-to-the-minute updates. We're going to eventually include GPS tracking, like in the Uber or the Lyft app, where you see exactly where it is on your app, on the mobile device, where your package is. So you'll know exactly when you're going to be here or what it is. We didn't include that in the initial launch because we have to have a minimum viable product, and everything you add into an app costs money. So we are kind of bootstrapping this along, as we haven't had a whole lot of investors to date, but it's basically just been friends and family and out-of-pocket expenses so far. The growing network it's a free app to download, so anybody that wants to use it as a customer, it's free to download. All you do is when you go to set up a delivery, all it's asking for is a credit card. We use Stripe as our payment processor, and we do a background check and DMV check on any of the drivers. So these are what some of the typical apps look like when you download the app. And that's the first screen you see is the one on to your far left. That shows you the current map and the current jobs available. Then you have 2 options. You either want to ship something or you want to be a driver and drive. If you choose to be a driver, you see the screen in the middle. It will usually pull up a destination of where you are, and then you add a destination where you're going. Our proprietary thing that we have is a sliding scale that says how far off your route you're willing to deviate. So you can slide that scale from 0 all the way to 50, and that'll show you available jobs in the direction that you're going. So now, unlike all these other side gigs out there that are people that are looking to augment their income, those take up your valuable time, which is the most precious resource you have. So you want to be an Amazon Flex driver. Sure, you can make money doing that, but they require a 3 to 4 hour block of your time. You want to be an Uber or Lyft driver? Sure, it works great as long as you have the time to dedicate to go where that person needs to go. A lot of times isn't in the direction that you necessarily go. With our app, you know exactly where it's getting picked up, exactly where it's going, and you know exactly how far off of your intended route it's going to work. You can use it the other way in the freelance mode where you just pick up packages and become a UPS driver yourself. So it works great in that mode too. And then on the far right, you'll see that is what a typical job looks like when you click on it. You see all the details, any specific instructions that are associated with it, and you agree to it or not, and back out, or you can agree to it and then link it to another job and so on and so forth. But this is our basic business model. Customer creates a job after they create an account. That immediately puts a pull on their credit card, reserving the funds, making sure there's available funds to pay for the job. Once a driver agrees to pick that up, Stripe will hold that money, and as soon as the driver delivers it, Stripe automatically diverts their portion to them, which is currently at 90%, and we only are taking 10%. This is to entice drivers to join up and to get people used to using the app. and then we get our portion directly from Stripe. So we're not keeping any of the books, so we don't have any bookkeeping. We're not keeping any PII information from customers or drivers. That's all being done through our background checkers and through Stripe. Stripe issues out 1099s to anybody that requires them for earnings, and all we do is take our portion. Our current marketing plan is to go to social media because that's the most bang for the buck right now. We are looking for revenue to support our marketing campaign. However, right now, with the funds we have available, the best way for us to do it is to target advertising on social media. This is our basic competition right now. Rody is the pioneer in on-the-way delivery. They founded 3 years ago, and they've closed round C with a total of $62 million invested earlier this year. Amazon Flex, there's another one that just started last year, which is Hitch, and then Ship It are two of the other typical on-your-way package delivery apps. There are several other ones out there, but these are the main ones.
And your time is up.
Thank you.
Questions from the judges?
How did the conversation with the general contractors go? Because I just know when I worked on them several years ago, most superintendents on the job site are a 50-year-old guy with a flip phone. So what was the feedback there just on?
Every single person I talk to on every job site, and I have numerous contractor friends, love the idea, and most said they would pay up to $40 to have either material or a specific tool they need delivered to the job site. I mean, I've yet to run into somebody that, hasn't thought the idea was fabulous, because their distributors are either the products they're using specifically could be if you're in the tile industry or in the roofing industry, whatever the case may be, all the way down to individual tools that you can buy from Home Depot, Lowe's, Fastenal, stuff like that. All these retailers have the ability to buy their product online, or if you have a customer account, buy it on account, and simply supply the driver with the information needed to pick it up and then deliver it to you.
What's your predicted split? You're at 90-10 today to get drivers. What are you?
Once after we reach our initial goal, which is 1,000 drivers delivering approximately 20 packages a month, we're going to start bringing on new drivers at a 70-30 pay scale, with the ability to move up in the pay scale on a quota basis. You complete X number of deliveries a month, you'll move up to the next pay scale, fail to meet the next month's delivery quota, and you fall back to the previous year. You'll never earn less than 70%, but you'll never earn more than 90%. Obviously 90% is what we've targeted. The majority of our target marketed drivers say that they would do a job for, and our target market drivers are ages 18 to 54 with a median household income of $56,000, which in the Hampton Roads area, that's approximately 1.3 million people every day that get up and commute to work.
How many deliveries have you made from say a distributor to a general contractor or a job site in target market?
Only a handful, because we've just recently, earlier this month, completed our beta testing trials, where we've just had friends and family and acquaintances using the app to do these things. People that I know would, hey, I'm gonna go to Lowe's, I'm gonna help you out and try out your app, I ordered this thing, and we have a small market of drivers. We have about 25 drivers in the Hampton Roads area right now that are dedicated to picking up anything that shows up on the map. So nothing but positive feedback so far. We are in talks with two corporate entities in the Hampton Roads area to augment their shipping needs with our app. So one of them is currently has a $9,000 a month UPS bill alone, and they provide a lot of support to the city. I'm not sure if you are aware of Atlantic Heating and Cooling, and then one of the local surf shops, WRV, we're in talks with them with supplying their e-commerce shipping.
How do you overcome, say I was at a job site, I needed something from Lowe's, go online or call, put in the order, they're going to be checking IDs, purchase orders, things like that. How do you overcome that through the app?
Home Depot specifically is open to how to solve the final mile product problem. I've met with corporate They're partnered with Rody right now, so Rody is a direct vendor for them to be able to pick that up, and it's proprietary within their API system. So once we show them the ability to scale and meet their demands of their of the area and region stores they're at, they're more than willing to partner with us to include us in their API to be able to provide that information to the drivers once they accept the package. Once again, the drivers are all vetted and everything's tracked. We provide up to $300 currently per shipment for each job. Rody is offering up to $10,000, but they're underwritten by UPS Capital, which is UPS's insurance that they own. And talked to UPS as well while I was in Hampton or in Atlanta, and they're willing to underwrite us once we show a proven track record of performance.
So how are you different than your competitors again?
We are the only app that allows you to name your price. So other apps out there will allow you to list a product from A to B. They tell you how much it costs. You'll see, it's going on the route. I haven't seen with Rody, I haven't seen an ability to deviate off of your route because I'm signed up as a driver on Rody, and there's no way for them to show you a job how far off your route you're willing to deviate. All it does is list all the available jobs, and you're up to you to decide whether or not you want to pick it up on your way or not.
So how much do you think it's going to cost you then to educate the market about your app compared to everyone else?
It's very user-friendly, and just clicking through it is pretty self-explanatory. Once again, that'll be in our direct marketing. Through talking with other advisors and small business owners in the Hampton Roads area that I've networked with, we figure we need approximately $125,000 a year marketing budget to reach our goals for that. Just adopting a new technology, but with the youth these days, adopting new technology is pretty easy.
Two quick questions for you. One, so you said you're a driver on Rody, so how many deliveries have you personally made for Rody or your own company? And then real quick too, what examples of success have you seen for name your own price business model in the industry?
I've collected 2 baggages. Rody's also partnered with Delta for delivering their late or lost baggages to their point of destination. So I've delivered 2 from the airport to their destination. It's very simple. Just go and pick it up. Hey, I'm here to pick up this bag and deliver it to this destination, and gotten paid for doing it. The second question was the success for the name your own price. Everybody that I've talked to they really like that. It's going to be an adoption issue that people have to get used to because it's so ingrained in everybody right now that they just pay what they pay for shipping. I mean, Amazon has done a most fabulous job of convincing people there's such thing as free shipping. Amazon in 2016 made $8 billion on their shipping industry. However, they paid $6 billion to run that industry. So they made a $3 billion profit on shipping alone in 2016. So no such thing as free shipping. Once you get people to understand the fact that they have control now over how much it costs them to ship the product from A to B, and that's why we included the cost comparison within the app to show people how much it typically costs to go using traditional methods and the ability to set your own price. We tried to look into getting that patented. Very difficult to get a slogan patent. Progressive. Had to work, I think it was 7 years. It has to become synonymous with the name of the company before you can patent it. So name your own price insurance is synonymous with Progressive, so they got a patent. Something we'll have to work towards because nobody else is offering that currently. So as long as we can make that synonymous with our brand name, then we'll be able to patent that, saying name your own price shipper.
What's your geographic growth plan?
Right now, we're only concentrating on the Hampton Roads area as far as marketing due to budget constraints, but this is a national product that everybody can use anywhere. I mean, shipping is a worldwide issue. That the final mile, targeted and trying to be finding interest for. You notice just in the last 3 years, between Walmart, Target, all these other companies that, even grocery stores, are offering the ease of picking up your product, ordering online, pulling up to just a pull up and say, hey, I'm here, and they'll bring the bags out to you. Target will deliver your product to you within 48 hours, things of that nature.
So what's your value proposition for drivers then, since you're...
For drivers, it's, you're going to make a trip from A to B anyway. Using this app, potentially once the jobs start becoming more and more prominent, we hope to get to a position where every time you get in your vehicle to drive from A to B, you have the ability to earn money now. Because driving from, like I drove from Virginia Beach to here, the corridor from Virginia Beach all the way up to DC moves approximately, I think it was, the number I looked up was, it was in the low billions annually, just that corridor alone. So everybody that makes that trip from DC that either lives in the beach or the Hampton area every day now can potentially pick up a package or two, drive, and offset either the price of gas or maybe the whole price of your vehicle. So that's what our intention was, using the app with A to B, putting in an address, and I only want to go 2 miles off my route today. It'll only show you the jobs that match that criteria. You open it all the way up and you see all the jobs available.
Do you have a sense as you expand geographically of, and you mentioned the $125,000 marketing budget, but what does it take for a critical mass point of drivers to where the user experience is at a point where you'd be comfortable with in a specific geography? Because say you establish yourself in Hampton Roads, but anybody can use the app. In Richmond, somebody throws something out there for pickup and nobody shows up.
That's a fundamental problem that Uber faced, because Uber launched in New York, and then I remember when Uber first came to our area, we were currently using Metro Scoot if we wanted to go out and party on the weekend and not suffer the consequences of a DUI. So when Uber first came out, you would download the app and request an Uber, and sometimes you wouldn't get one at all or be waiting hours for one. Now you can go almost anywhere, download the app, and have a ride within minutes. So that's just through intense marketing, and once people understand the idea that they can now earn money at an even less expense of their time. I've talked to every Uber and Lyft driver that I've rode with, and they said, absolutely, I'm download your and use it.
And there's a pretty well published how they changed their strategy from that first experience to now how they handle markets. I encourage you to look that up, and it has some good stuff.
Absolutely, thank you.
Thank you so much. So our next presenter, Andromedy. Did I say it correctly? Yes. I'm stressing it out.
I can send it to you if you want.
All right, as my co-founder sets up a little video for us, just to introduce myself. I'm Brittany Kendrick, this is Xavier Henderson, this is Corey Salter. We are founders of Hydronomy. We're hoping to provide or present our startup, but then also get some feedback as far as guidance, mentorship, and as well as funding for research and development. We'll talk more in detail about that.
All right, hi everyone, thank you for having us. So we may not notice it here in America, but freshwater access is dwindling worldwide. And we are here to provide a solution to that matter with Hydronomy.
So Hydronomy's team consists of 2 technical co-founders and 1 non-technical co-founder. Myself, I'm a civil engineer. I specialize in water and environmental resources. Corey, he is a political financing strategist that is specialized in progressive environmental issues. And then Xavier is an aerospace engineer who is particularly focused in systems integration and manufacturing, hardwaring, but most importantly, he is a ball of laughter.
So the problem we are tackling is water scarcity and water security. So scarcity is more related to the access and availability, while security is related to, the quality of the water.
To address this problem, we have created an atmospheric water generator that is solely powered by solar energy.
So the way it works is, obviously, solar energy is powering the system, and then it allows us to capture moisture in the air and converts it into water. But then from water form, it is filtered through a series of medias in order to get clean drinking water that's approved by EPA standards. I did have a video here, but you know, it might take a little, we'll just keep going, so don't worry. We'll show the video, it's no sound behind it, we'll show it during the Q&A, and that's fine, but
So while we know that this technology already exists, hydronomy values environmental conservation and water autonomy. So most decentralized water sources use a B2C marketing strategy, while hydronomy, we're looking to implement a B2B and B2G strategy, and we'll do this through a water advocacy campaign.
So in 2017 and 2018, we evaluated the prototype for water quality output and production. So this summer we will continue R&D, however, we're focusing on manipulating our water filtration system and optimizing our energy consumption. So through research, we have identified a critical sample market in Flint, Michigan. When Flint, Michigan had its water crisis, the government appropriated $329 million for rehabilitation efforts to help the city. However, they only reached half of the residents. Now, if hydronomy was to exist, we could reach all 39,000 of the households in Flint, Michigan, and it will only cost $129 million. And then as for water quality, we are superior when it comes to EPA standards. And in comparison to Flint, Michigan, we are superior to them. And not to cause an alarm, but when it comes to Williamsburg, Virginia, yeah, we kind of better than them too. So we take a high, we care about water quality, and we do the most when it comes to testing our water.
So obviously this is definitely beneficial in domestic markets, but then we start thinking about internationally, you have developing countries that are already in the position of accepting decentralized water generation units, such as like very remote mountainous regions of Peru, as well as in a populous city like Cape Town, South Africa. So part of the customer acquisition plan is first we want to launch a water advocacy campaign. So first, just building backing from people like you and I who understand what is going on with their local water quality issues, as well as understanding the economical hardships cities are taking on because of federal infrastructure is not matching or exceeding the expectations to improve current infrastructure. Then from there, by the end of summer, we want to make sure that we'll hope to manufacture between 3 to 5 units so that we can apply onto family, friends, or households in order to collect data, validate, and eventually launch into a pilot program that can scale into a contract with any type of city or municipality as a water provider. So in summary, we've analyzed our competition, and one thing that I think we are thoroughly understanding of who the true customer is as you can see, population continues to grow, whereas water use is beginning to drop. And that's because people are understanding like conservation tactics need to be adhered to. However, federal water funding has been underfunded for the past 10 years. It's a bit, has been underfunded for the past 10 years, and knowing that like aging infrastructure is a serious issue, and the federal government has continued to like underfund this aspect, we find that municipalities are carrying this heavy burden, and eventually it's being passed down onto homeowners as cities are adopting smart water meters, which are too smart for aging infrastructure. So recognizing all of these like gaps in the market and how they can be a bit exploitive with current existing or smart technology, Hydronomy hopes to deploy these services and these units in order to enhance public health for residents, as well as minimize the cost that is associated with ripping up a pipeline or maintaining water infrastructure. And in summary, I think our team is most competent and most excited to do this because we have a lot of background in engineering as well as in understanding public policy and strategic partners that can be influential in deploying and serving us and you and myself. Thank you.
How does it work? So you gave the sales pitch, but you never talked about the product.
All right, okay, yeah, true. Sorry, we're pulling up.
So we have,
Do you have a prototype?
yeah, we have a video of the prototype, and then we can show you.
Can you click on that? Is that a link? You see it says backup link? Can you click on that?
There's a mouse.
Or I click on it?
Yeah.
See a mouse? Oh, God, it's slow. It's slow.
On the keyboard.
But it's still moving.
So you talked about a vast array of, cities and domestic and international. What is really your target market, especially starting out? Where is your focus going to be as far as what you've get your product up and running? Who would be the target market for it?
Okay, so right now our target market is definitely Flint, Michigan, and we want to make it where it can help multiple people. So we would want to go to Flint, Michigan. We would want to go to Peru. We kind of want to diversify the areas. For example, we did testing in New York City, then we moved to upstate New York, and now we're moving to Jacksonville, Florida. So we kind of want to target different areas at the same time so we can see how our system works.
So, all right, let this thing roll. So our current prototype Okay, the current prototype has a dehumidifier, and it is entirely powered by like solar panels, as you can see. Yeah, great. So this is our like MVP, our minimum viable product, obviously. And so it is then, once the moisture is captured in the air, it is converted into liquid form. It is ran through this current like Zen water filtration system that has like a 0.1 ceramic micrometer, as well as like 5 different mineralization mediums. And then as you can see, the battery packs for the solar panels, and then eventually you'll see like the actual solar panels. But that's our current prototype that we'll be manipulating this summer with like optimizing the energy use with like relay switches, which is like his realm, and I'll be manipulating with the water filtration portion. So finding like passive biomimic filtration mechanisms that can be applied rather than using this very expensive as well as mechanical, which is potentially able to fail technology.
So your target customer, they're not the municipality themselves, it's individual homeowners that want to privatize their water creation?
No, that is currently what's being, what's on the market right now. We are focusing on, as our target customer will be cities and municipalities, because it's expensive technology that is already expensive, but that's already existing. So like homeowners in California who are traditionally found with having deprived of water access, right? Or being restrained from the city, but when you can water your lawns and whatnot. So that's not necessarily who we're targeting as homeowners, no. They'll be the final beneficiaries of it, but who we're targeting is cities. There's no other disruptive technology or even new disruptive technology that's creating another source of water for cities. We're still relying on capturing water from surface water or groundwater, cleaning it at a centralized source, and then distributing it out to households. There's no other new disruptive technology that's looking into that lane.
So the creation, when you move past prototype, the creation of the water will happen at the municipality's plant or at the home?
At the home. And it will be attached to the hot water tank, essentially.
So what is the cost per ratio per yield of gallon of water, or what, back with beverage napkin calculations have you done thus far?
Yeah, so go to after slide. I think I put it in there. Nevertheless, water for a homeowner is particularly cheaper here in the domestic, in America. However, the cost associated with operating and maintaining a water treatment facility is expansive. It's I think the best analogy I was able to provide was on the slide with Flint, Michigan, and how Flint was only repairing a force main that was priced at $2 million, whereas that is not necessary for a hydrology, and that's a cost that's assumed by the city and not necessarily by the homeowner, well, indirectly through the homeowner, but that is not that's the city's taking on that debt. It's not directly towards the consumer.
Yeah, but if I was in the municipality and asked you the same question, what's the answer?
I don't have it, I'm sorry.
Okay, all right, that's good.
Because I'm just trying to understand the model, so they'd be smaller systems, but they'd be located at the individual home sites?
Yes.
As opposed to a centralized water processing and distribution system?
Yes.
Does anybody on the team have experience selling to municipalities? And then the second part is, whenever you guys tested in New York and some of the locations you mentioned, were you in conversations with the municipalities, or were you just in this?
Well, no, we weren't.
No, we weren't, but you'd probably be the best person to do that.
Can you repeat the question?
Yeah, so the underlying question
Yeah,
is
we don't have
selling
any experience selling to municipalities, but I think I bring that experience with the different relationships that I may have with, I work in the political space, so I have a lot of different connections with members of Congress. I've worked for a few mayors around the country, so that's where we think that we have those relationships to put us in the room to have those conversations with these municipalities.
How many of these units are on the market today? Homeowners have?
It's kind of a complicated answer. So the existing technology or existing companies, one is called Zero Mass Water, another one is called Water Gen. Now I've individually reached out to these companies to find out how much are they charging for their unit, what are just wanted to understand what my competitor is doing. It sounds like they too are in the R&D phase. They're very tight-lipped. They just want to see if you how many units you want to buy. And as of right now, they've been participating in expositions that are going on all around the country about water crises and just demoing their one system that they've manufactured. So I can't tell you much besides what I can find on Crunchbase and how much they've raised in their seed fund.
How do you defend against them just selling to the municipality if they're handling the product side?
Yeah. They're not selling to municipalities.
But what do they decide to? So how do you defend against that?
So one thing that I have noticed in how they're positioning themselves to create a pivot or probably leverage a municipality contract is by emergency operations perspective. So we will come, WaterGen has provided 2 systems in remote regions of Africa to provide water for emergency purposes. So that's one way, but I think what they fail to understand, and I think our secret sauce is to make sure that we build the water advocacy campaign so that we don't have to do the selling. The people who understand the importance and are educated about water scarcity and security, that they can advocate on our behalf. So it's no longer a thing of the municipality needs to have a meeting with me. No, the community has already asked for it. You should be soliciting from me. Does that make sense?
Is there any intellectual property tied to your system? What was shown in the video seemed like off-the-shelf products that were put together with the system.
that's what we're hoping to develop this summer with R&D, whatnot. So manipulating, like recoding.
I guess. So one of the things that I mentioned was energy consumption. So I want to be able to sense the system and figure out how much energy the solar panel is putting in and how much the system is using to figure out, hey, do we need to change around the wires, change it from parallel to series, like if you saw how the batteries were set up, they're in series. But using that with Arduino's coding's super simple. I can get data on all the electricity, and then also wanting to use Arduino's to look at the temperature and humidity and have all this stuff being calculated at every point of the day, so then we can use that to better our system. And that's what we're doing this summer, like she said. We're also going to be introducing new filtration things into the system. So right now we use the Waterzen's filtration system, but we also want to do reverse osmosis, which we already have, and use UV lights.
Yeah. So there's understanding the existing mechanisms or technology for like the water filtration portion, but we'll be designing like a biomimic form of this. So like, for example, seahorses have like UV rays in their eyes, fun fact, but that's something that is synonymous to how like a UV light can be utilized, but it can be manipulated and designed accordingly.
Why do you need the municipality? If you're not using any of their infrastructure to take the water to the home, why not go direct?
I think it's a lot to ask for a homeowner who knows they're already spending $40 every month to, hey, you should purchase this $3,000 system and you'll have water for, when we think about someone that does not have disposable income to purchase that, that's not. And then also to know that we need to create a culture where water security and water scarcity and water education is rooted and prioritized by the federal or the city or the state governments. Because if we start letting people do it, then who's to say that like it's dwindling fast because we're not aware of what we're using our already existing resource right now. So it's more of a culture thing.
Do you think the lowest hanging fruit is the domestic market in the U.S.? And I understand Flint, Michigan, and some of those are not necessarily outliers, but extreme cases in the U.S. Have you looked at going straight to the second and third world countries where there's a much greater need? They don't necessarily have the long-term municipality support and are looking for new alternatives that may be more cost-effective.
Yeah, so I've had the opportunity to travel to Peru. I've been in Lima as well as Ocopada, and these are like particularly remote areas of Peru as well as in Cuba. And then I had the opportunity to go to South Africa and like fully understand how developing countries are much more in need, but there is also a fundamental issue with international policy of who is prioritizing water and who is going to be delegating or regulating this source. So that seems like a more difficult feat for our current skill set, but I know we're very much cognizant of that, and I think that's what we thought like domestic would probably be a great first entry point before we go further and build those relationships to accomplish that.
Time is up. Thank you. Thank you for joining me.
Thank you.
All right, our next presenter, Linked Leads. Hi, everybody. I broke it. What do I do? Which button moves it? Here we go. So here's the fun part when you run a technology company, but can you work the slides? Ready? Am I going the right way? Here we go. Okay. My name is Gretchen Law. I am the CEO and co-founder of Linked Leads. We've built a platform that matches service businesses
with their key decision makers. Think like a dating app for business-to-business sales. Some of the industries I was talking about, oh, this is on here. Oh, this is fun. Okay, well, the slide deck didn't work. Some of the industries that we've worked with so far are commercial insurance, finance, a lot of recruiters, really anything where the key decision maker is like a CEO or a C-suite person of our management. It all started roughly 18 months ago. I was running Rebel Sales Method and was hired to come in and rework a sales strategy for a lady who ran a boutique recruiting firm. She recruited like C-suite people in the tech industry. She found all of the job openings and the people on LinkedIn. While I was there, she gave this system to a friend of hers who had just started out as a digital marketer. She was like designing websites and stuff. She was billing out like $2,000 to $3,000 a month, and inside of 60 days, she had over 10x her business. She had a 90-day wait list for clients, but had hired 5 new people. And I looked at him and I was like, this is amazing. You need to be doing this. I spent 8 years in corporate sales. I spent the last 6 years working with startups. I'm married to a sales trainer. Like, I've never seen anything like this before. So we jumped in a year ago next month, actually. The thing is that the business-to-business market in the US in 2018 was $9 trillion transacted on the internet. Of that, 1.6 trillion was new business. It doesn't take a very little piece. You know, all of our clients, they know they need to do digital marketing. Right now, most of them are trying to find clients the same way that they have for the last 25 plus years. They're networking, they're mining for referrals, and some of them are seriously still cold calling. It's crazy. They all have a friend or like a niece or a cousin or somebody who told them, you need to do digital marketing. So they jumped on Facebook, they started putting money towards boosting posts, they started driving like Google AdWords to their normal website. They had no idea how to measure return on investment, and they came to the conclusion that digital marketing doesn't work for them. And the truth of the matter is that nobody's hiring a litigation attorney on Facebook. That's not how this works. So this is what we've done. You guys want to see it? Yeah, right? Hopefully this part works. Oh God. Here we go. All right, so this is all running real time off of LinkedIn. Okay. Some things I want to push on here. You do not need a premium LinkedIn account to make this work. As you can see, the 1 month statistics, we've talked to 4,000 key decision makers in a month. And we've had 346 conversations with them. Tried cold calling that in 2019. The way it works, you come and click the search button, and it pulls up this box. Okay, you can type in kind of whatever you want. For this demonstration, we're using HR consultant. A lot of our insurance agencies and our recruiters, those are kind of their contact. You can filter by location, which is really key. Like, say your licensing is only good in California, we can target there. If you're looking for clients that are just in your backyard, you can use your zip code. Industry, obviously that can work. Company, that comes in fun. Some of our clients have figured out that they can target their competitors' employees. And they make good candidates. And then of course, like title, that's important. We add them to a connector campaign, and it brings up a sample list here, so you can look and make sure like these are actually the people that we want to get in touch with and talk to. And then it puts them in this, what we call a connector campaign. This is all custom messaging. It's set on timers, a little like what an email drip campaign does. Some of the key things that are nice though, because it is all custom, we can become compliant if there's any like state or federal laws we need to go with. And we test everything, absolutely everything. So we test a lot of this A/B test messaging. This pulls all of the messages off of LinkedIn, so you can go and answer them and look at the history and all that stuff. These are the analytics that we run. That's one of the biggest things that sets us apart, because you could, in theory, hire somebody offshore to cut and paste for you, like an army. We're running analytics just like it's an ads campaign, but there's no ad spend. Okay, so we're looking at how many connection requests are accepted. Fun keynote, nobody reads those little messages that you send on LinkedIn when you're trying to connect with them. And then reply to other messages. So we're looking at like what message is resonating. Are these people actually looking? We'll test it against geographical area. Literally anything you can think of. Traction. So in 2018, we put just under 200 companies on this system. we're growing like crazy. We did that revenue in quarter 1 of 2019. We've bootstrapped this whole thing. We're doing a pilot with a $300 million staffing agency for quarter 2 right now. Kind of the challenge is that this was built as an agency tool for us to be able to manage things. We're turning away business because clients want their inside sales reps to be able to get in here and look at it. And for safety and security reasons, we can't. So that's what we would do with any money that we raise. And we're kind of at the point now where we can continue to bootstrap, but like how long is that going to take? And how much faster could we go? So that brings us here. We know that we are ready to play with the big companies and step on a big stage. So it's time to stop hanging out in the garage. Who wants linked leads? Judges?
What's your ask? What are you trying to raise?
$250,000 in exchange for 10%.
How far will that get you?
Right now we're building out our development tool. We're at about a 9-month runway. We'd like to hire more salespeople too. I'm doing all our business development. My co-founder is doing all of our operations stuff, and there's only one of me.
Remind me how this works again. Is if I'm a customer of Linked Leads, is this a portal I'm using on LinkedIn, or are you providing a service for me?
Well, right now it's a service. So you would come and say, hey, I've got an inside sales team, we want whatever your target is. You tell us, we plug it in. It's very transparent. We're plugged into the back of LinkedIn's API, so you can see all the activity on LinkedIn. The problem is we're doing massive amounts of activity and people are losing things. So I'm like paying people to manually go in and screenshot, like, hey Bob, when did you call you on Tuesday? Like, how come you didn't call him? He wants to buy from you. There has to be a better way.
What was the revenue? Like, the numbers?
Sorry, okay, so we are for quarter 1, we're just over 70,000. We're on target for April,
So
probably about 30.
So you're trying to get it to a service to where you don't have to do all the heavy lifting, and you can give them a solution or a software, they can do it.
We want to pivot more into like a software as a service model, yes. Some of our clients, to be transparent, like we work with a lot of big corporations, they don't want to play with the tool, but they want to be able to see it, if that makes sense. We work with a lot of recruiters and like the boutique firms, they're tech savvy enough, they want to get in and do it, but we've worked with some like big insurance agencies and stuff, they don't care how it's done, they just want it done.
So, and you said you had 200 customers?
Mm-hmm.
So how many more customers can you get doing it the manual way?
Well, great question. In the beginning, to be fair, we had a retention problem, so that was an issue. Also, we were teaching people to do it, which again, we figured out they don't want that. They just want it done. We could probably double our client base right now with our existing capabilities.
What's your break even? How many customers?
We're already profitable, so it costs us about $453 to acquire our client. The problem is we're looking on taking a lot more like development costs as we move into a product, and so we're looking at like, yes, we continue to bootstrap with our monthly revenue and make that happen, but you know, if that gives us 90 days or 120 days before we're ready or whatever, and then the time to pull it out.
So you said you had a retention problem. So how long has your longest customer been with you?
10 months.
And you've been open how long?
11. Like, not all of them were leaving. But in the beginning, we were doing a lot of analytics, and we were making the tweaks, but we were not being transparent with our clients. So it was really easy for them to be like, this isn't working. But it really was, we just weren't being transparent about it. We fixed that.
So what is your pricing model?
We bill out quarterly, so $3,500 a quarter if you're going to answer the messaging, or $5,000 a quarter if my team's going to do it.
Where are you doing your coding? Who's doing the software side development?
Great question. We have a technical advisor who used to be at Ferguson, Joe Murray, and then we're partnered with a dev shop that's in Austin, being launch partners. And we actually already have the click-throughs of the recent version, it's just not really yet.
So 250 will get you 9 months, and you said you just want to scale. What is that? Just your pre-seed? Are you going to go
Yeah,
fundraising?
Yes, that's the plan. Like as we move more into it, you know, we've got like 3 clients off the top of my head. One had 100 sales reps, one had 168 sales reps, like ready to come when we are ready. We're just not. We have good problems.
Who do you consider your biggest competitors?
I mean, probably the obvious one is LinkedIn, because we're using their platform. But the plan is, as we continue to develop, to be able to deliver other ways. Right now, we're kind of band-aiding a couple tools internally for our marketing that works really well, like retargeting via email and stuff like that. There are a couple Chrome extensions that do this for $20 or $30 a month. The big companies that we're working with, they don't want a Chrome extension. First, it eats all their computer data, you gotta be manually doing it, and there's no analytics behind it, so they're just spamming people.
What would keep LinkedIn from providing this next level of service and just culling you out entirely?
Well, they've been doing it a long time, they haven't done it yet. They have a similar product called LinkedIn Recruiter. I don't know if anybody's familiar with that. I mean, you can pay up to $20,000 a year to have that level of service on LinkedIn. It doesn't provide any of the analytics or anything. What we've seen, there's really nothing in the B2B space that does any type of marketing. So there's a lot of B2C stuff, but we'd like to move into that.
Is LinkedIn so Salesforce and Autodesk and different software companies want to become a platform and have other companies build on top of?
Yes.
Does LinkedIn do that, and are there other examples of startups building their business off of?
Yes. I think it's probably less common than Salesforce, but they have a lot of partners that they deal with, and we have looked at becoming one. We just honestly haven't yet. But everything that we're doing, they have open APIs.
Okay. So $250K in 9 months gets you the software, or it just allows you?
Yeah. And a couple extra salespeople, and moving down that path. Yeah?
Any other questions?
Awesome. Well, thank you so much, guys.
Our next presenter, 3D Buddy Cats.
Hi ladies and gentlemen, my name is Casey Taylor. I'm the CEO and founder of 3D Buddy Caps. When I was growing up, I had a major problem with anxiety and depression, and that mainly took place at school, because I always felt lonely without my favorite toy or that teddy bear I always wanted with me. According to psychology today, that special toy or teddy bear can reduce anxiety and reduce depression for kids' development. This is when 3D Buddy Caps comes into play. A kid will be able to customize their favorite toy or animal into the bottle cap, and they will be able to stay hydrated and comfortable. So, we already have a manufacturer lined up for our bottles. All of our 3D Buddy Caps will be able to fit on this bottle. It's overseas and not China. We have done testing. They let this photo right here, this cap, set for 48 hours, no leakage. They also sent me a video of them shaking it up. Nothing came out and everything was fine. Our market research. We believe our target market is 5 to 14-year-olds, but throughout our market research, of 200 plus adults, we have learned 60% of adults are also interested in our caps. Maybe their pets, their favorite quotes, or flowers. According to TMR, the global reusable water bottle market is supposed to hit $10.19 billion by the year 2025. Another question. So, parents are willing to pay $15 to $20 for our water bottles. Our last question in that survey was, how much would you be willing to pay if Billy wanted a horse with a cape? How much would you be willing to pay? The average number was $19, how much extra they would be willing to pay for that customization. Q&A capital. Right now, 3D Buddy Cats actually has a Kickstarter going on to hopefully we can receive funding. Revenue streams. Our bottle, this picture you saw, $1.90. For the user design, $1.90. For the cap, $2, and for the straw with a cap attached, 70 cents, which leads us to a $4.10 for production. Mass produced, and what I mean by mass produced is, for example, if we can get license agreements, like for example, Steph Curry, if we can put Steph Curry on one of our bottles, that would be $1.90 for the bottle, $1.50 for the cap, and 70 cents for the straw, which would be $4.10. Our initial revenue stream for the customization, $19 added to our user designs will give us a $37 retail. That was a $32 in profit, and that is at 87% margin. For our mass production, we will sell this at $25. That would give us a $21 profit and an 83% margin. Competition. The water bottle company is huge. So, with Camelback, as you see, they have logos. Nothing to do with their caps. Good to Grow is probably, in my eyes, our major competitor because they do have characters, but you will see these at gas stations, and you will see these bottles, which they are disposable, not reusable. Our bottles are reusable sports bottles. You can put them in the washer, the dishwasher, or the sink, and so our bottles will hold 25 ounces, which compared to the 12 ounces, kids go through 12 ounces like it's nothing during sporting events. Collectible market. We would like to try to make this a collectible market. As you see, this Pest candy dispenser, many of you probably out there in the audience today remember collecting these. And they had different characters such as Disney, Daffy Duck, Winnie the Pooh. And we believe if we can get Steph Curry, your favorite celebrities, cartoon characters, we could also make this collectible market. When 3D Buddy Cats becomes successful, we would like to donate some of our proceeds to clean water advocates because clean water is an issue in the world today. So we would like to either work with Charity Water or Water.org. 3D Buddy Cats' mission is to allow our customers to stay hydrated and feel comfortable with our customization caps. Thank you.
Question from the judges?
So you talk about customization. Is this standard products that you think will be attractive to the market, or is there someone can bring in a picture of something and so you can adapt a particular design for them?
So right now there's actually apps in the world today that allow 3D scanning. So we would like to hopefully to work with someone to use those apps, or hopefully I will be able to hire somebody to create that app, and they can either take pictures and send that item as a file, and we'll be able to print it out. Also, another thing I thought about recently is many children love to draw things, and they would love to see those things come true. So if they wanted to draw something, send it over to my side, and I would just basically mimic that drawing.
Do you have that skill set in AutoCAD or whatever it takes?
Yes, sir.
You do?
Yes, sir.
Great.
You just 3D printing the customized caps?
The customized caps will be 3D printed. But for example, the baseball cap that you see, that is, I believe because I've already interest for that cap. So I plan on taking it into Little League games, and that cap will be mass produced. And I'm sorry, I forgot the samples. I always wanted to get a Shark Tank, so I was like, I'll take advantage of this.
So then you're going to do plastic overseas in China?
Yes, sir.
Silicone reusable bottle?
Yes, sir. HDP water bottle.
So when you mention a name like Steph Curry, there's obviously licensing.
Yes, ma'am.
But, so have you investigated the economics of celebrities and sports sports heroes versus, say, franchise things with Disney or movies?
Did you repeat the question?
Having investigated the economics of licensing celebrities, usage from celebrities versus, say, franchise opportunities like Disney or movies tie-ins.
So, when I first saw this idea, I'm a huge Fortnite fan. I don't know, it's a very popular video game, and I tried to contact them, and it was a shot down the drain. So I've really not thought about that at all because I was just thinking. So my user design, the baseball hat, with a baseball bat being the straw. So I thought of that, and I did not want to focus on licensing. That's one of the main reasons I want hopefully one of you to join my team. So I can have some great feedback and experience with getting those license agreements, or even talking to the companies. This has been really hard to try to get a hold of.
Do you foresee you having the 3D printer, or are you utilizing some of the companies out there where you can submit the design and have it printed and drop shipped?
Well, I would like to have my own 3D printer. Also, I go to school in Southwest Virginia, University of Virginia College of Ross, and I have a co-working space lined up, Duffield Pioneer Center, and they are allowing me to use the 3D scanner and the 3D printer. And I would like to throw out some stats. For 3D printing, you have to have stainless steel nozzles that when the filament comes out to make it food safe, which I will plan on doing.
So this material is a food safe material?
Yes, PLA is made out of corn and starch, so it is food safe.
You said you tested, just looking at this, I just know 3D printing, you get a little bit of surface texture and things of that nature. But you
So,
tested it.
to answer that question.
Go ahead.
Sorry. So, to answer that question, I was prepared. There are coatings out there in the world, such as polyurethane and, can't pronounce the second one, excavity, and they will be antibacterial coatings so bacteria cannot build up.
So you put your own straw in here, because that one there has a straw, correct?
Okay, so yes.
This one here has a straw.
The straw will.
That's not 3D printed.
No, sir. No, sir. No, sir.
So when in a market where like everyone's getting rid of plastic straws, and you have this cap, and you're saying, okay, well I still need a straw to put it in here.
No, sir. The straws that we will be applying are reusable straws. For example, Camelback sometimes has the straws that you attach up in. Those are reusable and rewashable, and we will have those, and they have a cap attached so you can close it on and off.
Okay, in this.
Yes, sir. Yes, sir.
Have you thought about making the, orifice and the thread patterns match, Camelback, Contigo, all of the big guys, so that you can focus on what you do, which is, the caps?
So that's another great question. I think it's sad to say that I've been working on this for 9 months, and since December, I've contacted 5 different organizations in the United States, and I just sad to say none of them was willing to work with me about, can I get threading? Can I use your file just so I can see how my cap will fit it? And nobody, and that's when I contacted the people in China, my man Andrew, and he's working with me. We got the bottles ready, we're ready to go. We're missing the startup funds, and we are seeking $27,680, and that's what we're going to start.
How long will it last you?
That will be for the whole year. And then we will have, first year, we will be negative net of $6,000. But second year, we will do $30,000. Third year, $81,000.
And that's using an outsourced 3D printer?
That is including the mass-produced baseball.
Okay. Okay, so you're just looking for $30,000 for the mold, injection mold to make it?
Yes, sir. Beginning of the work, yes, sir.
And what's your sales channel for getting these out to the market?
Well, we will be using our online website, and I'm on my team, I will be attending Little League baseball games, parks, and craft shows, especially for the baseball game.
Are there any approvals
So your plan is to go ahead and anything that you produce that'll be from China, even if you had a 3D printer, you wouldn't source that in the States?
No, sir. So the mass-produced models such as the baseball or the, say, animal, some sort that was really popular, that would definitely come overseas because our prediction is, let's go back to the Steph Curry model. 10,000 kids are going to want Steph Curry, but maybe if you have a child, he's going to want his own user design. So we will have that in state, and mass-produced will come from overseas.
So do you know why, if Mickey and all of these licensed characters already for that one company, why don't kids keep the Mickeys and they're just disposable?
Well, I'm not saying they don't keep the caps. I'm mainly talking about the bottles. The bottles are disposable. So with our bottles, they will be able to put their caps on and off the sports water bottle. And one of the things we have learned through our market research is, for example, if you order just the first cap in your first bottle, if you come back to us, parents will be willing to pay just for the cap itself. And we have been going to ourselves, and we'll be willing to do that. They just want to order the cap and just have one bottle. They'll be able to take one cap, put in that bottle, and so on.
So why not then just focus on the custom 3D printing and stay focused in that space and say, hey, send us your pictures, send us everything. We're going to make you these custom 3D caps for your whatever water bottle, rather than going over to China and doing that design.
Well, the main reason is because, like I said, 3D printing does take a lot longer compared to mass producing. So I could probably make 10 a day, and we do not believe right now that will be enough to actually have a business. It will be more of a hobby, I believe.
So I think piggybacking on that, maybe you could have a website where you would have mass produced where you 3D printed it or mass produced the caricature or whatever it is, and then have a customizable option. But focusing your core value on that unique cap,
yes, sir.
Not necessarily having to solve the entire bottle and cap problem.
Yes,
so
sir.
if there's a drop down where I don't know how many different types of bottles there are, but there's the top 2 or top 3, and then here's what you can get standard and possibly customized for no charge.
Yes, sir.
As a potential. That way you can forget about worrying about the bottle.
Yes, sir. Yes, I see what you're saying, yes, sir.
Yeah.
And to mention that, it's funny because I actually had somebody on Facebook like, if my son wanted to put this on a Camelback bottle or a Yeti, what do you people do it? And I'm definitely willing to do anything y'all suggest. It's just right now I believe that, for my example, how I try to contact companies, nobody's willing to talk to just me.
Well, in that case, I think you can just go buy a Camelback bottle, buy a whatever other bottle, and just product test and figure it out, and forget needing them to help you figure it out. You just need to make it compatible.
Okay, yes, sir.
So what's your marketing plan then for all of this?
Social media, we will, right now I actually have my hospital, so we will try to sell some of our caps to hospitals and, social media ads. Because when I was back at home, hospital came up to me, we'd be going to for example, with the baseball team, put our hospital name on it, just like RHS, and we'll be willing to purchase order, so.
What's the traction on your Kickstarter right now?
We're around $800.
And is it for the full 27,000?
No, sir.
How much is it for?
17. We are really struggling getting it out there. I have no contacts.
Of that,
Not much money.
Of that 17, how much is a 3D printer? Ballpark.
For the 3D printer?
Yeah.
Around 4,000, sir. And because there are cheaper printers, but I wanted to make sure I had the best quality.
Yeah, well, I'm just thinking, again, your core could be, and this is just an opinion, but like one of the other judges mentioned, is that customizable, or with some stock caricatures, but that experience where I don't have the technical experience to go on any 3D website and design what's in my head on the other side. Just use, so that could be that service and having that shipped without needing the
that seems like a way more popular, way in some sort of scalability. You possibly could use some one-offs as examples. I mean, the Steph Curry idea is great, but Steph Curry's probably already doing it if it's that good, or Disney. They'd be a great customer too, but they're outsourcing the same guy in China that you talk to. So, this idea of customizing it might make sense, but in a little bit of a different setting of scalability. I would stay away from the one-offs from my perspective, because I just don't think you can make money on that.
Any other questions?
Thank you.
Our next presenter, Vortex Apparel.
Imagine that you could take your phone, wallet, keys, and other valuables to the beach, pool, or water park without fear of them getting wet or stolen. My name is Alan Sexton, and I worked as a lifeguard this past summer in Ohio at Zambezi Bay Water Park. As a lifeguard, I witnessed firsthand the struggle people have in order to protect their valuables at a water park. For example, let's say you're carrying 3 valuable items on your person: your phone, wallet, and car keys. You have 4 different options. You could spend $10 to $20 on a locker to keep your valuables in. However, this option is not only expensive, you also have no access to your valuables during this time. Or you could spend $15 on a bulky waterproof phone pouch that most likely just fit your phone and nothing else. Your third option is to simply leave your valuables out in the open. Or is to use a Ziploc bag that can rupture, seal it correctly, or can fall out of your pocket while in the water. Your final option, and the one many of us pick, is to simply leave your valuables out in the open and hope that they're still there when you return. Unfortunately, this last option leaves many valuables prone to theft. In fact, my sister's phone was actually stolen last summer when she hid her phone under a towel at Zambezi Bay. After seeing these 4 scenarios happen over and over again as a lifeguard, that is when I decided there must be a better way to store valuables in and around water. That is when I thought about swimming trunks with waterproof pockets, and I created Vortex Apparel. Vortex Apparel is a company that creates swimming trunks with fully waterproof pockets, so you can carry your phone, wallets, keys, and other valuables to the beach, pool, or water park without fear of them getting wet or stolen. After doing further research, I found that there are only 2 companies in the entire world that are attempting something similar. One company in the UK called Aquanadia, and another company in Belgium called Ocean. However, there are several problems with these products. Both Aquanadia's and Ocean's waterproof pockets have only 1 waterproof pocket each. Aquanadia's waterproof pockets are simply plastic inserts that are sealed off by a magnetic strip, which is not only bulky, but also unstable in high water pressure activities such as cliff jumping and water skiing. Aquanadia's waterproof pockets are also extremely small and will barely fit my Galaxy S7 phone with an OtterBox case on it. This is the same problem with Ocean swimming trunks. A pair of Aquanadia swimming trunks will cost you $90 per pair, while a pair of Ocean swimming trunks will cost you $250 per pair, with $35 shipping to the United States. After watching these, swimwear represents a huge market, bringing in almost $21 billion annually. Total water park attendance in the United States alone was 15 million in 2017. Total beach attendance in the United States was 385 million in 2017. There is currently no sustainable, efficient, and cost-effective way to keep your valuables safe around water. That is why I created Vortex Apparel. These large waterproof pockets are made with Gore-Tex waterproof fabric, which keeps the pockets light and flexible. The pockets are then secured with waterproof zippers, and the pocket edges are sealed off with AquaSeal, a liquid neoprene contact cement, which is the same cement used in diving dry suits. But what makes this business qualified to launch this product? As I've stated before, I've first-hand experience with these current market pains. Alexandra Barker has started multiple businesses and is very experienced with startups. Edward Giard was the former Vice President of Licensing and Accessories for Under Armour he's started multiple businesses and has even put one on Shark Tank. I'm also working alongside Mike Lavelle, who is a patent lawyer and has provided me with legal advice and expertise. I believe that my passion and determination, alongside these mentors and their invaluable experience, provides the perfect condition to launch this business. Over the past 5 months since launching this business, I've currently produced 4 pocket prototypes, surveyed over 400 people, launched a landing page, and are currently accepting pre-orders. I am currently working with Clothier Design Source, a clothing manufacturing company in St. Paul, Minnesota. They are working on 3D tech packs and the finalized prototype for this project. The finalized prototype will be done August 1st of 2019. I have a social media manager and videographer lined up in order to get the social media done by May 31st of 2019, and the drone footage in order to shoot promotional videos for a 90-day Kickstarter that will launch August 31st of 2019 to November 29th of 2019. I believe that my experience, my team and their experience, and my mentors and their obvious experience, this business will succeed. Now, any questions? And this is also a prototype that if you guys want to check out.
What's the attorney, how patentable is it? Are you run on that path yet?
Exactly. So that's obviously a great question. So unfortunately, there are no patents surrounding swimming trunks with waterproof pockets. That is actually not a possibility. All patents were filed 27 years ago, so there's currently no way that IP can be attained on that. However, in terms of design patents, that obviously is something that's a little bit different. So that's what I'm currently working on with him. So we're working on heat sealing pocket, that type of design. So there's no way to actually get a patent on the process of the idea, the concept. However, the process can be patented, and that's what I'm working on currently.
Have you worked with any of the fabric manufacturers or specifically to pass it on?
With specifically for what?
Looking for their support on development, backing, obviously.
Yeah,
They want
exactly.
to use the logo, and that's a very expensive proposition.
With the manufacturers?
Yeah, like if you want to use, gore on the fabric.
Yes, so I've actually, Gore-Tex was obviously for the specific prototype. However, I've actually sourced Gore-Tex replica fabric, which is a lot cheaper, and obviously I don't run into the legal side of that.
You talk about advertising for pre-sales. Do you have any pre-sales at this point in time?
Yes, so we launched about a week ago, and we got about 8 pre-sales currently.
What's your target price point?
$85. And with manufacturing in the United States, that's a ROI of 55%. And then I've got manufacturers lined up overseas through Edwards Yard, former Vice President of Under Armour, and that ROI would be 82%, which is obviously above 80% for retail.
What's your long-term distribution plans?
Exactly. So starting off, obviously, with the Kickstarter, a lot of marketing going into that, just through online, through e-commerce. I've experienced on Amazon, sold multiple products on that platform with Amazon FBA. So e-commerce, Amazon FBA, and going into got connections with outdoor areas. So with Zumbizi Bay Water Park, for example, that retail area, I can put it in their retail area, as well as scuba shops, outdoor outfitters such as Cabela's, Bass Pro Shops. So I can go into those stores as well.
If you're in those stores, what do you think that you'd be selling to them at? If you're going to be retailing at 85, what do you see the
I think that would be honestly up for discussion with those stores. So obviously I have to make some money off of it. That's why getting up to the price point of 80%, 82% is extremely valuable.
So the cost on your product is what per piece?
So 82%, it fluctuates with 82% is if I produce 2,500 pieces. So
Locally or internationally?
Internationally.
But your price per piece is what again?
women's swim trunks would be more athletic style, so athletic shorts, shorter, smaller pocket, as well as tankinis with a pocket on the side. Those tankinis actually already exist, but it's not a waterproof pocket. So that's kind of how I appeal to, more the female side as well. And then obviously future initiatives, waterproof pockets aren't actually as much of a thing as you would think. So fanny packs with waterproof pockets and fishing vests with waterproof pockets. That way I can kind of, that multi-generational, as you were stating, just, focusing on the older generation with fishing as well as the younger generation with swimwear.
You have unisex on the fanny pack too, so that's
Yes. What's your funding today?
So funding is actually self-funded through family, through my parents, as well as myself. So I've done about 6,000, my parents have done 5,000.
And what do you need to get a product to market? And are your mentors that you showed, are they committed to coming in as investors?
Yeah, so they have said that they wanted to invest. I've kind of obviously pushed it off a little bit just because we talked about it, and coming to these pitch competitions, I won a pitch competition a few days ago, $1,000, and then just coming to this pitch competition to see what investors would be interested. So they are willing to invest if this will fall through.
How much do you need?
So about $150,000, that'll give me a year and a half runway. That way I can produce 5,000 units. So it'd be perfect for retail, getting into those spaces.
So 5,000 distributed across multiple sizes, or
Yes.
you have to go in manufacturing lots of one size?
Yeah, so that would be 4 different sizes to start out with, 3 different colors, dark red, dark gray, and dark red, dark blue, and dark green. So just to start out with. Edward Yard has multiple experience with colors, and he said those are the 3 most popular colors just to start out with, and then obviously moving into more. So at 5,000 units, that would be $425,000 revenue.
So what do you think is the time to develop the process? These are fundamental prototypes, I would say. I mean, there's a process development, there's automation, things of that nature. Do you have a time frame?
Yeah, exactly. So in terms of time frame, be about 3 months. So just to get that finalized prototype, I'm working with the prototyping manufacturer in St. Paul, Minnesota currently, Clothing Design Source. Just to get that done, that'll take about 3 months, and then I've already got experienced videographers lined up, as well as social media marketers.
You may iron it out in testing, but is this a representative of what you think the possibility is?
So that is a great question. They will actually be heat sealed. So this is obviously great for prototyping. Heat seal this, and it can work. It can be washed, dried, but heat sealing is actually a lot more just safer. And waterproofing rating, IPX, it actually has a higher waterproofing rating to be heat sealed.
It would be a little bit similar to.
Exactly. It would way less, and be less bulky if it was heat sealed. So heat sealing is kind of
shelf technology stuff.
yeah. So heat sealing is pretty much plastic Ziploc bags, dry bags, that kind of technology.
Well, there's the engineering side. Do you want any plans to test it to make sure that the design is durable, rugged enough?
Exactly.
We're talking
So I've actually got
swimming and
so I've been in contact with 2 different companies that do testing for waterproofing. So for example, Aquanautis swim trunks are IPX8 rated, which is 100, or it's below 1 meter. So they've tested up to 100 meters. I've got 2 companies that will test it once the prototype is finished. That way to achieve that IPX8 rating, which is, certified.
Do you intend to also do some consumer testing just in terms of?
Exactly.
usage?
Mostly, yeah, exactly, through your family, friends. That's always important. Sending it out to different people. I've got multiple people lined up. So either through giveaways, just to test the market. So as well as Instagram influencers. Roland Roberts, Dr. Roland Roberts, CEO of Hoverboard. He actually has a radio show, Courageous, gets 250 million views every month. So sending him a pair, we're both Liberty University alumni. So sending him a pair, getting on his show, just marketing it through that.
Any other questions?
If, real quick, if there's any questions on the air bubbles, there are air bubbles coming out of it when it was in the water. So Vortex fabric, real quick, is two-way fabric. problem. So air can actually go out, water cannot come in. So it's a two-way, it's a breathable fabric, usually used in medical devices, medical fabric, but just to clear that up.
Have you done, or data, some of the data on the Gore-Tex side of it, but on your knockoff on washes and heat cycles?
Yes, so I have done testing on these prototypes. Obviously, there would be more rugged testing on the heat-sealed prototypes on August 1st.
Is long-term, is the plan to stay as a garment manufacturer, or are you looking to ultimately find somebody to pick up the technology?
Yeah, so that's actually a great question. The long-term goal would be a pocket manufacturer and a pocket distributor. For example, so if I build this business, basically I will show that, hey, people are interested. Swimming trunks with waterproof pockets actually works. People are interested. Hey, Under Armour, through my connection with Edward Jard, he's friendly with Kevin Plank. Hey, Under Armour, this actually works. I've proven it. Do you want waterproof pockets? And now I'm a waterproof pocket manufacturer. They give me the specifications. I send it over to China. I'm basically the third party for that. But obviously, I can't start out with that business. I have to prove the model first, which is why I'm starting out with clothing with waterproof pockets.
Well, with that, would have thought of licensing. If they're already manufacturing the garment and to get a pocket separately, it seems an additional burden to them.
Yeah, exactly. So Under Armour's actually looked into this process before, but it was just a little bit too much on their plate. So actually Edward specifically looked into this. They're trying to compete with Under Armour and Nike, or with Nike in terms of their athletic wear and their shoes. So they're currently not really focused on this. If I can show that, hey, people actually want this, it works, and then I get the system down of, I've got manufacturers who can build this. It's a 1 to 2 week lead time. How many do you need? What's your specification? Then I can be that third party, that middleman, if you will.
With that IP protection, what's stopping them from just going and doing it themselves once you prove it out?
Yeah, so that's where I'm working on the design patent, because pockets that are heat sealed are the safest. So that's what I'm working on, again, a design patent, and then patent that process.
Any other questions?
There's one final one. It's so for the investors, how do they make their money back?
Yeah, exactly. I think that would be up for debate, whether it's a convertible note in terms of equity, even a loan percentage-wise. I haven't gotten an official valuation, so that would definitely be something to have that conversation with, also talk with my mentors, and then that back and forth. So.
A lot of creative ideas. That concludes this portion of our Shark Tank Virginia. Our next portion, or next category, would be technology, but we're going to take a 30-minute break. And we have food out here. We have food for purchase.
Tacos.
Tacos, yes. We have tacos for purchase out in the lobby area. So we'll see you in about 30 minutes. So I'm going to give each one of you the mic. If you can just introduce yourselves, your name, where you work, and what do you hope to hear out of tonight's presentations?
Hi, my name's Tim Salmier. I own a company called Tigis International. I'm just looking for go-to-market plans, how they expect to generate revenue, and hopefully an idea that I can follow up on.
I'm Colin Wright. I'm COO of Ecolution Services, Industrial Mobile Water Treatment Systems. Native of Richmond, live here in Williamsburg, and graduate of Virginia Tech. I'm looking to hope to see a lot of imaginative and business viable ideas today.
Good evening, everyone. I'm Tim Ryan. I own a company called ARC4. We work with early stage startups and small businesses. Also the director of the Launchpad, and looking to see if we can find a company to run with and see how we can help.
Hi, I'm Matt Tabers. I'm co-owner of Play & Co., which is a premium indoor children's play center in Newport News. And my day job outside of that is I run a business accelerator for the state. And I think specifically today, I'm really excited to see which companies are pushing the envelope, which ones that are not afraid to take on the biggest challenge, and what are their ideas to solve that.
Good evening. I'm Willie Donaldson, and I'm a sort of partially used CEO of about 8 companies, and helped start about 20 others. And I now work at Christopher Newport University. I run their entrepreneurship center and biotech and management program, and just looking for some great ideas and great energy from some investable companies.
Hi, I'm Jeff Johnson. I am the director of the Tech Center Research Park in Newport News with Virginia Tech. We're standing up the research park that you see in the heart of Newport News. And so I'm here actually to identify potential companies that would be candidates that for us to grow and to help grow in many ways, and looking for great ideas and disruptive kind of technologies.
So our first presenter is Tably.
Spread out.
The clicker's there.
For each of the presenters.
Everybody hear me without the mic? Appreciate everyone's time. My name is Brent Dilly, co-founder of Table Lead, Service on Demand. At Table Lead, we are innovating the guest experience by enabling service on demand. And with instant service, we found that guests are happier, they order more, and they post better online reviews. So hopefully we can all relate to this photo. Whether you're at a restaurant or a bar, it's been a long day, it's Friday afternoon, and your first year disappeared on you, and you're ready for the next one. And for whatever reason, for life, you just can't seem to find your server. So we've all been there. I think I was there last night, and we're trying to solve that. So what we found is if you can't find your server for long enough, and you're out to dinner with your wife, boyfriend, fiance, whatever it might be, if you wait long enough, you might not order that extra bottle of wine or those appetizers. You might go online and post a 1-star review on Yelp or Google Reviews, and in cases, if you wait too long, you might just leave. So waiting is negative for all parties involved. So for the guest, it's frustrating. For the server, you're ordering less, you might be upset, that might impact your tips. And for the restaurants, who are our customers, it impacts your bottom line. So the restaurant industry alone, in the US alone, is an $800 billion industry. And what we found with some of our initial customers is that we can provide a 3% profit improvement to those restaurants, which brings $24 billion of value essentially to this space alone. So how are we doing this? And in front of the judges, each have one of our Table Lead taps, which I also have one in my pocket. So one of these would sit on your table, and whenever you required service of any kind, you would simply press the button, a little light would come on, and your server is notified either on our smart wearables, or they can use their own smartwatch of their choice, should they have one. As far as a competitive landscape, no one here is going to be surprised we are in the top right corner of the box. It just happened to work out that way. But essentially, there are 2 different groups of companies that we're competing with as far as table technology space. The one which most people might have seen before is like a Red Robin or Chili's, kind of the iPad-based system. That's a company called Ziosk or Presto. So these groups are, they have a management platform, but they're essentially removing the need for servers, or removing the interaction with servers. Whereas our company, Table Lead, we're trying to enhance the interaction between the guest and the server. And there's a couple other groups doing that, namely CallPod, a company called Waiter Button. But essentially, the difference we have is we've got a management platform that goes along with it, and I'll talk a little bit about that. So we have a patent-pending software that comes alongside our table units and smartwatches. And essentially, what this does is it allows general managers, owners, and operators to assign and reassign table units to server wearables real-time remotely. So if something happens in the middle of a shift, someone calls in sick, whatever that might be, that server is going to need to switch tables. And you really don't that data to drive operational efficiencies and come up with a more profitable way to operate and to satisfy guests more completely. As far as traction goes, we are currently in 9 cities. The company is based out of Richmond, Virginia. We have 30 specific sites that are using the product, 23 of which we've added in the past 8 weeks. So we founded the company last year. We spent the first part of the year with a minimum viable product that the table units hooked directly to the watch. And we realized we had some trouble with our watches that we had to redesign, and that everybody was after the data aspect of it, kind of with the big data revolution. So we took the latter half of last year building out the management platform that we just shared with you in the last 2 screens. And we've since launched 8 weeks ago and added the 23 sites within the last 8 weeks. We're getting traction from full-service hotels, high-end country clubs, specifically for pool and patio service, and then, of course, your bar, restaurant, entertainment space. As far as business model, we're charging customers $10 per table per month plus a hardware installation. Average unit economics are $3,300 per site with over an 80% gross margin. In many cases, we're profitable from month 1, covering the majority or all of our hardware costs upon installation. 3 founders, Wendy, Kevin, and I. I'm acting as the CCO, or the commercial-facing gentleman. Wendy is the primary shareholder and CEO, and Kevin is an investor and a founder, but he continues to have a full-time job, so he's helping us out from a strategic standpoint. We're all engineers. We all have Fortune 100 work experience. I'm from went to school at Virginia Tech, Wendy at VCU, and Kevin did a combination of Duke and Cornell. And now pictured here, we just brought in a 4th partner as a full-stack developer, which is something we've been searching for a long time now because of, as you can see, how much the technology side is impacting the product. From mentors, we've got a number of mentors. The 3 that we want to highlight today. Dave Gallagher, founder and CEO of Dominion Payroll in Richmond, Virginia. They've been on the Forbes top 10 fastest growing companies list for 10 years in a row. Mike Mendelson, finance expert with multiple exits, and then Earl Cox, CSO emeritus at Martin Agency, which is a Richmond-based marketing company. They invented the Geico and the Caveman. We have a partnership with Performance Food Group that enables us access to their trade shows and access to their reps to help broaden our reach. From a go-to-market perspective, we're treating it as a land grab, essentially. We feel like there's a revolution coming as far as integrating technology on the table with the rise of millennials and Gen Z. We think this is a new frontier of sorts, so we're gearing up to get on the tables first with a number of different go-to-markets, as you can see on the left. And then from a technology perspective, we're working on packing as much value into the product as possible, whether that's pay at the table, server app gamification, or Kitchen Connect to try to take it to the next level and notify the server when the food is ready as well. So we're seeing it used as a guest to staff and in some ways a staff to staff. We're also working, we're focusing our time on the restaurants, bars, and hotels, hospitality space, but we're doing our due diligence with a couple other verticals. One is with Hub International. They're a $1 million insurance brokerage. They're trying to correlate tably at manufacturing facilities and whether or not that can lower injury rates. That would help them reduce premiums. And Giant Eagle is one of the top 10 largest grocery chains in the U.S. They're testing out the product for use as a customer satisfaction enhancer where you can get to your employee when you need to find the can of beans or whatever it might be. So I did mention that we are we're primarily focused on the hospitality space. Our goal is to have 300 sites by the end of this year, which would make us a $1 million annual run rate. And so my name is Brent Dilley, this is Taylor Lee, and we are enhancing the dining experience by providing guests with instant service on demand. Thank you for your time. Clock goes fast.
It does. You were right on time, too.
Yeah, sorry.
Who did your development work? Since you just hired a full-stack developer, who did the initial work?
We did a combination of using overseas developers, primarily out of India, and then our full-stack guys coming in, essentially rebuilding the application. We have server apps as well that they download that allows them to receive push notifications, and we did that through a company called Mobilux in Richmond. They built the original Tumblr app, so they're high
So you mentioned a monthly fee. Are you sharing any of the revenue or the additional revenues? There's no revenue share model?
With the
You mentioned that currently the cost to get to market is, I think it was a $10 a month fee for the technology. Are you sharing any of the additional revenues that they're getting? Or is there a revenue share play here?
So we're charging our customers $10 per table unit.
Right.
On an ongoing fee.
Right.
Are you asking for sharing that with?
Are you getting some of their revenue?
Yeah.
Yeah, when they get the 3%
driving
savings.
additional revenues.
No, they're not paying us based on their revenue.
Right.
No. I think at some point, if we do pay the table model down, I think we'll be
Take a
purchasing that credit card kind of
transaction fee or something.
transaction fees, exactly right. And then in that case, ideally, we'd be able to get them the system free and take a portion of that.
So 2 questions. The first one is, right now, in terms of value add, it's just basically notifying the server that you want them. That's what it does today. That's just, it's
from a guest perspective.
From a guest perspective. Okay. And then looking forward, can you really talk a little bit about what you see as additional potential revenue streams and where you see in the revenue roadmap, in your product roadmap? Yes.
Yeah, so we mentioned pay at the table. So we're working with a third-party group that would allow us to put an NFC chip in our product and hold your phone up to it. It launches a browser, and then your API in the POS system you can check out from your phone. So we would essentially take a portion of that. We mentioned the other verticals as a possibility. We've got upsell opportunities with the kitchen product on the core. Those are probably the main additional revenue generators. I think there's also an option to connect sales to our product. So if we can better integrate our product into the API, maybe we put a screen, maybe put a touch screen on it, kind of like a mini iPhone. And if people are actually ordering from the table, we could potentially better connect revenue and take a portion of that. But we're trying to stay away from things that would totally eliminate the server-guest interaction, because that's kind of what the Zeos and Presto guys have done. They've found very good business success.
What's stopping restaurants from having what you are doing part of their own proprietary app? Or is that a challenge or an obstacle that you see as you're moving?
I don't think so as much. So they could have it as part of their proprietary app. You're talking about like a big group like Buffalo Wild Wings, right?
Right.
Yeah, so there's 2 things. One, that app would have to know where you are at the table, right? So either you check in and say I'm at table 2, or you're doing your RFID, Bluetooth mesh kind of deals that are out there to figure out where you are. I think the other thing that we feel really strongly about is it's very hard to get B2C to get people to download apps. For most part, people's phones from a B2C perspective are pretty well full, and we love the idea of everybody from 8 years old to 80 years old understands how to push a button. So I think it is possible for another group to do this. How much success they would have, I'm not sure. I mean, I don't know any personally that has, maybe my dad has the Chili's app because him and my mom are there a couple times a week, but the chances of him opening it up and requesting service from it is small. So we're not really that concerned about it, but it is possible.
How much money have you raised so far?
Right now we've raised $250.
Is that family, friends, or was that official?
We got it. We did 50 through family and friends, and then 200 through our two lead investors. Okay. Or 100 each.
Have you looked anywhere other than in the U.S.? I see U.S. is the best customer service in the world. Europe is miles and miles behind. I see real big opportunity for.
I think so too. Yeah, I think we've got enough to chew on in the U.S., but I think we absolutely see this as a viable option elsewhere. We have a Canadian customer that's a country club in Canada. We've got some interest from at trade shows from Mexico and a couple Latin American countries. But absolutely, I think that Europe is a possibility. One thing we didn't really touch on here is it does make your service staff far more efficient. So it can't be used as a cost reduction tool, especially for the U.S. and high minimum wage states like New York City. So in Virginia, the tip minimum wage is $2.13. In New York City, it's $11.13. So removing the need for one server would pay for the system multiple times over. And I think in Europe, it's more of that model where removing labor would have a major financial benefit.
Did I hear you say you're actually selling the watches? Is that what I heard? And the wearables, or are you going to integrate into my phone or my?
Both. So today you can use, if you have an Apple Watch or a Samsung or a smart wearable that can receive push notifications, the service download our app, they can use their own wearables, but in most cases we're providing the wearable I'm wearing, which is a Fitbit style device. And we do that as part of our hardware deposit up front.
So as part of your customer discovery work, sounds like you have done some. Did you look at the acceptance of this from the server standpoint? I get it from the management standpoint, but so now you got a timer on me. This is the old industrial engineer, so you're okay, you get this.
Yeah, I got you.
Right.
So the guests are all in, the managers are all in because they know what's going on, and the operators are all in because they make more money. The servers are the group that we're having the hardest time getting a full buy-in, right? So we have proven that servers will make more tips with the product, but there is a big brother aspect to it. So we're looking at ways in our onboarding process and our training process to get our message across. One of the things I put on there, we're doing the server app gamification. So if your service times are this, or you get this many steps in, you can collect table leaf dollars, and then once you get to a certain level, you can turn it in for an Amazon gift card or whatever that might be. So we are aware that our most vulnerable position right now is server acceptance. So we're looking at ways to.
So is it much like an airplane where the server has to go and turn the button off at the table?
They do, yeah. We tested, near field type of RFID stuff, and restaurants are so hectic that you get too many false negatives, and then you get upset customers. So we figured we found the only way we could guarantee a server was there was to actually have a server where the guests deactivate the button.
Who do you define as your customer?
Like our early adopters, like our core customers.
One of the things, it seemed like there was a little bit of a disconnect. For your first slide, talked about showed the lady with their hand up in the air, and then you're talking about how the frustration is with that person, but then the rest of the pitch has been geared towards the restaurant owner.
Oh, our customers are definitely the owners. Yeah, the people that are paying us are definitely the owners.
So it just, from the pitch standpoint, to me, it was a little misleading in the very beginning, where I think that the overall problem that you're solving is that restaurant owners are leaving money on the table, so to speak.
Essentially, yeah.
Okay.
Yeah. Fair point on that. Yeah.
I know it's early, but as you segment the restaurants, are you seeing any ones that are more amenable to the sale?
Definitely.
What segments seem to be the most attractive?
So in the hospitality space, your entertainments, like your bowling alleys that have restaurants. If anyone lives in Richmond, I heard Tang Biscuit is one of our big customers. Shuffleboard bar, sports bars, kind of that middle bar and grill zone. The busier, the bigger, and the more alcohol you sell, the more likely you are to be a safely early adopter. That's in the restaurant space. You've got one white tablecloth customer, but I think white tablecloth and like your Denny's Waffle House zone are probably outside of our early adopters. And then you've got your full service hotels and your country clubs, mainly for pool and patio service. Those have been our core early adoption group for the hospitality space.
I know you raised $250 already. Are you looking for more money?
Not current. Like we don't currently need it at this moment. Maybe more.
That's great.
But our goal right now is to get to 100 customers as soon as possible, and then do a more sizable raise at that point, mainly to add technology features and to just staff up on sales.
Is that a break-even point, 100 customers?
No, it's just where we feel like it gives us enough, the valuation, essentially the valuation that we think we're looking for, and to get us the type of raise that we would need to really scale it to the next kind of,
What you said earlier, you pretty much break even after a month.
Yeah, from a cost perspective, we're breaking even on the hardware, but of course we're adding features, and then obviously we're going to be adding sales and marketing efforts too that are going to outrun our customer spend.
Can you talk about the wearable aspect? So is it just via a watch or a Fitbit type apparatus, or is it Bluetooth, head, some type of in a different way?
Pushing it to your wrist wearable if you have it. If somebody has like a next-gen Bluetooth or something like that would be head, or if Google Glass ever comes around, if you can receive a push notification from your phone to whatever it is that you're touching or wearing, theoretically we should be able to send that message there. Right now, this is our actual Fitbit style device that we're providing to servers should they not already have their own wearable. We found a lot of managers have wearables. a shocking amount of servers making minimum wage also have Apple Watches.
Share a little bit. So one of the things that surprised me was you couldn't order from a table. And I understand the logic of differentiating yourself from somebody else, but I'm sitting at a table with my family. I'm ready for whatever. I wouldn't mind ordering it, to be honest with you. Tell me a little bit more about your thought process there.
It's hard and expensive to do because for those who aren't familiar with the restaurant space, like you could throw a rock at a POS company. I mean, there's just Micros and a couple others have dominated the space, but there's literally probably 50 to 100 POS providers. So then you're talking you've got an API into all those groups. And one of the big barriers to entry for an independent restaurant or a smaller group going to like a company like Zios is now they've got to have the beautiful pictures, the menu has to be updated, it has to be correct. So then you're just talking about a whole host of just back-end system things that are just expensive. And
There's probably a threshold, though. You could probably, if Buffalo Wild Wings said, hey, listen, come on in, but we need this, and it's a 10,000 restaurants, I'm sure you guys,
we would say, if you could give us some seed money, we'll happily build it. It's totally doable.
Do they generally have, their POS systems, do they generally have open APIs?
Yeah, I mean, all the POS systems I'm aware of, you can get APIs. Some of them will charge you more than others. Yeah, I mean, Yelp and some of these other companies that we can use to do data mining to reach our customers. You can API in for cheaper, but the POS systems, they want a pretty sizable chunk of change at the initial time.
5 seconds.
What other cities are you in?
We're in Richmond, DC, New York. We've got a site up in Minneapolis, one out in Toronto. I can give you the rest of the list if you need. South Carolina as well.
That's good.
Thank you, Table.
Thank you. Thanks. There you go. Oh. You got your... Yes, what's your...
Yeah, I'll grab my cookies before I forget.
Yeah. Here's the mic right here. Sorry. It's a really good call. Smith.
Our next presenter, Neighbor Force. Oh, do you need the mic?
Yes. Make sure I know how to work this. Oh, that's us. Good evening. My name is Paige Wilson, and I'm the founder of Neighbor Force. Thanks for having me here this evening. I'm going to start by sharing a few numbers with you. 10,000. That's the number of baby boomers that are turning 65 every single day for the next 10 years. This age wave is known as the silver tsunami. America's growing older at an unprecedented rate. In the next 3 decades, there'll be more people over 65 than children for the first time in history. And this bulging group of seniors is going to want to stay independent, stay in their home, and they're going to need support to do that. Today, that support comes from families. But we've got a crisis brewing. Families are smaller, and the sheer number of family caregivers is reducing by half over that same 3 decades that we have the silver tsunami. Add to that most kids have moved away from their parents. 2/3 of them live in a city far away. So if there are no family caregivers, who is going to take care of these, our aging population? It's putting a huge strain on the sandwich population. If you haven't gone through it yet, and you will, you'll see how tough it is. So a couple years ago, I went through it with my mom. She became ill, and she was ill for an extended period of time. I was widowed, I was working on my career and still raising my daughter, but of course I wanted to do everything I could for my mother. She had a lot of medical care ultimately, but still there was a ton that fell on me, and it was very stressful. She ultimately passed away. I went back to focusing on my career, but it just kept nagging at me. And so about 18 months ago, I decided to start seeing if I could find some kind of solution to all this, take some of this stress away. And about the same time, I started seeing some of my friends whose kids were in high school or going off to college, and they were driving Uber. And I said, wait, why are you driving Uber? And they said, you know, my kids are gone, and I'm just craving connection and purpose. but I don't want to go back to my career. These were educated people, and I don't want a part-time job because I want the flexibility of playing tennis when I want or going to the beach or whatever it is. Literally, a light bulb went off. And I thought, you know, maybe the gig economy will allow us to tap into this vast and growing labor force, or I call it neighbor force, of underutilized resources. So that's what Neighbor Force does. Our technology platform connects seniors who need a little help with community members, and we call them neighbors, who are willing to provide that assistance. Who are the neighbors? Again, these are the people that don't want a real job. But they want to feel good about themselves. They're community-minded. They're driven by their heart. What do? Everyday things. Literally, it's like the things the son or daughter or neighbor would do if they were available. We stay 100% outside of the medical world. We bridge the gap between when someone's fully independent and when they start needing a little more formal medical care. We call it the pre-care. Our clients are not at the point where they need that medical yet, but they may need a little help, and they don't like the idea of of a aide or a nurse. So we are trying to own this market right here. Now, that doesn't mean we can't play all along the care continuum, and we do. We often work alongside and augment or supplement the traditional medical care. The value prop, pretty straightforward. Seniors are getting the help they need. Neighbors are getting an opportunity to satisfy that yearning for purpose. But the greatest benefit here is going to the families. They're so stressed. We're taking a lot of stress off of them. We're giving them peace of mind. And what was I going to say? 70% of our clients our bookings are initiated by the adult children. So these are really the people that are feeling the squeeze.
Is 7 or 70?
70. Did I say 7? 70. So addressable market, almost hate throwing this up here. It's too big. The overall longevity market, $7 trillion today and growing along with the seniors growing. So we tried to drill down a little bit and said, okay, let's look at the value of this unpaid care that's being provided for family members. Again, $500 billion today and growing. So we said, okay, let's drill down a little further and just look at Richmond maybe as a proxy. So, and if you can read the small print, feel free to, but we went through an analysis to determine what we thought were the target in Richmond of seniors and started with 100,000. And we said, so if this group of seniors looks for help somewhere, twice a week for 2 hours each. So 4 hours out of the entire week. That's all they're looking for. And it's funny, there's a lot of studies that say 2 visits a week for a couple hours will keep you in your home. Turns out our average client is booking us about 4 hours a week. But no matter, that was our initial assumption. And we get 2% of that. 2. That's over $9 million in revenue. That's just Richmond, just City 1. And by the way, if we do nothing else, in 10 years, that's grown by 40% just because of the demographics. Oh, wrong way. So our revenue model, very simple. We charge a flat hourly rate to the client. We pay a flat hourly rate to the neighbor. What's been great, we didn't anticipate this, but 80% of our revenue is coming from monthly subscriptions, which is fabulous. Obviously, it's recurring, it's sticky, it's scalable. And from a cash flow standpoint, it's great. So we charge our monthly subscriptions at the beginning of the month. The pay-as-you-go clients are billed weekly, and then we pay the neighbors at the end of the month. So the competitive landscape, this whole pre-care notion is really a new and growing subsector, maybe of the caregiving space, which is ripe for disruption. The old line, traditional care models are burdened with cumbersome cost structures, regulatory challenges, and they're really not equipped to adapt to this ever-changing market. So in our space, the disruptive companies like Neighbor Force, Join Papa and the few others that are in there, we are utilizing technology to come up with an offering that can address this new and growing need. Am I on your way? Sorry. And so, you know, it's definitely white space, and I see it with our clients. It's clear that if NeighborForce didn't exist, most of our clients would either go without or they would put more pressure on their families. The traditional medical solution, CNAs and 4-hour minimums and things like that, is not what they're looking for. In terms of go-to-market, well, so right now we're really relying on word of mouth. All of our growth has been organic and driven by referrals. We actually think that because of the network effect, this is going to continue to be a strong driver of both neighbor and client acquisition. And we can talk maybe more in Q&A. Uh-oh, I'm out of time. Didn't look. But we have these other channels. I better move. How did I do that? Accomplished a lot in the last year since, am I out? Since I quit my job.
Yes.
We can talk about it in Q&A.
So 12 minutes of Q&A, judges.
So let me ask you, what'd you do before this?
I was in corporate finance, held a lot of positions in Fortune 500 companies, treasurer, CFO. Most recently, I sold my soul and was an investment banker. See why I left?
Can you talk about how many customers you've had, and maybe as a percentage of those customers, which ones are repeats? You mentioned you have a high number of monthly subscriptions, so it seems like it's getting good traction.
100% repeats. Okay. It's been amazing. So we have about 80 clients now, but 80% of them are regular subscription users. When I came up with the idea, I was thinking people would use us more like Uber here and there, and we do have those clients. One lady called us recently to help her roll up a rug because UPS was coming and she couldn't do it on her own. We get some of those calls from time to time, but 80% of our clients were coming in 2, 3, 5 times a week, usually an hour or 2, 3 hours max. A lot of the home care agencies, people think they want to lump us in with visiting angels and those folks, and we are so not what they are. They have 4-hour minimums, they have contracts, they're using career caregivers that are a different kind of connection that the peers that NeighborForce offers.
What's your subscription cost, and how much monthly revenue are you doing?
So the way our subscription model works currently, it's based on hours used. So our top plan is $500 a month, and that gives you a 20% discount to our standard rate, which is $25. Nobody's using just the 25 hours, but anything over the 25 hours, they get the 20% discount. And almost all of our subscription clients are on that highest level.
Do you convert that? How do you convert that to monthly revenue for the company?
So we launched last September, and first quarter we grew 60% month over month. Our revenue this month will be about $10,000. Our projection for year end, we'd like to say we're going to continue 60% month over month, and we may, by the way, but we reduced that to the low 20s, and at that rate, our run rate in December will be a little over $600,000.
Are you only in the Richmond market?
We're only in Richmond right now.
And I'm assuming you're profitable at this juncture, or?
Cash flow wise. And yes, we did make a profit first quarter, but I'm not taking a salary, so there's that.
Your neighbors, how do you vet them? Do they have to go through a background check?
Yeah, this is interesting. Our neighbors, they're thoroughly vetted. They can apply online. We are operating on an off-the-shelf technology right now that's integrated with a bunch of SaaS offerings and integration, and it works pretty well, but we're getting ready to raise capital to build our own tech, and we've got a partner there. I forgot the question.
Background check.
Yeah, background checks. So I got excited about the tech. Yeah, so they apply online, they are screened, and then they have an in-person interview. That's really the only non-scalable part that I don't think we're going to give up anytime soon. Then they go through. Then they pay a $40 application fee.
God bless you.
Which makes our cost of acquisition for neighbors $0. It offsets the background check. It weeds out a few of the people that we don't want, and it has them skin in the game. I waived that fee before we launched this summer, just to test it, and I was right. We had probably 40% of the people dropped off because they said, yeah, sounds great, sign me up, and then they never were available. That has not happened since then.
How much have you raised so far, and what are you looking for today?
So I have bootstrapped this entirely. I quit my job last April. So there's me, single founder. And there was just an article in American Inno about bootstrapping. And I said, well, I'm getting ready to raise capital. But I really wanted to make sure that this was viable, and certainly we've proven the model. Join Papa, which is, I think you might have seen on the competition slide. They were a Y Combinator company, and they're based in Miami. They've raised a bunch of capital, and they're scaling. They're in about 19 cities in Florida. But here's the thing. They're great, and they've got great tech and smart guys. They're grandkids on demand, which sounds good, and if you go on their website and you watch a video all about that magical interaction, I'm telling you, we've operated for 7 months. It's not the right model. I see what our neighbors are doing with our clients and what the children of the clients are looking for from us. I don't think a 19-year-old could do it. I have one. I don't know how they insure them. How reliable are they? We have, you may have seen, we're 100% on-time arrivals. We've never missed an appointment. Our neighbors are professional people that take it very seriously. And then those kids, they go away once they've graduated. We bring these neighbors on, and they're probably a neighbor until they're a client. And then the natural network effect, the neighbors' parents need us, their parents need us, their friends need us, they're going to need us, as opposed to these college kids who aren't really connected in their communities.
Do the clients get the same neighbors every time?
That's a great question. So the initial idea was Uber, right? As long as you buy into the brand and the model, and that's why we spent a lot of time on that, and two-sided marketplaces, trust is key. However, if they favored a neighbor, absolutely. And so what's happened, and this is great, I've learned so much in these 7 months that are helping us with the user stories and developing our app. If I had built it 7 months ago, it wouldn't work correctly. But for the seniors that aren't that tech savvy, if they've got a regular neighbor that maybe comes 2 or 3 days a week, the neighbor sits down with them on, let's say, Monday and says, okay, well, this week I can't come on Friday. I'm going out of town. Would you like me to come on Thursday? And when they say yes, the neighbor books it. Done. We don't have to touch it. But the clients and the clients' children can book online, and many of them are starting to do that. The subscription ones are easy when they're regular because we just book it and it's recurring.
Do the neighbors have to sign some sort of non-compete or anything?
Glad you asked that question. That's a great question. Everybody's worried about that. Well, here's the thing. So our neighbors don't want to work very much. And that's a tricky part of our technology that we're building. Because they have to give us when they're available. Uber's easy. You turn it on when you're available and off when you're not. Well, I need to know if you're available next Thursday because I'm trying to book something, right? So we're using this third-party app right now that's not that easy to use, but they're afraid to say, I'm available 4 days next week, even though they might be, because they don't want to really be booked 4 days. Right. So our technology is they're going to be able to limit hours and visits. But I'm sure it will happen, and they sign a non-compete. It's part of the agreement. But, there is such a demand for caregivers. What I would say is if you want to be a caregiver, please go do it. I mean, there's a need for that. Just keep in mind that now you are going to have to source your clients. You're going to have to answer to your clients. You're going to have to bill. You're going to have to get your own insurance, and we've got all of that. So I don't see that happening a lot. And in fact, one of the questions when they apply as a neighbor is how many hours are you interested in working? And I've learned if they check as many as possible, it's probably a red flag because it means that they're looking for this job for income. And our busiest neighbors are really working about 12 hours a week. So if somebody's trying to work a 30 or 40 hour, it never would happen anyway. 2 hours here, drive there for 3 hours, over here for an hour and a half. But it's kind of clear that those people are more motivated by the income than the connection.
Are you looking for capital?
Yes. Okay. So
how much?
I'm very, even though I hated the regiment of the bank, I'm very regimented. And so I really was kind of tracking where we are and had said May 1. I wanted to have a team in place, and I wanted to look for capital. So it's happening. Dave, our CTO, I signed him on this week. He's a part owner in the company. He was going to come when we were in the afternoon, but his 5-year-old has a birthday party tonight. He's fabulous, very smart guy, and data is going to be a huge part of what we're doing here. Brian at Ameronix, these guys were introduced to us by Nate Marcus, who's been here before, if y'all know Nate. But they've also invested in the company a little bit, and they are building out our proprietary tech. And then we are in the process of trying to hire an operations manager for Richmond that could take some of the day-to-day off of me as we look to scale.
How much you looking for?
400,000. And that would be team, tech, processes. And that would take us, September of 2020 is when we would turn a full profit, taking that capital in. We don't quite run out of cash with that, so the runway is about the same. Our burn rate's about 35,000. But depending on the investor and how quickly we want to grow, because it's definitely a white space, we would probably do another series before that and really pick up our growth. We've modeled 30 cities in the next 5 years with an average of 4,000 clients per city.
So your burn rate's 35, but you're counting income in there on top of the 400
yes.
to really, okay.
Exactly.
So you're good through next September?
Correct.
How do you do the vetting in your next city? You said that's the hardest part to scale.
Right. So the way, and you know, we've got a couple cities that we've identified, but I think the way we would do it is we would identify, we would call it a neighborhood lead. But there are a lot of people out there that are seeking meaning, that were very well educated, probably a woman more than likely, but not necessarily, who are at that stage that they, again, don't want their other career, but very connected in the community. And I call it a culture carrier. Our culture is so important at Neighbor Force. I don't think we have to pay them a lot, and we can incentivize them. Go to market, since I skipped it, unless somebody has another question, because I think it's important. So we have this, you know, right now it's all organic, but there are all these other channels that could help us accelerate growth and could be potential for exit. Medical side, obviously, all kinds of opportunities there. We're owning the market before they get them. And so we've kind of dipped a toe into each one of these, and I say me, but Partner MD, which is a well-known concierge practice in Richmond, we're in all of their offices. They love our model. I spoke at their wellness seminars, which was sold out for the first time ever. Senior living communities, again, there could be a huge opportunity there for alliances. We've got a number of groups that have us maybe in their welcome package. And I'm going to a conference, one of their highlighted startups. Corporate, oh my gosh, you know, companies are losing so much productivity with their employees missing work, or the new thing is presenteeism. They're at work, but they're making all these phone calls and stressing over their parents. And the number one thing they say they need is resources. So that's another avenue that we could pursue.
What's the exit strategy?
So right now is to build a really good business. We don't want to build it for one of these yet, because I think we want to figure out what's the best opportunity there. But obviously a lot of capital in that space. And the VC world's really focused in this whole senior living, senior longevity space.
Thank you.
Okay.
Thank you, Paige. So our next presenter is Spot.
It's not like any Think Studio platform A Pew Research Center study found that individuality is a key trait amongst this demographic, so it makes sense that they're not interested in touristy recommendations. And last is a sense of privacy and exclusivity. A McKinsey study found that Gen Z prefers to share their more intimate experiences with a smaller group of trusted friends, which explains why they're not using apps that are inherently public and impersonal recommendations. Spot combines location discovery and social media to create a personalized travel platform. Spot puts your friends' recommendations first. So if you were to go to a city for the first time tomorrow, the first thing you might do is reach out to a couple friends or family members. Spot streamlines this process by outlining your friend's recommendations in a different color on the map and showing right away if you have a friend that's been there. Spot's map is also customizable and you can sort and filter right on the map for exactly what you're looking for. Spot offers location-specific content through the digital guest books that I mentioned earlier. So how this works is that if you actually go to a place, check in with location services, you gain access to that Spot's community, and then all the content's been posted there. So there are public and private spots. On the public level, this could be getting tapped into the community, coffee shop or hiking trail, and at the private level, digital guest books can act like a virtual time capsule for you and your friends and family to archive experiences in special places. And lastly, you can save it all and archive it through a personalized profile that's meant to feel like a digital passport of the cool places. Our target demographic is set to become the largest segment of the travel market by 2020. Yet, as I mentioned earlier, they're not interested in the existing options. To illustrate that point a little bit further, you can see here 16% of TripAdvisor's user base is made up of users ages 18 to 34. Yet 62% of Instagram is made up of that same demographic. This is because this group isn't interested in experience-based apps that don't allow them to share those experiences. Spot combines the idea of being able to find something cool around you quickly with peer-to-peer recommendations and social sharing to create a truly differentiated solution. So Spot is also in a great position to take advantage of some upcoming trends in technology. The first of these is that augmented reality can allow us to create a more immersive experience. So Google Maps just released a new feature, or at least announced it, that you can hold up your phone now in certain cities and get turn-by-turn directions through AR. So you can imagine Spot using a similar feature where you can hold up your phone in the city and your phone will come to life with all the different spots that are around you. For example, if there's a local bar that has live music playing, you hold your phone up in the direction of that bar and an animation of a band plays above it to give you an idea of what's going on inside there. Next, we want to leverage artificial intelligence for a personalization platform. We really want Spot to be for travel in terms of personalized recommendations, what Netflix and Spotify are for content. It's really, personalization is a really big gap in the travel market right now and something that could be addressed. And lastly, there's an accessibility play here as well. So as you make these digital guest books more immersive and utilize things like 360 photos and potentially virtual reality down the road, you can give people who aren't physically able to go to those places the opportunity to experience them in a way they never have before. There are a number of potential revenue streams for Spot. The one that we've dove most into and have done the most customer discovery surrounding are targeting small businesses. So the first way we can do this is through direct interaction with the digital guest books that exist there. So Spots here would pay a subscription fee to gain access to posting special deals, content, and events in their digital guest books. And so this would allow them to access users that are already invested in them because they've already checked in there and go there. Next would be to attract new audiences. Spots could pay to highlight themselves on the map. And so this could either be to advertise a special event or just gain visibility. Moving forward, we want to develop an internal marketplace that will allow users to package together kind of a virtual guide of places in a city or area and sell them to other users with Spots taking a transaction. We want Spot to be an app that not only has a positive impact on its users, but on the community as well. And so to bring that vision to life, the focus Next is that spot gives small businesses the opportunity to connect with, like I mentioned earlier, and it also allows users to find local businesses that they might not otherwise been able to. Helping those businesses create those communities that you probably feel some of your favorite local businesses that have been around forever is something that is really hard for them to do early on, especially if they're offering a very Lastly, we want Spot to be the first social media that has a positive impact on 61% of Instagram users use the app for more than 15 minutes a day, so it's having a negative impact on their happiness. Spot will break this trend by focusing on real-world action over scrolling through feeds and looking at other people's lives. Once users take that action, the experiences that they have will also serve to benefit them as well. That's because spending time in nature and being natural ways to positively benefit our physical and mental wellness. So right now, we are in Launch Chapel Hills Cohort 11. Launch, which is a pre-accelerator for the summer. We have a team of UNC computer science students that are building our MVP right now. That's going to be done in the next few weeks. So we're hoping to start beta testing. And we're looking to iterate on our features this summer and ultimately release the first version in the App Store in August or September when students come back from campus. But the plan right now is to build a self-sustaining community of users in Chapel Hill and then look to money for expansion. We're very open to having those conversations now. I'd love to start developing relationships, get to know each other, and then look to eventually raise that money. Yeah, I'm Kenny. I'm an entrepreneurship major at UNC, computer science minor, so I was a building an app before developers. My co-founder couldn't make it today. But yeah, if you're just interested in any way of helping us create this piece of technology, create real world authentic experiences, I'd love to chat. Spot, rediscover your world.
Hey, great job. Good job.
What year are you in?
Kenny,
Oops, sorry.
go ahead. No, go ahead.
What year are you in?
I'm a senior.
When you graduate, what are you going to do?
I had my last day of class yesterday.
What are you going to do?
I graduated 2 weeks.
So you're not going to get a job? Good job.
Good, that's commitment. Kenny, I think the most important slide for me was competitive positioning, because that whole map with the other social Instagram. So there are hotspots and things that are happening. They'll say, "Hey, it's popping right now. This is what's." How are you again differentiating yourself again? I need to make sure I was clear on that. I'm not sure I got that.
There are actually, in terms of the things happening now, there are a lot of competitors. So you have Instagram, Snapchat now has
That's right. Yep.
Spot is more in the lens of TripAdvisor, where things are pretty static. So you don't need a certain amount of daily users to keep things going, because there will eventually be an event side to this. It's more based on places. So it's finding places around you rather than finding what's happening around you.
Okay, yeah, no, it does, right? So now I'm thinking about moat, right? I'm thinking about places like, this is something that's near and dear to my heart, because I'm always going to other cities, and I exactly want to do what you said. I don't want to just go to a regular beaten path, right? I want to do exactly kind of what you said. So TripAdvisor is a go-to, Yelp is a go-to, right? I'm not kind of doing it, but they're very big, and for them to move right or to move closer to your competitive space seems like a major challenge. What do you think about that in terms of competitive positioning?
For sure. So I think that there's the real differentiator, especially I don't think I emphasize it enough, honestly, but private side of spots I think are very valuable. So whereas public spots would be mostly like a very curated list of more local businesses, and kind of like something you could find on Yelp or TripAdvisor if you really dug for it, and it's a more creative list. On the private level, it's like even if you went to say
Mm-hmm.
or just like and then in terms of the public places that your friends are going to, being able to see those right away. And even like Google reviews,
Kind of as a follow-up to that, Kenny, I'm guessing there's nothing proprietary here, so it's really just an execution play in the space. Okay.
So, quick question for you. So if you, oh, please.
so moving forward, I was mentioning personalization platform, and I think that I'm more that like you've gone through things like this, but as you bring on like the technical developing a personalization.
Is the I'm going to bridge off this gentleman here. Is the differentiator really from Yelp? Because Yelp is just this big monster, you know, and you go in and it's everybody and you don't know who these people are. Is the differentiator where it's a group of people that you've kind of cordoned off into a room and you trust each other's input? Is that how it's done? Make sure I understand.
So I think it's created in like multiple senses. The first being the places themselves. So whereas Yelp, like if you go to Yelp in a new city, like sometimes it'll be like a 4-star. I think I guess this is more for like they're trying to push it to, whereas this will be all local businesses. So the businesses themselves are created, and then we imagine this is an app where you have swap of people, like people who actually trust the recommendations. And so then there's also
So will there be negative recommendations too on this, or is it sounds like it's more positive within a personal group, but are you is it open to more negativity and on the recommendations for the local businesses? And then what stops competitors from coming in and maybe seeding some negative feedback to help their business out?
So I think that it's definitely more about experiences so like negative experiences, like right now it's just like a yes or no. But I think that is like definitely a concern moving forward, especially because if you want to have this good relationship with businesses, how do you allow people to get constructive feedback and not have it ruin like their especially new businesses, they get 2 1-star reviews.
Can you talk more on the connection? You mentioned Gen Z and small business. Is that really your sweet spot? And what are your thoughts outside of that? Thinking bigger picture.
So I think that because I think that a lot of things like this will start with the younger, more socially minded group, and then they kind of gradually get adopted. I know my brother's 30 and lives in a city, and like he's been someone who's been like talking to me about this app because it's not their target market because he has the disposable income finally to travel often. He's going to cities a lot of the time with new devices. And I think at that age where people are living in cities, just that can kind of push more. I'm worried about bringing like large chains, big businesses into this, even though it is like a more lucrative option potentially, because I think that it like harness like the type of culture we're trying to create. Which is also why that third revenue model is something that we're really starting to look into now. Is can we create some sort of peer-to-peer marketplace that means that we don't have to directly sell to each single small business. Because that's like kind of the Yelp style. That's part of investing in technology too.
I'm assuming the app is free. You anticipate it being free.
Yes.
And do you see a freemium extension is one question, and then the other is what mass do you need to get to monetize it, to make this a valuable platform?
The first question is actually really good follow-up. Goes along with
Well, so you're anticipating it being free. So is there a freemium version where there are premium features that you can buy into as a revenue stream?
the internal marketplace is not really
Mm-hmm. Well, the second, you're just talking about it, is what mass do you need to get to where you can monetize this? You've got enough of the network effects that you can start doing advertising of the internal marketplace or some way to monetize it.
There's the one route you can go where we can get small businesses like the first time you check into a business, the business owner is part of that.
How many users do you have on the platform right now? I know you haven't hit beta yet, but how many alpha user testers do you have, and how did you go about getting those users?
So we have, I think it's like 60, definitely want to keep it most people reach out to most friends, and then there's like
How are you paying your bills? I mean, you're going to come out of here just a full-time job. You're going to hire a CTO. Where's the money coming from?
There you go.
There's your time. I have a little bit of like a small amount of money kicked in I have a lot of experience.
Can I say one thing really quickly? I wouldn't worry so much. I know you're trying to be very cognizant and think very thoroughly about your key next steps, but almost while you're doing that, it would be really interesting to see, think about it from if it was $1 billion business, what would that look like? Because I think you're thinking about it the right way and being very strategic, and you're trying to, really pick users that are really your target audience. But at the same time, I'm 34, about to be 35. I would use it. And I've got friends that are way older than me. Even my parents that are, baby boomers and things like that. I mean, that would be a target audience too. So, I would just keep that in mind. Even almost work it from the other end of the spectrum. So, because I think it's a really good idea.
Yeah, I'm a little older than he is, and I'd use it.
Yeah.
So there you go.
Yeah.
Kenny, thank you. Congratulations on graduating soon. Our next presenter, River. Did I say it correctly?
Yes and no.
Okay, yes and no?
All good. Good evening. How is everybody?
Good.
My name is Jason Roundtree. I am the Chief Communications Officer of River, and we have George Cumming, our founder and CEO, who is also with us here.
Sorry, Jason, I came in a little bit late because I was working with Richard.
Yeah.
Richard was doing his best using a clunky system.
We were together.
And very typical for anyone trying to offer beverages. He was using a PayPal system, he was processing a credit card transaction, which is going to have a lot of fees.
Yeah, we're here to solve those pain points. We are a mobile payment service for beverage sales, and we are helping both customers and vendors, so the people putting on the events and the people attending events. As George said, I'll give two short scenarios. One is, say, I am an investor based out of DC that comes to this event tonight. I've booked my Airbnb on my phone. I have taken an Uber from my Airbnb here. I maybe bought my ticket to this event online. I see that there's a festival across the street. Fantastic. I'll hit that for a little bit before I come here. All of a sudden, I have to get in line, exchange my money for chips. Hopefully, I have cash. If not, I hope that they take card. Get in the other line after I have my chips, and now order a drink. That's what they were using across the street. We can streamline all of that. And from a vendor side, they're using the chips because they work. You know, if they're using a paper ticket model, you're using it because it still works. But in the back of your mind, you're probably saying, wow, this could be so much better. I just don't know how. That is us. What we do is we digitize the drink tickets, you know, whether it's a chip, drink ticket, whatever it may be. We put it all on the user's smartphone to streamline the event for both the vendor and the customer. This is our biggest problem. We've gone over a couple of them, but at the heart of it, on the customer side, whether or not I am being faced with using a paper ticket, a chip model, or a point of sale system, something doesn't feel right along the way. If it's a paper ticket, I usually have to come into the event, get ID'd, and then from there go into another line to get my drink tickets, and then finally I'll get to go and wait in yet another line to get a drink. That's usually how it is with both paper tickets and the chip model. With the point of sale system, many think, hey, you know, it's better. We've digitized it. We're there. We take card. We have Wi-Fi, all of that. But still, something's missing. A lot of times that's in the person-to-person thing. You know, you can have a great conversation with your server for 15 seconds. You're really enjoying it. You're enjoying the moment. And then they swipe your card on whatever processor they might have. It is usually entirely too slow. You both just kind of stand there. It's awkward. You've killed that mood. And at the heart of what we're doing here, you know, you go to these events, you spend all of this money to have a good time, to be there with other people, to be happy and enjoy yourself. And what we found is that along the way, this is the pain point that takes away from your experience. Everything leading up and everything after this is fantastic. Why are we still, you know, grinning and bearing it and just pushing along? We've created this solution here. And the first solution is it's an easier transaction, just flat out. What we've done is we've actually moved the actual point of sale of you spending money on those tickets to the customer's smartphone. So now it is a lot easier for your users, you know, if you're hosting the event, to get their tickets beforehand, which is pretty spectacular. So once they actually get to the event, you know, they'll still need to be ID'd, sure, but after that, they're off to the races. They've already got their tickets preloaded. All they're doing is using them. Secondly, it's a lower operating cost. It is free for the vendor to use, which I cannot stress enough. It's free for the vendor to use. Free for the customer to download. We make our money off of a convenience fee off of their transaction, which I'll cover in a second here. We offer upgraded security. You know, if you've ever been to an event, anything that offers a QR code, what is stopping anybody from printing 50 copies of that QR code and then selling them outside of a venue? At that point, it's a lottery. You hope you got the first one. If you did, great, you're into the event. If you didn't, sorry, you just got scammed. With our application, our drink ticket does not generate on your phone until you're in front of your server. There's also time-stamped, and there's several other security nets that we've put in there to make it virtually fraud-proof. Upgraded data, which is obviously a huge market. If you are using a paper ticket model, a cash-only bar, a chip model, whatever it may be, you don't really know what's happening at the end of the day. You have a general idea. You don't know what's been pocketed, where this money has gone. All of a sudden, that revenue stream is almost going to feel like a new revenue stream because you're going to have the clearest picture you've ever had to date using our technology of what went in, what went out, and so on, so on and so forth. From the vendor side, you have an extended customer reach. You all of a sudden get to be in another place for your customers before the event even starts. You can advertise, you can put your name, your drink menu, everything out there before your event even begins. You can do a million other things to get out there in front of your customers earlier. And finally, this all culminates in an extended and enhanced customer experience. From the vendor side, you're going to have customers who are feeling better about your event. 320 million people plus a year go to events. And on top of that, about 70% of ticket purchasing is happening digitally. Both of those numbers are only going up. Customers have a very, very large menu of different events that they can go to. The lineups of music events in particular are starting to get very similar. So, event vendors are looking for ways to really stand out and offer that heightened customer experience, and we certainly offer that to them. This is our app preview. It certainly is this simple. It's 1, 2, 3. You pick your event, you purchase your tickets, you get to the event, and that Revere digital ticket right there is going to appear on your screen in front of your server. You swipe it to them, and off you go. Our pricing and sales are thus, we take a convenience fee off of the customer's transaction. It's 3.75% plus 30 cents for each transaction. We've done the math and done the research, and it's pretty much anything under 4% the customer is happy to spend. And on top of that, we have the luxury of having a fairly easy way to articulate our convenience fee, because you're truly going to feel that convenience. You'll be in less lines, you will go through the lines that you need to faster, and you'll get back to what you really came to do quicker. The transactions are made through a third-party credit card processor, which means our vendors will get their money nearly instantaneously. And vendors now have the opportunity to sell and promote before the event, which is obviously huge for them. We've talked to a lot of events who say, I put on fantastic programming year after year. I cannot pre-sell for the life of me. It's a day of decision. Maybe their cost to come in is very cheap. If people come in, they look outside, is it raining? No, I'll go. It's a day of decision. This is one of the many ways that we can help them boost pre-sale numbers, bundle it with, a free drink, whatever it may be. This is a way for them to really sort of sell before the event. And since we've changed the actual point of sale to being when you buy these tickets prior to the event, the vendors are going to have access to more capital before the event starts. These are our competitive advantages. Like I said, we have a lower operating cost. It is free for the vendor to use. It is free for our customers to download. That's going to maximize sales for the vendors, obviously. They're going to be spending less on staffing, point of sale systems, whatever it may be. We're going to be cheaper. It's affordable on both ends that way. And again, at the end of the day, it enables your users to have a better time at your event. So what we've tried to do is make sure that we've streamlined both sides so that both the person putting on the event and the person attending are both having a better time. These are quotes from real people, and we have a multitude of them. So take those in, and I'm going to pass it off to George here for the FAQ.
Judges?
So my first question would be, what stops the vendors from using old tech or continue taking cash that would still slow up the process? Are you all offering this service, but you want to tie them into just this service and nothing else?
The vendors have reached a point of frustration. About 2 years ago, you saw the industry gravitating away from the paper ticket system because customers were so frustrated, which led to them loss of revenue. They switched over to point of sale system, especially at a bigger event. And what ended up is what you have out here. Every transaction, every drink was being run up on a credit card. So they took an archaic system and it came to a screeching halt. Right now, real time, if you're in something in the water in Virginia Beach right now, you have a minimum of a 20-minute line to get a drink. That's probably to go close to an hour by the end of the night tonight. People are seeing loss of revenue. We have a specific example of lock-in where they had 3 different years, 3 different attendants, which ranged at a minimum of 15,000 people, a maximum of 45,000 people. Their beer sales were exactly the same, which means it was a capacity issue.
How does it, so I saw the app, you go in there, what do they scan it with? How do they?
There isn't a scanning, and we've developed a unique use of a technology. So as you approach the table has a iPad on it, which sends out a message of what this table is offering. So you can, a real-time menu pops up on your phone, you make your selection, and you visually pass the ticket off the phone to the server. So it's still a one-on-one connection, an eye-to-eye connection.
Literally just swipe?
You literally swipe it off your phone. On the table is an iPad, which has the mirror image of the transaction on the server side. So in the event, the server turns around getting a beverage, has no idea who flicked the ticket. your picture, your order is on their iPad. The server never has to touch the iPad, so all they're doing is serving drinks.
Very cool.
You mentioned the ID and age issues. How do you solve those?
You know, one of the things that we're smart enough not to do is not to solve that. Most events now are hiring that out to third parties to remove the liability from the event holder. We can do it easily. It's a very, obviously if you order wine online, there's ways to do that. At this time, we don't intend to get in the way of ABC. We've had communication with the chairman of the ABC board, who's also on the national ABC board, to confirm that is a safe method.
Was it actually in production right now? I mean, are you guys using it?
So
Or is it...
we were introduced to the Apple Store Monday.
Okay.
We have events waiting for us regionally. The City of Hampton, the Downtown Development Partnership, is going to use us to run their weekly Saturday event. They also have what was formerly Bay Days, which is now the Pirate Festival, which is a much bigger event. It's a perfect testing ground because they have only been using cash. They've had no inventory system. They've had no idea of how much anything is sold for. You know, at the end of the day, there's a cash box, and that's all they have. So the amazing thing is they're like, let's do it. How can we help you? Can we give you a VIP line? Would you like a table to introduce your product to new users? And we're super excited to work with something like that. We also have a venue in Richmond this summer, a big festival that is also cash. And they're incredibly excited. You know, right now they rely on one ATM machine for everyone that doesn't have cash, and it's become a burden to the customer and to the event.
And you provide the iPads.
We are initially.
Right.
Anyone with an iPad can download the app, and that's a really good question. So when you download the app, you have a phone, it gives you the customers, and if you download the app and you're on an iPad, you get the vendor side. So the vendor can set this up in a matter of minutes with their bank ID.
How long have you been doing this? Where are you located?
Jason and I are the team. We've had outsourced Veracity, which is a company in Richmond that built our MVP, and NS804, who built the final product and the communication between the devices. We have located in Startup Virginia, which has been an amazing resource of people and mentors. We have just gotten 3 interns from the University of Richmond from a grant from the University of Richmond for the summer, which is terrific. We acknowledge 2 things. People do not want to download an app unless they have to. Right. This frustrated audience, if it's an alternative of waiting in line for 20 minutes, we think will download the app. But it's a new use of technology, and we have to present it to people. So our interns are going to be very busy this summer.
Do you cash out at the end of the night, or do you cash out with every visit to
so the actual transaction happens when the customer downloads a batch of tickets. So when they walk into the event, they'll be prompted, you know, I want 5 tickets tonight, it's going to be $25. That's when the real point of sale happens. And then that is just on their phone as a value that they work off throughout the evening.
But you as the seller are actually getting paid when they download the tickets, right?
The vendor and the seller, yeah, get paid immediately when they download the tickets.
How do you handle returns? How do you handle returns or?
It is being done on a case-by-case basis with the vendor. Somebody who has a weekly event wants the customer to walk away, if possible, with $10 in their account, because it would encourage them to come back the next week. If it is a one-time shot, the customer is going to probably just process it back, just like you would in Venmo or another banking-type software.
Is there a gratuity aspect to the app?
Yes. One of the things that's been stressed is most of these servers are volunteers, and they usually come in for charity. It's how they get their ABC regulations. So just when you select your beer, you select your tip.
Clearly you're focusing on drink tickets. Maybe you thought, I mean, it's not a bad place to focus. We thought about other means. Can you scale this to food and other things?
Absolutely. We were approached. We were in an event called Downriver, and a small, I think they're just opening their 2nd location, juice bar came up to us, and they've been frustrated with the rewards program because it seems to just cost them nothing and doesn't improve the customer experience. We got approached by a coffee shop that, you know, they realize that they're right in line with Starbucks. Somebody probably is going to walk by if they have the Starbucks card. It is so incredibly scalable because, again, all you have to do is have an iPad. And we look at Hampton, which has $90,000 worth of sale beer. Not a lot of profit for us. It'd be about $5,000 a year. But we also look at somebody like the Okeechobee Fest, that we went down and worked with them, and they have everything through their point of sale system. Merchandise, t-shirts, sunglasses, alcohol, food, and they do 12 million in three days.
The model's been set up for you. I mean, Starbucks does it now with their app. You know, you go and you charge you have $25 to it.
Right.
You buy something online,
Sure.
you swing by, pick it up, and you move on.
Yes.
And so that there's an existing understanding of how it would work as a consumer. So it's actually not a bad thought.
And your capital so far and/or your ask here, what do you?
So we have spent, and tell me if I'm not answering your question, $160,000 on product development. It's a unique use of technology, and it's been expensive every step of the way. We are in very good financial shape. We are looking to raise money, and it's fairly minimal at this point. We have a $15,000 bill that will be coming in from our developer for building the back office. We have $20,000 in a friends and family note and $30,000 that came off a real estate investment. What we'd like to do, obviously, is get our developer paid, keeps business relationships happy, but to clear out the friends and family note and the real estate so we can start using that as a line of credit for operations.
How much you looking for?
$65,000. And we've
What are you offering for that?
We're looking at a safe type investment where we could secure it for a future value, giving the investor a 20% discount, and the investment could be further secured to real estate.
This goes to the internet. The person's got their phone and iPad. What's the connection pathway?
Excellent question, because it's a problem in the industry. So when you walk into the event, or you may pre-buy them, and you buy your tickets, it is done through the internet. Once you're at the event, it is a one-on-one connection between your phone and the iPad, and that's what's fairly unique about the technology. So, big problem at events, especially larger events, the internet freezes up. Everybody's downloading video, you can't get a signal, and the last thing we'd want is a system to come to a screeching halt. So the transaction takes place between the phone and the table without any internet connection.
What if I wanted more tickets?
It's a couple of different uses of technology. The simplest part of it is low-frequency Bluetooth, which we're all used to using. But we've enabled a sort of a unique product with Apple in particular that allows these two devices to talk.
What if I wanted more tickets while I was there?
If you run out of tickets, you're prompted, do you want to, it comes up as a message and you put a value back on it.
Without the internet connection?
You need the internet connection there, yes.
How do you solve that?
Two things that we want to do in larger festivals. We want to have a place where we're actually boost the internet somewhere near the front gate, somewhere where people are accustomed to waiting in line. And we also want to have a recharging station at the larger stations, because it's a fear of what happens when your phone goes down. Of course, you're not going to get your ride home. You're never going to find your friends. But everyone does have that fear. So sort of having a captive audience at a recharging station is a huge benefit, because they have time to download the app while they're waiting for their phone to recharge.
Good.
Any other questions, judges?
No. Nice job.
Thank you.
Good.
Thank you. So our next presenter, Major Clarity.
Is this the clicker? Hey y'all, how you doing tonight?
Very good. Good.
So my name is Joe. I'm the founder of Major Clarity, and what we do is we help. Oh, looks like some formatting. Okay. Well, we help K-12 schools ensure that every student's education leads to a successful career outcome. And the way that we do this is through an online platform that allows students to actually test drive careers through authentic video and activity simulation content, and then routing that to academic planning, regardless of the career pathway that they might pursue, whether that's a 4-year degree, a 2-year degree, a technical degree, or going straight into the workforce. And before going deeper into what we actually do and our traction and progress, I want to talk about who the people behind this actually are, because it's highly important to what we're actually trying to pull off in this marketplace. So my COO, who I hired this last summer, was the previous VP of Operations for Education Advisory Board. It's a $1.5 billion educational company that does student success services, both in terms of enrollment and retention and graduation for higher education institutions. And our chairman and my lead mentor is John Nestor, who was the CEO of Royal & Company, which sold to Advisory Board and then was split off to become EAB. And he led that to a $850 million acquisition in the space of student relationship building. So long story short, the people who are building this company are the people who have built right now the nation's most successful company in the country at building relationships between students and post-secondary institutions. And all of that work was done within the 4-year educational market space. So they built those relationships for 4-year institutions and 4-year institutions solely and made $1 billion doing it. However, right now, K-12 education is going through a massive alignment shift. And so K-12 for the last 20 years has aligned to college placement and college outcomes. And 49 of 50 ESSA plans for states have included career readiness indicators. All of these K-12 institutions are under pressure to realign their academic planning processes to career outcomes. And the current softwares, the current tools, the current processes are aligned to these college outcomes and aligned with academic planning. And so as K-12 is going through this massive shift, post-secondary is also facing a problem because the company that John and Lauren and many others built facilitated relationships just between the post-4-year institutions and the students. And those relationships were able to be facilitated because of things like the SAT, the ACT, and the PSAT. So to simply boil it down, those tests created a massive database in aggregate that could be used at scale to build relationships between 4-year institutions and high school students wanting to go down the 4-year path. And the other 2 markets were neglected and ignored because K-12 schools weren't aligning to career outcomes. They were only focused on college outcomes. So 2-year and technical schools have no similar infrastructure to build relationships with students at scale. And even more so, the workforce, especially the skilled labor workforce, has no infrastructure to build relationships with these students at scale. And that's because the infrastructure has only aligned towards college outcomes traditionally. And so the way we actually see our company is not about being a K-12 solution. It's about being a relationship builder between students and successful career outcomes. And part of that includes first building the infrastructure within K-12 to make that possible, because that infrastructure has never existed, which is why 2 of the 3 tranches of this market have never existed before. So what does our solution actually do? As I briefly mentioned in the beginning, students log into Major Clarity and can test drive careers through interactive video content with industry professionals and through career simulation activities we build with instructional designers and industry professionals to actually give them a taste or a test drive of what that career pathway would be like. And this is important because it's flipping the script on how academic planning happens at the K-12 level. Traditionally, students say, okay, I'm going to take these courses, here's my GPA, these are the colleges I can get into. Okay, this is what I'm going to major in. And so it's a forward-moving academic planning process. It's 1 step at a time, 1 step at a time. The only way to build an academic planning process that is education level agnostic and aligns to career readiness is to start with the career and work backwards. And so by starting with our pathway content, every student, whether they need a PhD or they're going straight into the workforce, starts off exploring these career pathways. The deeper they get into the pathways, they start identifying the level of education they will need to pursue that pathway. And we port that over to academic planning tools, where we integrate with student information systems at the K-12 level and can start making course recommendations and academic planning and graduation tracking for the students based on where they're actually heading for the career outcome. This slide, this is the deck that we send out and share, so there's a little more text on it, I apologize, but it basically just talks about what I just covered. And so if you look at the competitive landscape, there are a lot of providers who have done academic planning for the last 20 years. Naviance, Career Cruising, Cooter, SchoolLinks is one that's recently jumped up. And they have some amazing academic planning tools. However, they vastly neglect the students who aren't going to college. And we'll even ask that question to schools a lot of times, like, what are you doing in academic planning for the kids who aren't going to a 4-year college? And a lot of times that answer is, not much. On the other side, you have career exploration platforms, but they've never tackled the challenge of academic planning, so they cannot become ubiquitous within a district and actually be used to influence what that district is doing, because all they have is the content. All they have is video content or other things like that, so they're not actually able to influence that infrastructure and the day-to-day processes of that school. We're the only platform that can do the academic planning, the course planning, and the recommendations and data integration, and also starts with a career and works backwards through interactive content. So this is the strategic vision, and the reason we include this instead of just talking about the here and now is because it's really important to us to have people who are aligned in the long haul. We're not, as I've said many times, we're not just trying to build a tool for K through 12 education. What we're trying to do is realign the K through 12 educational system to be education agnostic and only care about placing students into successful career outcomes. And maybe that goes through a 4-year degree, maybe that goes through a 2-year degree, maybe that goes straight into the workforce. But what that starts off with is aligning career and technical education and counseling operations within the K through 12 level. And then from there, it goes into aligning K through 12 education with communities, local businesses, local employers, internships, job shadows, etc., which is the phase we're in right now. And then the third and final phase of that is actually aligning it to the post-secondary ecosystem for all 3 of those tracks. So every student can go into a successful post-secondary outcome regardless of what that track is for them. So talking about the opportunities in each of those tracks, a bottom-up market analysis, not top-down, places $2.3 billion of annual revenue that no one is tapping into right now because there's no infrastructure to connect K-12 students with workplace opportunities. 33% of students who graduate high school don't immediately enroll in college, and another 22 to 23% will enroll in a 2-year or a technical institution. Yet there's no way to build relationships with that 55% of the student market right now, even though many companies are making billions and billions of dollars building relationships with the minority of students. And that's because that infrastructure has never existed.
That is your time.
Okay.
Judges?
So who is your customer?
So we sell to K through 12 school districts, primarily the director of counseling or the director of career and technical education. We built this through a research pilot with New York City Department of Education in 2015, 2016. And in the last 2 years, we've grown to over 200 institutions, serving about 1,200 to 1,300 schools in 17 states. We currently cover close to 2.5% of students in the United States.
Talk about your revenue model.
Yep, so we charge $1.50 per student, annual licensing fee per enrolled student per year. And just this year in the Q1 of 2019, we closed our first content partnership with a Fortune 200 company who has massive hiring needs outside of the 4-year career pathway. And so that's obviously where we're going, but up until now, we've been able to, we finished up 2018 profitable only on the K through 12 licensing, and that's actually the vast minority of the market opportunity.
So the Fortune 200 company you closed with, how are they paying you guys?
Yep, so they're paying us $50,000 a year for a 2-year partnership, and they're co-building content with us. And so it's a win-win-win. It's a win for the students because the content's a higher quality. It's a win for us because the content's a higher quality. And it's a win for them because they're able to start positioning themselves in a way where they can encourage and prompt students to see the value in going into career pathways they're not currently pursuing. And then as that continues to scale, that will be a way for direct hiring and relationship building.
But you still see the revenue out of the school districts. That's where your primary revenue stream is. Or do you
for the next 2 years, and that's really just because we're trying to build up the mass that it will require to build this relationship building ecosystem. But the relationship building market opportunities in the $2.5 to $3 billion a year of recurring revenue, and most of that is without competition. Because this infrastructure doesn't exist, whereas the K-12 licensing market opportunity is 50 to 100 million a year. And so the only reason we're focused on that right now is because that's what makes the real vision possible. We actually started off giving away the product for free to schools for that reason, but when we charged, they took it more seriously and used it more, and we're actually more committed. So we charge because of that reason and have been able to build to profitability despite that.
The thing that concerns me is that I saw a stat, it was something like 30% of the jobs that are in existence today are not going to be existent in 20 years. So, and universities, no offense guys, are really slow at identifying what those needs are 10 years down the road. So what are your plans to speed that process up so that you can bring that to light?
Yeah, absolutely. So that's one of the beauty of the things that we're doing is it can instantaneously realign and redistribute to all of the K through 12 marketplace. And so right now we align with the 79 CTE pathways because it covers everything from biotech to pre-law to plumbing and electrical trades. But those pathways and clusters are constantly being reevaluated. So Virginia just opted into the 17th cluster as well. And so as the marketplace shifts and the pathways and clusters shift, all it takes is on average 2 to 3 weeks to build out content for a new pathway. We get that shipped, and now that's instantly distributed to all of the students using the platform.
But you see that content coming from that Fortune 200 type company that's going to bring that kind of visibility 20 years out. Okay.
Yep. Well, not solely through them. We wouldn't just throw them to the wolves. Like what we pitch it as is we have the expertise of maximizing student engagement and relationships, and you have the expertise on what this job actually looks like. So it is a collaborative effort, but yes, through a collaboration, not just saying, hey, give us the content, because we kind of filter it into the way that we know captivates a K-12 audience.
Joe, tell us about your team.
Yeah, so we started off with me and another young co-founder. We're at 18 people right now. It's about a third across sales, customer success, and engineers, and so developers. I hired my first very senior level professional hire last summer once we grew to over 100 institutions and needed some systems in place, and that was the former VP. She left being the VP of operations of EAB to join as our COO. And we'll be looking after this next round to bring on a senior executive for engineering and sales as well. So the sales and customer success teams are a little more junior. Our director of customer success did have several years of program management at VCU, but our sales team is a little bit more junior and just hustlers. So one of the next steps will be a VP of sales.
And what are you looking for in your next round?
Yep. So probably in the range of 2.5 to 3 million. So I didn't touch on it, but we're about to hit this quarter 1 million in run rate. Our first year we did 135,000. Last year we finished up at a 780,000 run rate in 2018, and we're profitable. And then now that we really feel like we have a system in place, we're in 17 states, we have a lot of opportunity to go deep and go to conferences and branding and all of these other things. We're looking for a $2.5 million round to really hit the gas and to start rounding out our senior management team.
So we've known each other for a couple of years now. What's the single most important piece of information that you've learned along the way to pivot to get to where you are?
How little I know. The more I learn, the less I know is really what I would say. But I would say, yeah, I mean, constantly just having humility and learning from people who are smarter than you is point A. And then point B is not shying away from doing hard things. So we've started hiring former educators because so here's a story of what the power of what we're doing is. One of the schools we're working with, a principal left a $120,000 job to take in. She had been a principal for 25 years. She took a $40,000 base to be a junior level salesperson and start her entire career over because of what she believes will do in education after seeing us work with her school district. And so bringing people like that in and learning from them as much as possible, that's the number one thing I've learned. And I've tried to surround myself with people like that as much as possible, whether it's the execs of EAB or school leaders, teachers, whoever we're hiring for that. They're the experts. What I think I do add is the long game. So a lot of times it's easier for people to get caught up in the short game. For instance, if I was in the short game, I would be totally focused on just building a better academic planning tool. Some of our competitors do have academic planning features that we don't offer, but the whole market's going through this realignment, and having a simpler way to sign up for a course isn't going to help students actually get where they need to go. And so what I try to bring to the table and what I've realized my value proposition is helping people see the bigger picture and step out of the day-to-day, but leveraging their expertise that's way beyond mine to know the day-to-day better.
Joe, have you guys ever considered the experiential dimension associated with mapping academics with careers? Because, of course, as you know, when you're students, you think you want to do this. If you want to do it, it's been tough. We know that when you're an experiential and you get an experience being in a marketing agency, if that's what you want to do, it's very different than the slick graphics and things that you guys can produce. So tell me about that.
Yeah, absolutely. So we started with interactive career simulations and videos because that's shown to increase learning and retention 98% of the time versus just text. And most of what high schools have done has just been text-based descriptions. But the next step is really actually starting to place those. So we're going to be placing 35 to 40 students into internships in the region of Southwest Virginia this summer through a beta of a local employment connections product we're launching that also can do job shadows, speaker requests, things like that. So how we see it is our platform is phase one of 5 feet deep. Then the local employer connections portal is phase two of 15 to 25 feet deep. And then the post-secondary relationship building is phase three of going 50 to 100 feet deep with the students.
And will you integrate that back, what you learn from those, will you integrate that back into the platform to make them more robust?
Absolutely, absolutely. And that's part of why we're starting with content partnerships instead of jumping into relationship building, so we can turn it into an instant feedback loop and actually see how it's changing trajectories and impact.
Good. Excuse my ignorance here. These school districts, they have the budget to pay you?
Yep. So we're because we're only $1.50 per student, most of our fees are under RFP limit except for the largest districts. And we're trying to get a sole source through Henrico right now because that is above the RFP limit. Chesterfield had to go to RFP as well. But yeah, most of it can come out of either the counseling or the CT budget if they want this. And so it allows our sales cycle to be much faster than typical. Our median time to close has been in between 100 and 110 days for the last 2 years.
Is that document really 272 pages?
Which one?
The one we're looking at.
No, I didn't even see the numbers. I'm sorry, my vision. No, I don't know what's up with the formatting. It's 17 pages with 2 appendix slides, so it's 15. It's a PowerPoint, gets messed up a little bit, but yeah.
Joe, are you looking for an institutional round next time, or what are you searching for?
Yeah, so it's really about just finding the right partner, I would say. For me, one of the things that, speaking to Tim's question, one of the things that I've really learned is there is some challenge in what we're doing in the world because it is a long-term game. Like a lot of, even the principal and teacher who I hired are like, yeah, counselors are just thinking about the next step or just this or just a course planning tool. And what we're really doing is going to require changing the mindset of how people look at what the ROI of a K through 12 educational experience is. And we're going to have to convince people of that and sell people on that. So I would say really what we're looking for is somebody who's on board for that and somebody who's not like, because if somebody who just wanted the quickest, easiest path to profitability would come into this business and say, hey, let's raise prices to $215. You're still in line with market pricing. We'll take revenue from 1 million to 1.5 instantly, or 4 million in a year and a half to 6 million instantly, add 30% to the profit margin. But the 10% of deals we lose costs us more in the long term than the 20% price hikes and things like that. And so I'm not saying it's institutions or people. It's about people who understand that the big pie is a little riskier, but 10 times larger of an impact for society and of a monetary opportunity than just looking at this business through a short-sighted lens. Because of the size, I do think there's a chance it will be institutional. We've talked with about 10 VC firms who are interested so far. We just started fundraising about a week and a half ago. Or 2 weeks ago is when we announced to our existing investors. So we raised a $500K convertible note 2 years ago to launch the platform, and then finished up last year profitable and are about to raise this round now.
Are you global?
What?
Global yet?
No, right now we've just been focused on the United States. Canada, there's definitely an opportunity, and I wouldn't be so arrogant as to speak to know anything about the educational climates in Africa or Europe right now. So Canada, there's definitely a lot of similarities and opportunities, but right now our horizon is just US and Canada.
Great.
All right, our final presenter, America's Ticket.
I don't know, can you all hear me? You got a pretty doggone loud voice, so I won't necessarily need that unless that's at the side. Where are we? Right, there's some formatting issues. My name is Timothy Baker. I'm the Ticket. This is my co-founder, Philip Search, and we are here today to talk to you about politics. Well, really, politics, I'm sure we can all agree, is a broken system. Voters are frustrated, they're confused, and we found that 44% of voters are just simply given up. And when we start to look at it, candidates are also challenged because they deal with the high cost of running a campaign and the challenge of getting good data to actually effectively drive it. So what are we left with? We're left with a system that voters have given up. Candidates don't even know what voters want, so things don't ever change. In fact, they're getting worse, and I'm sure you can all be familiar with that process. So America's Ticket is a web platform that compares candidates easily. We remove bias, we remove negative campaigning, and give control back to you as the voter. We also make it easy for any citizen to run for office and not need billions or millions of dollars. And we provide valuable voter data to those candidates so they can connect with their voters. So let me introduce to you America's Ticket. We are a data company. We are always going to be gathering the information, so throughout our site you're always going to see polling, because we want to allow the voters to have the opportunity to express how they feel on topical issues. So when they're ready to explore a candidate, it starts with a quiz. They answer a few simple questions like, do you believe in global warming? And then they're going to be brought into a side-by-side comparison of the top 2 to 5 candidates that actually meet their views. Now, if I want to know more about a candidate, I'm just going to go dive deeper into that candidate's page, but what is nice is that it's unbiased, it is negative-free, so as a voter, I can clearly understand what that candidate stands for. Now, we know that we've just solved the problem for voters, but how have we solved the problem for candidates? First, we make running a campaign or starting a campaign simple and easy, and we don't charge anything for it. So with this, we want to make sure it is accessible for anybody to be able to run for office, and by doing what we're doing, anybody can run, and it gives us all opportunity for more choice in our candidates. So beginning a campaign, just simply a click and you're off and running. Now, we're going to provide those candidates a free website, and we're going to provide them fundraising tools and the opportunity for them to create personalized polling. Now, with the candidates and the market itself, there are other companies out there that are trying to do something. The problem is they're leveraging technology and still trying to use antiquated tactics. So candidates still have to get out there and use numerous sites. They have to waste their time and spend a lot of money. So like with fundraising, they're going to end up having to give away large portions of their donations to the services that they use. And if they want to get data, they're going to have to spend thousands of dollars just to get access to a service that is going to turn around and require them to turn around and do knock on doors just to get the information. So really, is that very much of a success as far as the technology level? I don't think so. So we're actually providing the service to the voters for free, services for the candidates for free. So are we actually making money? We're making money by charging those candidates that are actually interested in running for office. So we start with our first revenue stream, which is around fundraising, because I've just proven to you that's actually a model that works. We're just going to do more for less, and we can do it because we're not like other companies that are reliant just on donations, because we have 2 additional revenue streams. Our second revenue stream is around subscription-based data. So those candidates that want to understand through real-time data what is out there, they're going to pay a monthly subscription fee and have 24/7 online access to either unaudited or broken out systems into a report like you see here. Our third revenue stream is also subscription-based around our polling, that we're allowing those candidates to be able to run personalized polls. Now with this, you do need to understand we have no shortage of candidates in this country, no shortage of elected officials. We probably want better ones, just no shortage. And there's over 500,000 elected officials here in this country, so there are elections going on every single year, all year long, which is great for us. But we also know that in the last few years, 45% of candidates running are doing so for the very first time. So what does that mean in reference to our business model? If we only have 1.5%, 3%, or even up to 5% penetration into that 500,000 elected officials, we are going to find ourselves, we believe firmly that we're going to find ourselves break even next year with over a 40% profit margin, and we also believe there's a 20% upside to this whole endeavor. So we are actually in a very, very good position for you guys to make an investment. Now, why do we believe we can achieve this? It's because of our amazing go-to-market strategy in a 2 marketplace system.
Oh, you're asking the wrong person.
All right,
Who's our tech guy?
local level influencers, and along with that,
It's on blank screen.
Magic.
You're awesome.
Yeah.
Thank you. So on a local level, we're going to work with creating key influencers. We're also going to get localized champions by sponsoring and participating in events that are through universities or different political events, increasing our engagement from the voters. Now, we were launched in 2017, and Q4 2019, we will be launching here in the state of Virginia. 2020, we've got a crazy presidential election campaign coming up that's going to blow up the internet. So guess what? We're launching nationally in 2020. 2023, we will be looking at international opportunities. Our team is made up of myself, CEO, founder of America's Ticket. Previous endeavor was a co-founder with GoGoBand, which actually we will be releasing that product in 2 weeks. My co-founder and CRO is Philip Search, deeply entrenched in the political world, most recently working as a Senate campaign manager and also chief of staff, passionate around the intersection of technology and politics. We have an amazing board of advisors. There's a very small portion of them, but one of them you'll recognize is Nate Marcus. He's the brainchild, founder behind Occasion Genius. He has been absolutely instrumental in the success of our company, and we know that we are uniquely qualified to execute on this and be successful. We are raising up to $1 million with a $25,000 minimum investment on a convertible note with a 15% discount, 6% interest, $5 million cap, and a $3 million floor. Now, as an industry leader in a newly emerging market, we are going to be an attractive company for acquisition by political parties, by private industry like your local media companies, and also by special interest groups like lobbyists. These guys are all going to want to take our technology, keep it to themselves, and use it for their own political agendas. So we know our acquisition opportunities exponentially grow as we gain traction across the United States. I have to thank you very much for the opportunity to share with you how America's Ticket is changing the dynamics of politics, and I look forward to speaking with you guys about investment opportunities and how you guys can join the American Ticket revolution.
Judges?
How do you authenticate each user to ensure that they're real and not bots or people having multiple accounts?
Absolutely great question. We've been discussing that with the company that we're having a conversation with their data. There are definitely some challenges around that, but we have figured out, I believe, a way to have 2 separate tranches. People that have decided to register so that they know they can actually vote, and their vote or commentary will be brought into our data. There's also going to be people that just want to come in and throw some information out there, which is great. We'll take that information, but the data that we're really going to leverage is from people. It could be just as simple as their name and their zip code. It's pretty challenging process, but one that can be overcome.
How do you make money on the first side? There were 2 sides of your business. One was if I want to be a candidate. That was the second one. The other first one was I just want to know if my issues and who my
Voters pay nothing.
so they pay nothing on that side of your model.
No. The voters pay literally nothing to be able to utilize the system. It's the candidates that are going to be running for
Okay.
office that want to get elected.
Okay.
That they're going to pay a percentage of their donations. We're actually charging
I saw that. Mm-hmm.
How do you get all the candidate info? For example, say you have 75% of the candidates that are running in that particular area. What about the other 25%? Are you assuming you can get everybody to use your platform?
That's a really good question. All the information on candidates is out there, so we're able to pull that in. That's pretty easy collection on that. The people that aren't on there are the ones that want to run, just don't know how to go about it or don't have the money to do it. So those are the ones we're going to be having to answer some registration questions. What are your platforms around? So that way we can do some comparison models with that. But all the other information on candidates is already readily available. These are political gurus, pretty much anything politically based.
So here's a question for you. You know, when you hear politics and you hear unbiased, they tend to not go together. And unfortunately, media has killed it for us. How do you get past that? Just with consumers out here, how do you get past, you know, it's easy for you to say, well, we're going to be unbiased, we're going to be unbiased. How do you actually get past that?
Two things, really. The only way to get by it is to avoid having the involvement with people that are biased. Like putting advertising on our site. We're not ever going to do that because that shows we have a bend towards one side or the other. Having certain types of investors. We've been talking to scores of politicians. Many of them love what we're doing, but we're not going to allow any investment coming in from that side because guess what? We take money from the Republican side. All of a sudden we're back towards the Republicans. We take it from the independent side. We're going over here. So it really comes down to the model. Making sure that we are unbiased because as a voter, I hate all the stuff that's going on right now. I DVR stuff because I can't stand the commercials that I see anymore.
So how much have you raised and where did it come from?
You guys are our very first pitch. Very first pitch. We've invested our own. We've put in a few $1,000s ourselves. But we are in discussion right now on one of the larger expenditures, which is the data development. We believe we have a pretty solid agreement there with the trade.
As a follow-up, your co-founder, you said you worked in politics, right? And as a fundraiser, I guess, chief of staff?
Chief of staff, campaign.
Republican or Democrat?
Republican.
Okay, so to his bias question, right? How are you going to overcome that? I mean, to me, I can see the validity of your, what you're trying to do, but that's going to be a question you have to answer. Since we're first, I thought I'd ask it.
No, that's fair. So I wanted to run as a delegate back in the day, and I realized that you either had to have a lot of money, or you had to have real deep inside political influence. And Tim and I sharing our passions for this, coming in from a mindset of, I had my first business when I was 10, and going up through the years. It's this business standpoint, not so much where I stand politically, being that I'm going to be behind the scenes with him. This is going to be open to anybody, Republican, Independent, and Democrat. I'll tell you, what this really is capturing is we really have a two-party system, and this is really allowing anybody in this stage to get on board for actually really no money. In terms of where I stand politically, it doesn't really matter as a founder. My goal is to have everybody. If that's your question.
The timing could be interesting. Obviously, our nation's ripe for something like that to open up beyond the two-party system. We all know that. Whether we're one side or the other, it doesn't matter. It's ripe for some change. Where are you at with the development of the site? Is it just a wireframe concept, and you're looking for developers to build it? Where are you at with it?
Yeah, we are pretty much in a wireframe. The nice thing is with the developers we've been talking about, because we're not getting into crazy data, we are definitely gathering a bunch of data, but we're keeping it in a raw format. So they feel pretty strongly that we can have this all created within about 60 days, more than 90 days.
But when you say that you're going to be using the data from existing politicians, how are you going to avoid the bias if you're using data that's already out there?
We're only using the data from an existing politician to identify what their platform is. We're not going into anything beyond that unless they want to be a part of what we're doing. We're just putting out the platform.
So you're starting from ground zero with data. You don't have any background data that you're...
Correct, and that's all easily accessible. That's what we found out from the political leaders we could do either from the Senate, state level, Senate, or even a couple of congressmen.
One recommendation I would make to you guys, honestly, and you've heard it a few different times, is figure out the messaging on the bias and where you get your data. That's going to be really important as you sell this, because there's just so much skepticism today, and rightfully so. So that would be my counsel to you. Figure out that messaging, whatever it looks like, because as you deliver it, you want to deliver it consistently over and over again, whatever your message is to overcome that objection. And no matter how great the product is, if you can't get past that, you're going to get stuck. Okay.
I'm curious, have you looked into the law specifically? I know one of the pillars of your revenue model is talking about taking a percentage of the fundraising fee for the candidate. So are there laws around that? I mean, it seems like fundraising in general can be kind of a sticky topic, depending on where the money's coming from, how they got it. Could that implicate you if they got that money in a bad way?
That's actually a really good question that I had a lot of concern around when I started first exploring this. There's a company out there, a good competitor, CrowdPack. They are strictly based around that fundraising structure, and they are able to, without any issues of being involved with campaign financing issues, to be able to charge the interest that they are for the fundraising being passed through. It's part of the crowdfunding that's available to be done in politics.
Feels like this market could be a bit choppy. I know you said there are elections all throughout every year, but every 4 years you're going to have a big spike. Every 2 years you're going to have a decent spike, and then in between it feels like there's going to be a bit of a dip. How are you going to smooth that out?
I'm going to tell you flat out, I was blown away by this one, that once somebody starts a campaign, it never stops. Because once they're elected, the very next month, they're out campaigning again for the next election. So somebody that's in this process, somebody that's on our model, has no real reason to stop. And we're not charging a crazy amount of money like they're trying to get out there and spend. One of the apps alone, that one of the candidates we talked to spent $25,000 just for the app, and then turned around and spent $2,000 every month for it to work. So we're in a position that we can make it feasible for them to maintain it. And it only makes sense because it's continuously keeping them up to date in real time as to what's going on with the pulse of that voter.
We never stop campaigning. So Congress, delegates and congressmen, just in Virginia alone, it's a 2-year term. Senators, both state, national, state is 4, and then your national 6. So just with delegates and congressmen, you get in 6 months, you're already starting into the next year. So those who won in 2018, they're already starting to collect money now. This fall, they're already starting for 2020. It never ends.
How do you track that? 1.5% of fundraising. So, I don't know what these guys are bringing in fundraising, but how do you tell, hey, we raised $30 million, I get a 1.5%, or is that just through this site that you are getting 1.5%?
Just through the processing through our site.
All right.
The numbers that we're looking at, like a city level, they're typically raising about $15,000 to $30,000 for their elections. We're only basing it around $5,000. Somebody in the state level, I think you said it was probably how many thousands?
Your minimum on a delegate, you're looking at about $250 if you're serious, up to, I spoke to a good friend of David, who's a Democrat, in Loudon, he's raising about 1.2 as a delegate.
And keep in mind, our numbers on fundraising for that position is $20,000. We are super deflating these numbers because I'm not coming in. Probably one of the biggest things I learned when working with Lighthouse Labs and Go-Go Band is that you do not inflate anything because it's not going to work. People aren't going to believe you. So I'd rather come in, under-expect what we're doing and over-exceed on what we're telling you.
I would think that the analytics is really a really big piece to the candidate and to the party. How does that candidate protect that data from getting out to its opponent?
Well, that's part of the data developer side of things. I'm not going to even pretend that I know all that stuff. But the one thing about the data is if you are choosing as a candidate to run your own personalized polls, that data is owned by you. You're not selling that data off or not making it available to anybody else.
So that's different than the $395 subscription. There was a slide on there that had some analytics.
That's different because that's the secondary side, which is the third, which is the polling side. Secondary is you want to have access to the whole pool of stuff. Here it is. The things that are going to be carved out of that is the people that.
Okay.
Who's doing your development work? Have you picked that person or picked that group yet?
I don't think I should actually share that.
No worries.
And we are
categories?
I think it could be really interesting when you talk about issues, like key specific issues, where do you stand, and making it very black and white, because politics is all about not being black and white, right? It's skating around the question. It's answering a question with another question. So I think there's something there around being very black and white. So whether that's going through a seasoned candidate that when you're doing your comparisons, it's here's their voting record, right? So did Trump vote for abortion, 10 years ago? So I think there's things like that would be really interesting when you're doing a comparison of even candidates that are new versus candidates that are the incumbent.
You just stay on topic because this is such a short period of time. I did not have a chance, and I'm just going to finish this real quick. We did not have a chance to cover the fact that once a person is elected, we do an overlay. So as a voter, I can see, hey, this is what the guy stood for there. This is how he voted. So when it comes around the next election, did he actually stand up for what he said he was going to do? We want to make sure that this is complete. All right, thank you.
Thank you.
All right, thank you to all the presenters and judges. Thank you. I want to bring up right now Elaine, Blake, and Tim. These were all the judges from all the categories to kind of give us your impressions of some of the presenters, the ideas. Come on up.
And while we have this happening, Adam is going to go and get the vote for the overall winner for this category. Now, we're not talking about really a winner per se, but we're really looking at which of the companies that the judges in each of the categories would the judges most likely be willing to personally invest in. So every company has gotten a page of feedback from each of the judges, so that's something that they can take back home with them. But while we are counting these votes, what I'd like to do is recognize somebody that's made a very important impact in my life personally, but also in Ignition, but also in the community here in Williamsburg, and that's Bill Bean. So Bill, can you stand up and... So I don't think that that Bill gets enough credit for the things that he's done in the past, and that's what we're all about here in Ignition, is we are privately funded, we're entrepreneurs ourselves, and we do everything that we can with our free time to help entrepreneurs, and that is really why we put this event together. And so Bill Bean, years ago when I started out as an entrepreneur, before I was even a member of the incubator that he was involved in at William & Mary, he would get meetings and help me have meetings with other clients and other people. Before I was even a member, he didn't ask for anything in return. He didn't expect me to make a payment. Eventually I did, and he led to my first sale, and that led me down the path that really changed my life. So it's people like Bill that makes a difference, and it is stories about people like him that need to be told, and I don't think that he's received the credit and that is due. And so Bill, I want to say thank you for everything you've done, not just for me, but everybody else. So I think you deserve a big round of applause. Thank you for making a difference. Of course. And so now we would like to bring up, do we have the final vote? Tim Samier, can you come up and announce the overall winner? So what we'd like to do is just talk to the judges from each, representing each of the categories. And we just want to hear about what feedback they have for some of the startups and what they thought about the event. It's just going to be a brief, no more than a minute or two. And from there, we're going to conclude with a final closing remark. Thank you.
Thank you, Lance, and thank you for hosting such a wonderful event today. And I'm glad for everyone who showed up. So again, my name is Elaine Horn-Rainey, and I'm the CEO of Timpanogen. I was on the healthcare panel judging the pitches earlier today. And overall, there are a lot of very early stage companies in there, and it really takes a lot of bravery to get up and present your idea in front of a group of strangers. And so I have a lot of respect for the companies that presented earlier today, especially, of course, everyone throughout the day, that as you know, as you're seated, and whether or not you started a company yourself, you know it takes a lot of courage to come up here and talk about your dream in front of a bunch of people. So congrats to them for that. And do you want me to? Okay, so again, all the competitors were excellent today, but the three judges decided that Frog Skin was the best competitor today for the healthcare. Thank you very much. Liked the of course, the technology had a very obvious place in the market. It was solving an obvious need, and you have a lot of really great traction so far. So we have a lot of belief that you will continue your success in the future. So, well, not me personally. I'm not injured right now. So, well, that's actually not true. So, but thank you very much for coming out, and thank you for everyone else who stayed all day today. Thanks.
Hey, Blake Luce, Director of Ferguson Ventures. I was part of the product and construction judging panel. Echoing Lance, great event. This is the second one we've been a part of, and excited about this being a successful third event. Really, the thought is the presentations and the startups and the pitches were well done. So the way that the ideas have turned into proof of concepts and customer validation, and it's more than just a presentation, was really nice to see. There were several, if not all, that already had working prototypes, that already had customers, and were already putting their products into their customers' hands so that they can validate it and they can continue to iterate their product as they go. So that was very exciting to see. I'd like to say congratulations to Babylon Micro Farms, winner today.
Hi, my name's Tim Sommer. I guess I'm humbled, but this is my third year judging, so it's been a lot of fun. I can tell you the first 2 years was extraordinary. This superseded that easily. Not just with the presenters, but the decks, the ideas, where they've come, where they've gone, and where they're going. And so it's been pretty exciting to see this. I'm an angel investor, so I'm here to invest. And there's some people I'm going to be following up with, and I'm excited about these people. The winner for our technology platform tonight is going to Major Clarity.
So you might wonder, what does that mean? Well, first we thought about having one overall winner for everybody. Then we decided we're just going to have a winner for a prize for everybody in each category, but then we decided that we'll give some prizes to actually everybody who participated tonight. So we're going to be giving 3 months of free membership at Ignition Center for the top 3 winners, and then we're going to be giving 1 month free membership to all the other winners. In addition, the Williamsburg Premium Outlets has agreed to, for those companies that have products that want to get their products out in front of customers in a retail environment, what we're looking at doing this summer is providing them with a store that they can actually interface with customers. So that's a great bonus in a way that we're looking to really help entrepreneurs. So more is going to be revealed to the startups next week once we send an email out. So at this time, we'd like to have all the Ignition board members come up and join us up here. Yeah. So these are the folks that give their own time. Nobody gets paid for this. We're passionate about everything that we do to help entrepreneurs and startups. And I wanted to put Bill and Adam on the spot and ask them why they do that.
Why we do that? It's great to give back and help other companies succeed and give them advice of problems that we've all overcome on our own and share that advice. So it's just great to give back and share the experiences that I've had and share some of my background with other people. So it's just really to give back and help others.
And I love startups and I love ideas, and I like to share the experience that I've learned over my 30 years working in both retail and wholesale distribution. And I've got to work with some great companies over the years like Home Depot and Lowe's, and some that are not around anymore, but the great ones are. So it's just about sharing that information.
Thank you very much. Tim and Elaine, do you want to say anything? And it's really about creating that entrepreneurship community, that sense of community. It doesn't matter where you are geographically. Tonight we had startups from Florida, New York, North Carolina. So it's not just Virginia, but we've attracted startups like previous years, out of state, including in a state. So what we're looking for and what we're asking for are, if you are a startup, come meet with us. We'd love to help you. We have a great space. We have a great team to help you. We're also looking for mentors and investors. So if you're interested or you maybe know somebody who is, we'd love to have you join our network. That way we can continue to make a difference. We are working with, we collaborate with Lighthouse Labs and Startup Virginia, and we're open to working with everybody and anyone. And we're really hoping that we can help build a community that collaborates and works together to really make a difference. Finally, I would like to thank our amazing MC, Reba. So, Reba has started a very interesting product which you can read about in your program flyer. And Reba, I just want to thank you so much. You really saved me from really having to find somebody to do this tonight. And Reba is amazing, and she has a passion for entrepreneurship, and she really has a really big heart and really wants everyone to succeed and give back. And I had a great time having a tour at the studio a couple of weeks ago in Richmond, and I got a chance to learn a lot from her and how she's really grown in just the few months that she started her startup in November. So thank you so much, Reba, for everything that you've done for us today. I think it's kind of late here and you're probably tired of hearing me talk, so we're going to stick around for a little bit, for about an hour. You're free to mingle and talk, but other than that, the event is over, and we're going to go get a drink at Greenleaf after this if anybody wants to join. Thanks for coming. Thank you very much, judges. Again, people like you that make a difference, and we hope we can all work together, come together to make this area a better place for entrepreneurs. It's all about the entrepreneurs succeeding, and that only happens if we work together and we put everything else aside and we work together to help and serve them. Thank you very much for coming.
What I do is actually, I'm the complete opposite, so I work for the
This doesn't make much sense.
And I'm a global executive. Another guy.